Hello, all. Just want to let you know we are live on the channel as of this time. So please remember we will go live in another 5 minutes. Thank you.
Board members, it's now 4 p.m. You can begin whenever you're ready.
Do I have a quorum present? One, two, three, four,
I don't see Letty.
yeah, she's there.
Here. Oh, okay.
Dr. Height, you're there. Good afternoon, everyone. We hope you remain healthy and well as we meet today to consider the critical question of how we bring our students, teachers, and school communities safely back together for a new school year. Today marks 132 days since our students were last in school buildings with educators. This has been 132 extraordinary days that have, for all of us, been full of personal and communal moments of fear, innovation, exhilaration, anger, despair, isolation, and unexpected connections. It's an understatement to say this has been a challenging time for our entire school community, our students, families, teachers, and staff, as we all struggle with the question of what it means to provide an education to more than 202,000 students during a global pandemic. On behalf of the entire board, I want to thank everyone across the district for the incredible work you've been doing since mid-March, when school buildings closed and we shifted to online learning. You've been moving mountains, and we all know that this work will only grow harder as we prepare for the new school year ahead. Today's conversation is also going to be hard. We should all be prepared for that. Board members have each been actively watching this conversation unfold as we've participated in as many reopening events as possible and have read the hundreds of questions and comments that have been prepared, pouring in the district since the district announced its reopening plan last week. We've also all members of the Philadelphia community. We're parents, grandparents, friends, and neighbors. Some of us have suffered direct loss at the hands of the coronavirus, and all of us are surrounded by Philadelphia students, teachers, and families who love deeply and have critical hopes and concerns as we approach this new school year. Across these events and outreach, there's some things that are clear. This year is going to be fluid. We all understand that our world has been shifting constantly and rapidly. Our plans must also be fluid, and it must be grounded in our absolute best understanding of health and science. This means we must understand the guidelines our health experts are using to make decisions about health and safety. We're thankful to have the city's health commissioner, Dr. Thomas Farley, here tonight, who will help provide clarity and predictability to understanding what the health experts are monitoring and what rising or decreasing numbers in coronavirus cases will mean for our ability to safely operate in-person schools. It's also clear from your outreach that we all agree that for a large number of our students, virtual learning is a bad option. No matter what programs or plans we put in place, virtual learning is at best a poor substitute for our youngest learners and our most vulnerable learners, such as our students with complex special needs and English language learners. For this reason, we're focused on understanding what health and safety measures must be in place in order to ensure we can bring students physically to school whenever it's safely possible to do so. Finally, we share your anger that this conversation is happening without the resources we need to make decisions our students not only deserve, but absolutely require. The original reopening plan called for fuller in-person learning opportunities for our most vulnerable students, but doing that safely is impossible with our current resources. This is a monumental issue of equity. I therefore end these remarks by outlining two clear things that we can all immediately do to advocate for additional funding to support our students and communities through this year. First, early this summer, Pennsylvania created a new COVID-19 disaster emergency health and safety grant program to provide funding to districts. This program uses an unfair formula to distribute funding. Under the formula that was adopted, Philadelphia receives less than every other district in the Commonwealth based on an average daily membership. If these funds had been distributed using the fair funding formula, the district share would increase from $13 million to more than $14 million, $40 million. Governor Wolf can fix this. The governor has more than $100 million in emergency education relief funds that can be used to make sure Philadelphia students receive their fair share of state funding. Call on the governor today and tell him to use CARES Act governor emergency relief funding to right this inequity and ensure our students have the same opportunities as all others in the state. Second, earlier this week, the United States Senate announced its intention to provide school districts with an additional $70 billion in emergency funding. There's been some indication that the Senate will tie a portion of this funding to in-person instruction. No matter how we open, this funding is essential to keep students and staff healthy and safe for learning when school begins in the fall. We need to make sure Congress includes the $70 billion in education funding in the next emergency bill, and we need to make sure this funding can be used to meet local needs and not put us in a position where we have to choose between the health and safety of students and staff and the financial support needed to keep students learning. We need the entire Philadelphia community to reach out to our senators and congressional members and ask them to provide schools with $70 billion in emergency funding that does not prohibit school districts from making the best decisions for their students and staff. This will help us address local revenue losses, make sure students and staff are healthy and safe, and keep our students learning when they're not in school buildings. We urge you to go to www.philasd.org/fundOurSchools to find contact information for Senator Toomey, Senator Casey, Congressman Boyle, Congressman Evans, and Congresswoman Scanlon. Finally, I'd like to add the board has received calls from individuals across the city for a Black Lives Matter week of action. This aligns with the board's emphasis on equity and anti-racism across all facets of teaching, learning, and operations. Given the urgent nature of this issue, I'll be asking that the board consider this request for a Black Lives Matter week of action in the context of a more comprehensive resolution about board priorities and supporting the district to develop and implement anti-racism strategies that would be embedded in teacher and student expectations in the climate and culture in our schools. While board has been planning to adopt a resolution addressing these issues in December when the week of action would be approaching, the board will dive into this week, starting with our next committee meeting in August, and focus on how our goals and guardrails will advance the work of Black Lives Matter and include the adoption of the week of action. I'll now begin tonight's meeting by asking Vice President Ahea Hinton to make a general announcement for our guests.
Thank you, President Wilkerson. I would like to note, I'm sorry. Thank you. I'm a little lost today. Okay, good evening, everyone. At every board meeting or every Board of Education meeting, a representative from the Deaf Hearing Communication Center is here to provide sign language interpretation of the proceedings. The proceedings of this meeting are streamed live on the internet at www.philasd.org/live, LIVE, and can be seen on PSTV's Comcast Channel 52 and Verizon Fios Channel 20. The proceedings are also being recorded by the School District of Philadelphia. The school district's recordings are protected by the copyright laws of the United States and may not be used in any manner without the express written consent of the school district. By participating in tonight's meeting, members of the public acknowledge that the school district may use its recordings for any purpose without obtaining permission or paying any compensation. Thank you for your attention.
Thank you, Vice President Ahea Hinton. I would also like to note for our audience and for all our registered speakers joining us this evening that we'll be calling our registered speakers in groups of 40 during tonight's meeting. We have over 150 people who've registered to speak. This will allow our staff to better coordinate the technology we're using to conduct tonight's meeting. The list of speakers has been posted on the agenda for tonight's meeting. On the speakers list, you'll find information on each group. If you're speaking this evening, please take a look at this list and note which group you're in. Each group will receive an email approximately 30 minutes before it's time for your group to begin speaking. Please keep an eye on your email and be ready to log into the Zoom platform as soon as you receive this email. Once you've shared your testimony, you'll be removed from the Zoom platform so that we can bring new speakers on. Please note that there is a 2-minute time lag between what you're viewing on our live stream in Zoom. Please keep track of the speakers list and make sure you are by your computer or phone when it comes your time to speak. We're going to take a short break between each group of speakers to allow Dr. Height and board members to summarize feedback and share comments in response to the questions that were posed. I want to thank all registered speakers in advance for your patience and partnership as we coordinate and manage tonight's meeting. Ms. Rout, please make an announcement about the board's executive session and then call the roll.
Thank you, Madam President. The board met in executive session on July 9th for privileged and confidential communications and labor relations issues. On July 16th and 20th for privileged and confidential discussions and discussion of investigations. July 23rd, I'm sorry, that's earlier today, confidential and privileged discussions concerning investigations, labor relations, and quasi-judicial charter school matters. Now for the roll call, Mr. Akbar.
Present.
Ms. Danzy.
Present.
Vice President Ahey Hinton.
Present.
Ms. Fix Lopez.
Present.
Thank you. Mr. Huang.
Present.
Dr. McColgan.
Present.
Dr. MacGyver. Present.
President Wilkerson. Present.
And Superintendent Height.
Present.
Thank you.
Thank you, Ms. Rabb. Board members, before we proceed, may I have a motion to approve the minutes of the June 25th action meeting and the July 1st action meeting?
So moved.
Second.
Thank you. Board members, all those in favor, please say aye.
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 Those opposed? Thank you. The minutes are adopted. We have 3 presentations this evening. These presentations will each cover different aspects and provide different context to the health and safety plan we're considering this evening. To begin, I'd like to invite Dr. Height to begin his presentation on district's health and safety plan for reopening. Dr. Height.
Thank you, Madam President. And I'll ask that the presentation be put up. Thank you. Thanks. So once again, thank you, President Wilkerson, for introducing the meeting and for your comments at the beginning of the meeting. And if we could go to slide 3, please, the next slide. While it's already been publicly announced and discussed, I'm going to start my remarks with a brief reminder of the big picture of our learning model for the fall and how we reached this decision. Planning for the start of school amidst changing circumstances is challenging, and we approach this work thoughtfully, collaboratively with public health experts, one of whom you're going to hear from this evening, but public health experts from the Children's Hospital of Philadelphia and the Philadelphia Department of Public Health. And we did this with an enormous sense of responsibility to our young people, to their families, and to our staff members. Our goal for the first day of school is to transition safely to a hybrid model in which students engage in both face-to-face and digital learning. As we made and continue to make decisions about reopening, we have always had 3 lenses through which we are approaching our work and planning. They are the health and safety of school community members and employees, the academic and social and emotional well-being of our children, our students, and the needs of families and stakeholders. Creating a healthy and safe school environment and work environments and implementing systems to keep our communities healthy and safe is our #1 priority. We're in daily contact with local public health experts and will follow their guidance at all times leading up to and throughout this year. Health and safety requirements will have a real daily impact on our students' lives, and the hybrid learning environment will be new as well. Will also be unfamiliar and challenging for our students and for our staff members. Amidst all of this, it is crucial that we maintain an unwavering focus on students' academic and social emotional needs. Face-to-face, direct instruction promotes student engagement and supports students' emotional well-being. When we can safely reintroduce face-to-face instruction into our students' daily lives, we must do so for our youngest students and those who are most vulnerable and those with complex needs. Balancing all of this against the needs of our families and staff is critical. Childcare needs, access to technology, and other important factors impact stakeholders' wants and needs for the fall. We took all of this into consideration. A huge thank you to the more than 36,000 students, families, staff members who took our reopening survey, and the countless others who contributed through attendance at town halls, participation on advisory boards, and via email, feedback forms, social media. Your input is key to creating a safe and successful reopening of schools. The backdrop of all of this is an unpredictable environment. COVID-19 conditions and guidance from city, state, and federal health authorities are continually and rapidly evolving. With this in mind, we are prepared to be able to flex our approach along the continuum of digital and face-to-face learning throughout the school year in response to changing transmission rates and emergent public health guidance and best practices. We must be nimble, flexible, and responsive every day leading up to September 2nd and every day thereafter. Next slide, please. Let's now take a closer look at what all of this means for students on a day-to-day basis this fall. K-12 students will be assigned to 2 days of face-to-face learning, either on Mondays and Wednesdays or on Tuesdays and Thursdays. We also understand that there's been a lot of talk about the choice of these 2 days versus a Monday, Tuesday, off on Wednesday, Thursday, Friday approach. And that is an approach we're also willing to consider as we think about a hybrid model for our students. Students will participate in digital learning on days when they are not physically in school for face-to-face learning. Pre-K students and special education students with complex needs will participate in face-to-face learning Monday through Thursday. And all students pre-K through 12 will participate in digital learning on the days on which everyone is off, either on Wednesdays, if that's the day, or Fridays, if that's the day. When surveyed in June, the majority of leaders who responded recommended that we implement a hybrid model like this one. And again, I want to thank many individuals for their critical input. Can we go to the next slide, please? We recognize that some families may want their children to continue fully digital learning in the fall. With this in mind, we are launching a digital academy for kindergarten through 12th grade students. Information about and an interest form for the new digital academy launched yesterday. You can read about it on our School Start 2020 webpage, where you will find a digital academy section and a link to the interest form. If you're interested in this option, please note that the deadline to submit your information is August 4th. Students choosing the digital academy option will commit to being enrolled in the program for the first 2 quarters of the 2020-2021 academic year, which will end in December. This is different than what was originally in the plan, which said it would be through the first quarter. The reason we changed this was to have some stability, as the numbers may require, if children move after each quarter, there would be a likelihood that we would have to shift teachers after each quarter. It would be the equivalent of leveling after each quarter, and we did not want to create that level of disruption at every quarter. So we adjusted this to be at least through the first semester. The earliest opportunity to transition to a hybrid model will be during the 3rd quarter in January. The academy is designed to be a as comparable as possible to the daily instruction, but realizing that it is not a substitute for face-to-face instruction. And provided in the hybrid learning model as well. Students enroll in the Academy may continue to receive school-level virtual services and support implemented by the staff at the student's home school. Such services may include telecounseling, teleservices, virtual assemblies, virtual field trips, virtual group activities. Because students opting for the Digital Academy are choosing an entirely remote option, they will not have the option of participating in any of the in-person school-based activities, such as extracurricular groups or scholastic athletics that may meet in person. An extensive list of the frequently asked questions specific to the Digital Academy is available on the district's School Start 2020 webpage. Can we go to the next slide? So as we prepare to start the school year with the hybrid mode and Digital Academy options, we've identified critical implementation steps to safely open our doors to students and staff. Here's a view of what the implementation pathway includes. And under each of these points, there are several milestones. And under those milestones, we're going to make this public, have a public dashboard that gives us information about where we are with respect to all of these issues. Because if these issues are not in place, it will mean a shift in our plan. Some of the steps along the pathway are opportunities to check our readiness. Some represent decision points that may require revisions to the reopening plan. These decision points are indicated with the red dots that you see on this slide. At each step along the way, we will continue monitoring public health guidance and adjusting plans as needed to ensure the safety of our students, staff, community. This includes, if necessary, starting the school year with 100% digital learning due to public health guidance. The next initial step in our implementation plan, as you can see on this slide, is the board's approval of the district's health and safety plan as required by the Pennsylvania Department of Education. I'll talk about this plan more in depth later in this presentation. The next steps include determining the number of students who need devices and internet access and assigning students to whatever days they will be in the face-to-face model. Making every effort to ensure siblings in a household are in the same schedule. We continue to work with the city and internet providers to ensure that all students have access to devices and the internet for digital learning. Following that, enrollment will begin for the district's Digital Academy for the first 2 quarters of the school year. We will use enrollment projections to finalize the Digital Academy staffing plan. Schools are currently developing operational plans in line with the district's guidance that best fit their school and meet the needs of their students. These plans include bell schedules, transportation, meals, classrooms, classroom usage, and more. Each school will submit their operation plan for approval in the next step shown here. The district will then lay out an approach for staffing coverage and filling open roles. Full staffing is critical in reopening schools with a hybrid model, and inadequate staffing will require revisions to the reopening plan. Following the execution of our staffing plans, we will conclude readying our facilities and school buildings and procuring health and safety supplies, including face coverings, necessary cleaning materials, and signage. As we move into the 3rd week of August, we will complete a full readiness check to ensure that we are prepared to open our doors safely. This will be followed by staff professional development, which will take place a week and a half before students return, and include training on health and safety protocols, as well as instructional design. Students and families will also be provided training on health and safety protocols and digital learning resources in preparation for the start of the school year. The district is proposing that September 2nd be the first day for students. I'll review the proposed changes to the academic calendar on the next slide. Our last step, shown here, will continue throughout the school year as we track student engagement and academic outcomes and monitor public health guidance and student and staff safety. To support all these efforts, we are creating a readiness report that will be available the week of August 3rd to help track progress through our implementation pathway. I'd like to reiterate two things. First, the emphasis on health and safety does not mean we're decreasing our emphasis on student achievement. Instructional rigor, high quality teaching, and academic supports remain crucial components of the 2020-2021 school year. Social distancing protocols, hand sanitizer, face coverings are critical to a successful school year as well. So are engaging lessons, standards aligned curricula, and social and emotional programming. Second, while we have a concrete plan for reopening our doors at the end of August or the beginning of September, and while that concrete plan is in place, we have to remain flexible. If public health experts tell us it is no longer safe to open, we will not do so. Next slide, please. Tonight, the board will be voting, or we're asking the board to be voting on proposed changes to the school year 2021 academic calendar made in response to the need for additional professional development for teachers as they prepare for face-to-face and digital learning in this new hybrid environment. Pending its approval, the new first day of school for students will be Wednesday, September 2nd. This is pushed back from Monday, August 31st. This change will allow for 2 additional professional development days for staff, for a total of 6 full days of professional development and 1 day for reorganization prior to the start of school. As a result of this change, several other changes had to be made to the academic calendar to ensure both students and staff are participating in the correct number of school and work days. Those are General Election Day, Tuesday, November 3rd, was formerly a full day of professional development for staff and a day off for students. If the changes are approved, teachers will also have the day off on this day. Wednesday, December 23rd was formerly a day off for all staff and students as part of winter recess, as was Friday, February 12th for the Chinese Lunar New Year. School will now be in session on both days for students and staff, but students will have a 3-hour early dismissal on February 12th. School was previously supposed to be in session for all students and staff during the state's primary elections, tentatively scheduled for Tuesday, May 4th. This day will now be a holiday for all students and staff. Next slide, please. I'm now going to move into the district's PDE required health and safety plan, which we're asking the board to take some action on tonight. Next slide. The district's health and safety plan is required by the Pennsylvania Department of Education and must be approved by the board. PDE required that the plan be created by a cross-functional team and that it includes detailed plans across the state's broader color-coded reopening phases, as well as necessary resources, materials, and professional development. PDE also required that the plan be tailored to the district's unique needs and that we post the final plan to our website. To the right side of the slide, you can see an example of what PDE asked the districts to provide. Next slide, please. The plan covers 9 components, and I'll walk through them one by one. The first component is our decision on how to reopen, including how we obtain feedback around this decision and our anticipated start date. We'll be covering this in detail in other parts of tonight's presentation. Next is the makeup of our pandemic team, which includes 49 individuals across levels of the system, all levels of the system, central office administrators, Department of Public Health officials, assistant superintendents, principals, and parents. Team members have defined roles and responsibilities for health and safety preparedness and response planning during the phased reopening of schools, such as development of the plan itself or decision-making regarding response efforts. The third component is our concrete plans for cleaning and ventilation, including the disinfecting of high-touch areas several times per day, the use of electrostatic backpack sprayers to capture all areas, the installation of hand sanitizing stations throughout the district, the monitoring of ventilation systems, and the removal of water fountain bubble heads from water fountains so that they can only be used as bottle filling stations. Next slide. Next is our plan for social distancing and other safety protocols, which limits the number of students and staff allowed in each classroom, covers the reorganization of classroom space to support distancing, and restricts access for non-essential visitors and volunteers. The fifth component is how we will monitor student and staff health, including the requirement that employees and families self-monitor for symptoms. The next component covers other considerations for student and staff health, including the requirement that all students and staff wear masks or face shields. This part of the plan also covers our approach to developing our available staff to ensure that all students have access to quality learning opportunities that meet their unique needs, such as case managers working with families of students with IEPs to determine the best environment for them prior to the start of the school year. Additionally, it covers our Healing Together initiative, which is designed to address the needs of our students, staff, and families in the wake of the sustained trauma of both racial injustice and the coronavirus pandemic. Healing Together encompasses an intensive focus in 4 areas: mental health and trauma, social emotional learning, relationships and community, and adult wellness. Next slide, please. The 7th component is our professional development plan, which lays out 1 PD session required of all staff and 18 additional unique PD sessions specific to a variety of audiences, including families, food service employees, bus drivers and attendants, school leaders, nurses, assistant superintendents. They include not just health and safety PDs, but also sessions on instructional design in the new hybrid environment, and sessions specific to the needs of unique learners, such as our pregnant and parenting students. The next portion of the plan is our phased communication plan to keep families, students, staff, and the broader community informed of and engaged in the district's health and safety plans. Strategies and methods include our dedicated School Start 2020 webpage and FAQs, engagement with a principal advisory board, and virtual town halls with both staff and the wider public. The final component covers our hybrid approach to elect core services, which are our services offered to pregnant and parenting teams. Elect programming will be implemented in a hybrid model with some virtual and some in-person services. Community and home-based supports will continue where possible. Can we move to the next slide? I'm now going to cover how we collected feedback on the plan and the most common questions we've received about it. So can we move to the next slide? As we prepare to implement our reopening plan, we continue to welcome and receive input, feedback, and questions regarding the plan through a number of different forums. We've conducted a series of engagement and feedback sessions with internal and external stakeholders, including City Council, faith leaders, local public education advocacy leaders, the congressional and PA delegation, and the philanthropic community. We also collect feedback via my weekly Facebook Live events. Thank you for all of the questions that we received during those events, which will continue to be held every Wednesday at 3 p.m. We're in the midst of hosting town hall sessions with employees through late July. Finally, we're continuing receiving feedback and questions via the online feedback form on our website from principals and the Office of Schools and via emails and social media. We will also be administering additional surveys to families, students, staff, and community members to gain feedback before and after school starts. Surveys are currently scheduled for August and then again in November. Questions received across all forums are shared with workstream leads for additional planning consideration, and answers are continually added to our online FAQs, which categorizes them for reading and search convenience. Categories include general safety protocols, cleaning protocols, curriculum, social and emotional supports, family supports, staff supports, and many other areas where we have categorized all of the questions and responses. Next slide, please. I want to take some time to dive into some of the most common FAQs to ensure that families and staff have the answers that they need. Many families are wondering how they will find out what days of the week their children need to report to school. Schools will be determining scheduling and will contact you with your child's schedule. Additionally, schools will make every effort to ensure siblings in the household are on the same schedule unless advised otherwise, even if they go to different schools. We will use the contact information we have on record to do this, so parents, please ensure that your children's contact information is up to date and accurate so schools can identify students who live together. Families and staff have also asked whether staff and students will be required to be tested for COVID-19 prior to the start of school, and whether daily temperature checks will be conducted. The answer to both of these questions is no. The CDC and the Philadelphia Department of Public Health are not currently recommending widespread testing prior to the start of school. Additionally, we will not be requiring temperature checks upon entry to school. Instead, staff will need to complete an online pre-entry screening form to verify that they are symptom-free and have not had recent exposure to someone with COVID-19. Families will be required to use a pre-arrival screening checklist to conduct a daily screening of their children before they leave for school, including taking their temperature. If the statements on the pre-arrival screening checklist are true, the family must keep the student at home and contact the child's or the student's healthcare provider. By completing this assessment at home, we can avoid students and employees with fevers traveling to school and interacting with others along the way, reduce the risk of a lack of social distancing while waiting in line for a temperature check. And at the start of the school year, families will be required to sign the COVID-19 School Health and Safety Agreement, which describes their commitment to keeping their children at home when their children are sick. Stakeholders also have asked questions about masks. All students and teachers will be required to wear masks. Students will receive disposable masks or can choose to wear their own. Pre-K through 5 students and students with special needs will also receive face shields. All staff will receive reusable masks as well, and some staff members will receive additional disposable masks or face shields depending on their roles. For example, pre-K through 5 teachers will receive a weekly supply of face shields, and nurses will receive a weekly supply of both disposable masks and face shields. We've also received many questions about what will happen if a student or staff person tests positive for COVID-19. We're currently working with the Philadelphia Department of Public Health to develop a clear protocol for these instances. Once developed, these will be posted on our website and shared with our staff, families, and students. Can we go to the next slide, please? I'll be concluding my presentation with an overview of the district's return to play plan, which the board will be voting on tonight. This is our plan for safely resuming athletics in a 3-part phased-in approach. Phase 1 would be individually based, with attendance limited to participating student athletes and coaches in accordance with city orders. The focus would be on engaging our coaches and students, establishing routines, communication on COVID-19 health and safety protocols. Phase 2 would be small cohort based, with attendance again limited to participating student, athletes, and coaches. The focus will be on small group programming and introducing the sharing of equipment in a safe and healthy manner. Phase 3 would be the resumption of full team practices and ultimately competition pending city guidelines. The focus would be on safe and healthy competition. Spectators would be limited to essential personnel required for game operations until limitations on large gatherings are lifted. Phases 1 and 2 will be limited to the students who are attending school on a particular day within the established cohort hybrid model for school reopening. For example, on Mondays, only students who attend school in person on Mondays would be able to participate. The plan does not have specific dates, as any movement between phases would have to align with the city guidelines and state and local orders, and may have to be re-implemented at a later time in the school year. In the event the fall season or any season thereafter is postponed or canceled, virtual programming will be developed and implemented to continue engaging student athletes and coaches and preparing them for post-secondary readiness. Discussions are ongoing with the NCAA and other national governing bodies on resources for virtual programming. Madam President, this concludes my part of the presentation.
Thank you, Dr. Height. We are lucky to be joined this evening by Commissioner Dr. Thomas Farley from the City of Philadelphia's Department of Public Health. Commissioner Farley has been working tirelessly on behalf of our city to ensure that the very best science is in place to guide the decisions that are being made about the health and safety of Philadelphia residents. Tonight, Commissioner Farley will discuss how these decisions impact the ability to have in-person education and will speak to some of the health and safety components of our plan. Commissioner Farley will also help us understand what we can all expect regarding decisions on school opening virtually or in person. Welcome, Commissioner Farley. Thank you for your work and thank you for being with us today. Please start.
Thank you very much, and thanks for the chance to address the board. I'm here today with Dr. Stacy Callum, who is our director for the Division of Maternal, Child, and Family Health, who has worked to develop our guidelines for schools across the city, and has worked with the school district in developing their plan. I'm going to just start with a brief sense of the context here, give you a picture of where we are with the epidemic across the country and locally, and then talk about our role and how we interface with the school district so far and how we will be doing that in the future. So if you go on to the first slide, this is a graph of that sort of gives you a picture of the epidemic. It's the number of cases we've had diagnosed by day, and by test result from the beginning of the epidemic until now. You can see that we did have a major peak in the epidemic that peaked around mid-April, at which time we were diagnosing about 500 to 600 cases per day in the city in Philadelphia residents. This was at a time where we were testing about 1,200 people per day. Since that time, the epidemic has subsided substantially. We're now diagnosing a little more than 100 people per day. And that's a time where we're testing about twice as many per day, now about 2,500 per day. For those of you who've paid attention to the press conferences in the last couple of days, we have seen what I've characterized as a modest increase in the past few days, which we'll have to keep an eye on, but I don't think that changes our overall perspective for where we are in the epidemic, that it's still there, but much lower than we were at its peak. Next slide. This gives you a sense of where this epidemic is in the country at the moment, because the epidemic changes very quickly and it changes quite a bit in different regions of the country. This is a graph from the map from the New York Times, and I apologize it doesn't have a legend on it, but what it's graphing is the case rate over a 7-day period for the most recent 7-day period by county. And those counties that are red have very high rates. Those counties that are yellow have lower rates, and those counties that are gray have very little disease at all. As you can see, the epidemic is heavily concentrated in the south and in some areas of the west. It's got lower rates in the northeast, which is the area that had the worst part of the epidemic back in April. The next slide gives you a sense of how this plays out then at the city level. So what I'm showing here is, it's actually mislabeled, it's the 7-day total number of cases per 100,000. So it takes into account population. And it compares Philadelphia to a number of just selected cities across the country to give you a sense of where we are in this. So our case rates are higher than that of New York City. And New York City was hit harder than us at the beginning of the epidemic, but at the moment they have lower case rates than we do. Our case rates are very similar to that of Chicago and Washington, D.C. They're lower than that of Allegheny County, where Pittsburgh is, and they're substantially lower than those cities which are in the south or in the west, as you can see, Los Angeles and Miami, which has a case rate which is 10 times where we are. So as we're looking at this, I would characterize this that the epidemic is still here, but it's substantially lower than it was before. And looking at this information and the additional information that Dr. Callum is going to present in a minute, we do think the schools in Philadelphia should open up for on-site instruction this fall. Dr. Callum will give you more details on our thinking behind that. But it goes back to the recommendation balancing the risks of COVID, which are genuine risks. They're not zero. We acknowledge that. With the alternative risks, particularly for children who have fewer resources, of not receiving a quality education. We do think that in-person education is a higher quality than digital education. And we do have quite a bit of concern that if children fall behind in their education during crucial years, they may never catch up, and the consequences of that are lifelong. So as we look at those two risks, we do think on balance that education in person can take place this fall. At the same time, we acknowledge that there's uncertainty about the trajectory of the epidemic and the amount of time and the amount of spread that could occur in schools. And so our recommendations that we're making today are our recommendations now. Those recommendations could change. Assuming that schools open, as according to the plan here, we'll need to monitor very closely what happens in schools, whether there's spread within schools, and whether what happens in schools has any impact on community-based rates. Now, if you go to the next slide, I'll give you a sense of the role of the health department so far and in the future. So the health department, the Philadelphia Department of Public Health, has established standards and guidance for all schools. That includes the School District of Philadelphia, but also private schools, other schools that are in the city. Those standards and guidance were developed in large part by Dr. Callum, who is currently a full-time member of the Department of Public Health, but is a pediatrician and was a faculty member of CHOP. And she worked with another doctor, Dr. Susan Coffin, who is a pediatrician and infectious disease specialist who works jointly with CHOP in the Department of Public Health. So we really tapped into the best expertise we have in children and in infectious diseases. That we developed those standards and guidance. And then at the same time, we provide a consultation to the school district administration as they develop their plan for the year. That consultation with the school district administration will continue throughout the school year. At all time, our experts are available for consultation, and our experts will be monitoring the situation and making decisions on changes as appropriate. In addition to that, the Department of Public Health is taking on the task of contact tracing for confirmed cases of COVID-19, regardless of where they take place in the city. That would be for any adults anywhere, that would be for children in the school system, and we're providing specific information for 2 people, including students and staff who might be exposed to a COVID-19 case that occurs in the school. I'm going to talk a little bit more about the implications of having multiple cases in schools. Dr. Callum will as well, but I want to turn it over to Dr. Callum now to talk more about what is actually in our guidance around safety for the year. Dr. Callum?
Great, thank you so much, Dr. Farley. So to start, I wanted to talk a little bit about our process in coming up with our public health guidance for school reopening. So what we did is we examined all of the research we could find about kids in COVID, about transmission in COVID, and transmission in school settings. We also looked to guidance and recommendations from the CDC, from the AAP, from international settings, and then from other municipalities throughout the country. So just to start with some of that background information, we know from the data that kids are far less likely to have COVID than adults. So in Philadelphia, to put some numbers behind that, of all of the cases we've had since the beginning of the epidemic, only 1% of those cases were in elementary school age children, so kids ages 5 to 11, and only 2% were in the older children ages 11 to 18. We also know from research that kids seem to get more mild disease if they do in fact get COVID as compared to adults. Additionally, the research on this is more mixed, but there is some evidence to support that children may transmit COVID-19 to others less frequently than adults do. I also wanted to give some background from 2 different studies that were done internationally that were really high quality epidemiological studies looking at what happens when we have COVID cases in a school setting. So the first study was from Australia. This is a study that looked at 18 initial cases of COVID-19. So 9 cases were in students, 9 were in staff, and the contact tracers believe that all of these cases originated out in the community, not in the schools. Then through really rigorous contact tracing, they were able to identify 863 close school contacts of those original 18 cases. So all individuals who'd been exposed to COVID-19. They then did follow-up of all those close contacts, and what the researchers found is that of the students who were exposed, only 2 of them ultimately tested positive for COVID, and that not a single teacher or staff member ultimately tested positive for COVID-19. There's a really similar epidemiological study done in Ireland. In this one, it was 6 initial cases of COVID that were all thought to have been acquired in the community. So 3 from students, 3 from staff, that then contact tracers identified they had over 1,000 close contacts in a school setting. And in this particular study, there were actually 0 secondary cases of COVID-19 in either the students or the staff who were close contacts to those initial cases. So these are only 2 examples. So of course we have much more to learn, but it does provide some promising information that in these scenarios, schools were not hotspots of COVID transmission. I'm now going to talk about the reopening framework from our Philadelphia Health Department. I just want to reiterate what Dr. Farley said, that our guidance we put out is intended for all schools in Philadelphia. So of course the district, but also our private, parochial, and charter schools. I say that because if there are questions about how things are being operationalized in the district, those are best answered by our school district colleagues. I'll be talking about the general framework. Also, before I get into all of the details, I want to say that each of these aspects of our plan offers a different layer of protection that we think when put together can greatly reduce the risk of COVID-19 in schools. However, there's no 100% way of guaranteeing that we can avoid having cases of COVID-19 in our schools or in our students. There's no way to guarantee that. Instead, what we can do is layer in all of these health and safety protections and make schools as safe as possible for our students and staff. So getting into the details, the first tenet of our plan is promoting social distancing. And the way we primarily can do that in schools is through what we call the cohort model. This means the same group of students stay together in the same classroom as much as possible all day with the same teachers. And then they don't mix with other cohorts of students. The idea behind this is that every potential person that you are exposed to is a potential case of COVID that you can get exposed to. So if you keep your circles tight and close, you're less likely to have potentially be exposed to someone that has COVID. So the maximum number of students that can be in a cohort is 25 as feasible. In elementary schools, we expect students to stay in their cohorts all day long. If there are specialty teachers, they can rotate into the cohorts, and extracurriculars will also take place within those cohorts. For middle school and high school students, knowing that their academic needs might be different, we're envisioning it more if they need to rotate, students need to rotate for academics, that they'll be part of several intersecting cohorts. And then also for middle school and high school students, they can do extracurriculars and sports with mixing cohorts, only if a social distance can be maintained during those activities. Another key component of promoting social distancing is physical distancing. So what that means is keeping all student desks at least 6 feet apart from each other. Everyone should be 6 feet away from the teacher, and everyone should be facing forwards. They're not facing each other. Another aspect where social distancing is really important is during mealtime, because that's a time when your mask is removed. So during mealtime, we recommend that all students either eat at their desks, or if they're using a cafeteria, that's done in a staggered fashion by cohort with assigned seats, social distance between the individual students, and then distance between all of the cohorts. The next aspect of our guidance for all schools is promoting healthy habits in a few different ways. The first way is hand hygiene. So the rationale behind hand hygiene is that we know that COVID is primarily transmitted through respiratory droplets. Those droplets can get on your hands, you can touch your face, your eyes, and then transmit COVID that way. But thankfully, good hand hygiene with either soap or water or hand sanitizer can break that transmission train. So we're recommending frequent hand hygiene in the school settings, as should be done everywhere. The next aspect of promoting healthy habits is mask wearing. So again, thinking of how COVID is transmitted primarily by respiratory droplets, if you're wearing a mask or facial covering and then talk or sneeze or cough, which all puts out respiratory droplets, that mask can help contain the respiratory droplets, so you're less likely to spread it to others. So because of that, we recommend that all staff and students should wear masks at school. There's a few different options. The preferred option is a cloth mask or a disposable surgical mask. And that's because these are more tightly adhered to the face, so we believe they'll be able to keep the respiratory droplets in the best way. If a student or a staff member is unable to tolerate the mask or for an educational need, visualizing the face is important, then a face shield is an acceptable alternative to a mask. Our guidance allows students and staff to take short mask breaks when they are outside at a social distance. If they're inside and there are either plexiglass barriers separating the desks, or the students are at a social distance, and of course during meal times. I also want to emphasize that our guidance suggests that enforcement of masking should be developmentally appropriate. So the expectations for kindergartners, say, and their ability to tolerate wearing a mask all day and how we enforce that may be different than what we do for, say, a 9th grader. The next aspect of our plan I wanted to talk about is keeping the school clean. So again, the rationale behind this is respiratory droplets can sometimes get on surfaces, so we want to keep those clean as a way of transmission. I do want to say that by far and away, the science points to that the primary mode of transmission is respiratory droplets between one person and another. So while keeping the school clean is important, what's far more important are things like social distancing and masking. That being said, keeping the school is a priority, and we recommend that all high-touch surfaces, so things like phones, doorknobs, faucets, are all cleaned at least twice daily, and that any sort of shared objects that multiple students would be using, say like art supplies or sports equipment, should be cleaned in between use. The next part of our plan is screening children and staff for symptoms, and the rationale behind this is, of course, we don't want anyone who's sick to be entering into the building. Our public health guidance allows for 3 different ways of screening staff and students. So it can either be done at home through self-monitoring, if you're given a checklist. There's also the option of using either a web-based or app-based platform and entering in your screening results, or doing on-site screening. And from our standpoint as the health department, all 3 of those modalities of screening are acceptable. So the components of the screener, there's 3 main things. One is fever, which is a temperature of 100.4 or higher. The second is having symptoms of COVID. And our definition of symptoms of COVID is in that orange box. So it's having new onset cough or shortness of breath, or 2 of any of the following symptoms, which are fever, chills, muscle pain, sore throat, or new loss of taste or smell. Then lastly, everyone should stay home if they've been exposed to anyone with COVID in the past 14 days. So another key part of our plan for all schools is making sure that schools know what to do when someone becomes sick, particularly if they become sick once they're on site at the building. So first or foremost, anyone who develops symptoms at school should be brought to an isolation room while they're waiting transport outside of the school. They should then wear a mask, be isolated, and then get tested for COVID as soon as possible. And that link on the screen points to our testing map, which shows all the different testing sites throughout the city. And then when can someone, if they've been sent home with symptoms, when are they allowed to return back to school? So I'm going to walk through a few different ways that you're allowed to return back to school. For first and foremost, we're recommended everyone gets testing. If you test positive, I'll talk about that on the next slide, what to do. But if you test negative for COVID-19 and your symptoms are resolved, then you're allowed to return back to school or work. Alternatively, an individual might see their healthcare provider who documents a diagnosis other than COVID-19. And if they have that note and say that they are safe to return to school, that is acceptable. In the rare scenarios where someone is unable to either get COVID tested or see their health care provider, then we will treat them as if they have COVID-19, which means they're not allowed to return to the school or work until it's been 10 days since symptom onset, since they've been fever-free off any fever-reducing medications for at least 24 hours, and their symptoms are improving. What happens if, in fact, someone, though, does test positive for COVID-19? So first and foremost, all schools are instructed and will know to report cases immediately to the health department so we can initiate contact tracing. And we'll be giving individualized guidance for each scenario, but I'm going to go over the general principles. So for the person who has COVID-19, they must isolate, meaning they must stay home away from others until the following criteria are met. And these criteria are all from the CDC, and they actually recently revised one on Friday. So this is their most up-to-date criteria. So you must stay home for 10 days since symptoms onset, so when you first got sick. You also must be fever-free for at least 24 hours without taking any medications to reduce your fever, and your symptoms must be improving. So a question I've gotten asked a lot about this is, well, wouldn't it be better, instead of this symptom-based or time-based strategy, to just test everyone again? And then if there's a repeat test that's negative, then we can let them come back to school. And intuitively, I understand why folks would ask that, but actually I want to explain the science behind why that's not the recommendation. So both the CDC and the health department do not recommend doing repeat testing for return to school. And that's because COVID-19, you can be infectious for up to 9 days, is what the research shows us. However, research also shows us that it's possible to continue to test positive for COVID-19 for up to 12 weeks, meaning you can still have a positive nasal swab for COVID for a really prolonged period of time when you are no longer infectious, which is why the CDC and our health department recommend the criteria on the left of your screen as the strategy for being allowed to go back to school. The next part of if someone gets COVID-19 is quarantine. What quarantine means is that you need to stay home for 14 days and monitor for symptoms. And if you were to develop symptoms during that time, then you have to go get tested. I'm sorry, I should have said your quarantining is for all those who were exposed to the individual who initially had COVID-19. This chart goes through some of our initial thinking about how we will quarantine in response to various scenarios at the school. This is our initial thinking. We may change it over time. And I do want to say that we're starting with a pretty conservative strategy towards quarantining. And what I mean by that is we plan to quarantine larger groups of students and staff now at the outset than we hope to do later on if the epidemic improves. So just going through some of the scenarios, the first is if we have a single case of COVID-19 in the school. So in response to that, we will quarantine the entire cohort or cohorts that that individual has been in for a full 14 days. The next example is if we have 2 or more cases in 2 or more classes of the same grade. So just for example, if we have 2 4th grade homerooms and in each homeroom, there are 2 or more cases of COVID-19. Now, if that happened, that would lead us to believe that maybe our cohorts weren't as tightly controlled as we would have liked, and that some of the kids are still mixing between their homerooms. So our response to that would be to quarantine the entire grade level. So in this example, all 4th graders for 14 days. Next, we have some criteria with regards to faculty and staff. So we know that the risk of COVID-19, if they were to get it, of having a serious complication is higher for our staff or faculty. So because of this, we're having much more stringent quarantine recommendations if there are cases that occur in staff or faculty. So what they are is if there are 3 cases in faculty or staff within 2 weeks of each other, where we know from our contact tracing that those cases were likely linked to schools, meaning they likely were exposed in the school setting, our response would then be to quarantine the entire school system for the next 14 days. Similarly, if we see 6 or more cases of faculty or staff within 14 days, this is regardless of the source of the exposure, whether we think it's from the community or the school, our response will be to quarantine the entire school for 14 days. And then last, another criteria for quarantining the entire school would be if we're seeing multiple clusters of cases of students in multiple grades. So we have 3 cases in a kindergarten class and 4 cases in a 5th grade class and a couple of cases in a 2nd grade class. We would certainly quarantine the entire school for that. I'm now going to switch it back over to Dr. Farley to talk about some of our criteria for closing all in-person education.
Thanks very much. So I've been asked a number of times, under what circumstances would we say the entire school system cannot open or would have to be closed if it started school? And I can't give you a specific number or a specific algorithm, but I can lay out our thinking and talk about what are the factors we're going to be looking at. So that there are 3 factors that we would consider to determine whether we want to close the entire system after it were to open. First would be the evidence that a spread is occurring within schools. For example, if we see clusters of cases in students or staff in multiple schools. Second would be rising community infection rates. And third would be links between school cases and community cases that suggested that the school was somehow helping to increase rates of infection in the community as a whole. Now, if any one of those key factors were bad enough, that might be enough for us to say the entire system needs to shut down. Or the more that we would have combinations of those 3, that might make us more likely to say the entire system needs to shut down. Other factors, though, that we would weigh in interpreting that include these 3. We're going to be looking at regional and national trends in cases, hospitalizations, and fatalities. We're looking at any evidence that we'll be developing over time that schools are or are not sites of spread in other communities. Dr. Callum has just given you examples of research from other countries, but we're all learning about how this operates in the context of the United States. And what happens in other cities will help inform whether we think that we have more or less risk in our school system here. And third would be compliance with safety precautions in schools. We've laid out a number of safety precautions which we believe are important, but we know that they're very difficult, or they may be difficult, to fully implement across all the schools in the city. And so we'll be monitoring that, and that is another factor that would weigh into that decision. These are our thoughts about if the school system were to open, and under what criteria we might ask it to, might say it needs to close again. Let me also say what might happen, try to answer the question, what might happen between now and the scheduled opening of school to tell us that would prompt us to say that you shouldn't open it at all. And we don't have these school-based criteria to look at because the schools wouldn't be open. And we're going to be predominantly looking at our community infection rates. And although I can't give you a hard number here, if we clearly see sharply rising community infection rates between now and the beginning of the school year, we're going to look closely as to whether we do think it still is safe for the school system to open. Now, that's all looking at things from a negative standpoint. Next slide. But it's nice to think more positively. Things may go quite well, and people may ask, under what criteria might you ease some of the restrictions that Dr. Callum has just laid out here? We're going to look at similar criteria. We'll look at the lack of evidence of spread within schools. If we go along and we find nothing happening in schools, that's going to give us more confidence. We might be able to back off on some of the restrictions. If we see falling community infection rates, we see no evidence that schools are important contributors to community-wide transmission. All of those might give us some sense that we might be able to ease back on some of the restrictions you've laid out here. Dr. Callum?
Great. So I'm just going to end by briefly mentioning all the things that everyone who's listening can do to help support a safe reopening of our schools. So first of all, for all the parents and caregivers who are listening, now is the time to get your child acclimated to wearing a mask so that when school starts, they are ready. I would also hope that everyone continues doing their social distancing, keeping their circles that they're interacting with very small and tight. If you're experiencing symptoms, please stay home. Do not go to school or work if you're symptomatic. We don't have a COVID-19 vaccine yet. Hopefully that's on the horizon eventually, but we do have vaccines for a lot of other childhood illnesses. So just as you would if you're a parent or a caregiver before any other school year, please make sure your child is up to date on all their immunizations. And last but certainly not least, if you do develop symptoms of COVID, please get tested as soon as possible. I put up the link for our testing map again, so then we can respond appropriately. Thank you so much.
And with that, we're happy to answer any questions or turn it back to the board.
Thank you, Dr. Farley. We're going to take questions after our next presentation, I believe. We're next going to hear from Mr. Sauer, who is a representative from SEPTA. He's the Assistant General Manager for SEPTA. He'll be discussing some of their plans for working with the school district through this reopening. I want to thank you for being with us, Mr. Sauer.
Thank you, Madam President. I appreciate the opportunity to address the board on this very important topic. And I'd like to start off by just acknowledging our long partnership with the school district of Philadelphia. We've been working with them, as I'm sure you know, for a long time. And we were excited to partner with them on their reopening plan. I'd like to also just take a moment to thank the SEPTA employees that have been working through the pandemic, our essential employees, and their efforts to get other essential employees back and forth to their places of employment and to shopping and so forth. The evolution, I'll just touch briefly on the evolution of our service, as I know many folks have been away from the system for a long time. Our ridership currently hovers at around 30% of our baseline on transit and 10% of our baseline on regional rail. So ridership has dropped precipitously on the system. It has recovered just a little bit from some very low numbers at the height of the pandemic to where we are today. But throughout the crisis, we've been working very closely with the city of Philadelphia and their officials, as well as the Commonwealth's officials, to understand how to react and to plan our service and protect our employees and customers as appropriately as we can. I wanted to touch a little bit on the service that we'll be providing first to the school district and to all of our customers. Over the course of the pandemic, from March on through about mid-May, we had reduced our service levels to what we were calling essential levels, just service to get essential riders out to where they needed to go in anticipation of all the quarantines and lockdowns that were in place for non-essential travel. We've seen on May 17th and 18th, we resumed our normal schedule on transit. That's buses, trolleys, and subways. And we have continued to work at a normal schedule since then, and we will continue to do that into the fall, adding back all the school travel, all the school busing that we normally put in play each school year. What we're hoping is that the hybrid model of learning that Dr. Height's proposing, as well as the staggered bell schedule with our full complement of service, will allow for social distancing on the vehicles as best as we can. We still currently have rider limits, capacity limits, if you will, on the vehicles. But we anticipate that as ridership grows, capacity limits will have to be adjusted and continue to be examined in anticipation of stronger ridership. But we have been working closely with the school district on their plan. We do have our normal service schedule proposed and ready to go. And we'll continue to monitor it. We'll assign supervision to the schools where we're providing specialized service to see what we need and adjust as appropriate. All that is on the table. I'll speak just briefly on our employees. Our employees have absenteeism has improved. The number of folks affected by the virus kind of meets the same pattern, if you will, as what Dr. Farley illustrated as far as the height of our absenteeism and back to levels that are more manageable today. We've done a number of things to try to protect our employees through acquiring PPE, barriers between the bus operators and the customers, and temperature screening for our employees. So we're doing a number of the things that have been spoken about earlier. If you would. So we've focused a great deal on cleaning, and more so, we've always had a robust cleaning program. We've tried to up our game, if you will, over the last few months, increasing the number of cleaners we have out and visible on the system. We've procured some new equipment for them. Some of the photographs that you see on this slide demonstrate some of the efforts we've made to address sanitizing high-touch surfaces. We have dedicated teams of cleaners in our subway stations and on our vehicles to sanitize our equipment and sanitize our stations, to keep it as clean and disinfected as much as we can for our customers throughout the day. We have overnight washing of the stations and overnight cleaning of the vehicles to get them prepared for the next service day. We go to the next slide, please. We're sanitizing every vehicle at least twice each day, sometimes more often, as we have cleaning staff assigned to various loops and terminals throughout the system where our buses turn around at the end of their trip, and we'll have cleaners get on the vehicle and wipe down high-touch surfaces. As I mentioned, the team of wipe down crew that we have in the stations on the subways to wipe down those surfaces as well. We've been reallocating our resources, as I mentioned, to overnight cleaning. We have been experimenting with new technology on cleaning. You may have heard about ultraviolet cleaning techniques. We've been working closely with a consultant who's also working with the MTA in New York on ultraviolet testing for cleaning purposes. We've been working on those as well. Next slide, please. So with all that the cleaning and as I mentioned, social distancing, we'll continue to try to achieve, but at some point when social distancing doesn't become is unachievable, wearing a mask is paramount. Back in early June, when the governor issued his directive for mandatory face mask or face coverings, we went in that direction as well, and all of our customers as well as our employees are required to have a face covering on whenever they are in the system. So we've done a number of things to make that campaign aware, our customers aware of that campaign. We've put signage up on all the vehicles in the stations. We're making announcements as much as we can. We even had a campaign early on where we gave away 20,000 masks on our vehicles. We've done a number of things to continue to educate and reinforce mask wearing. I'm happy to report we recently did an assessment of our customer compliance with face coverings, and we found that up to 80% of our customers are wearing a face covering. It's even higher on buses, over 90%. So it's very encouraging that people are following the guidance put in by local and state health officials. Next slide, please. What's extremely important to us is getting the word out to both our employees and our customers, not only to have a face covering in your possession, but to wear it properly, keeping your nose and mouth fully covered. So we've engaged with a number of campaigns, a number of communication efforts to get that word out and to encourage that. And you see some of that example here, and on the next slide, some of that here. So we are really working very hard to get our folks educated on how to wear the covering. It's going to be extremely important as people return to the system, whether it's your students and faculty or just our customers coming back, our other customers coming back into the system. And the vehicles, we'll have every vehicle available in service as we normally would on a normal fall schedule, just like we would have last year. I'll just mention one more thing. All of our interior vehicles have been marked to encourage social distancing. We've marked off different seating arrangements so that when our customers get on, they'll be more able to determine where is a good place to sit, where is a good place to stand in order to try to maintain social distancing. This concludes my presentation. Thank you again for the opportunity.
Thank you, Mr. Sauer. Board members, I'm now going to ask if there are any questions from board members of our presenters this evening. Given the remote platform, I'm going to call on board members in small groups to ask if you have any questions. And I ask that each board member limit their questions and the answers they receive to 5 minutes so that we can go through all board members. At the conclusion of the board members' questioning, we'll have 150 speakers who will also be asking questions. And then final comments will be entertained when members are asked to vote. And so with that, I'll start with Mr. Akbar, Ms. Danzy, and Vice President Ahea Hinton.
Madam President. First question is related to, I guess, Dr. Height, some guidance or his thoughts around this. My thought is that folks will, as we get closer to September and into September, educators, parents, students will sort of like make decisions with their feet, right? And can you talk a little bit about, like, are there attendance triggers from educators or students that would cause a pivot in the plan, or what's just the general thinking if we go through this plan when it comes to like attendance, people showing up, and that means from an educator standpoint and a student or parent standpoint, are there certain triggers, or what's the thought around pivoting when those things happen?
Yes, thank you, Board Member Akbar, for the question. And we will, to your point, we would be approaching attendance like we would on a normal school year. But I think part of your question gets to who will still be attending on a regular basis if in fact they feel comfortable or not. And we hope that we'll have more information around who signs up for the 100% digital, and that may help offset some individuals who may not be comfortable. We're also really paying attention, and I think we really need to pay attention to what other districts around us are doing, and in the event that individuals may have choices, if in fact we are implementing one model and then there's another model that could take children more or less, or whatever the difference is, we also have to track who who may be withdrawing from the system and transferring to those different opportunities. But attendance is going to be tracked on a daily basis, and we will be comparing that to prior years. Yes.
One point of clarification just around like those folks that are opting for our virtual academy versus like some families that are staying if the hybrid model goes into place. Once you're in the virtual academy, and let's say like there's a shift into like all our school communities to go virtual, do they or do they not have the opportunity to go back to their regular schools? And I heard a little bit like you could still participate in some of those school activities. Can you give me one more piece of clarity around that?
Yeah, so that's a great question, because even with the children who are assigned to the digital academy and those who will remain virtual the entire year, those individuals will be assigned to like the digital academy, but they will also still be attributed to a school. So we could quickly move those. If we went all virtual, individuals could really convert back to their home school, whatever that school may be. And because we're having to do both anyway, with face-to-face and the hybrid, but the children who sign up for the digital academy will be with a digital teacher, but they will still be assigned to their home school.
Thank you. That's it for me right now.
I have actually one for Dr. Farley and one for SEPTA. Dr. Farley, did you say that the health department would be monitoring the school's compliance with safety precautions? And
We'll be monitoring at a very high level. We will not be sending inspectors into school, but we'll be talking to the school district administration and overall get some sense for how well they can implement the plan as laid out.
And for Dr. Sawyer, I'm Dr. Sawyer, what that 10% that you said are not adhering to the mask, are they allowed on the SEPTA transportation?
Yes, we are not forbidding or preventing folks from getting aboard the buses without a mask. We are advising them. Our operators will advise them of the need for a mask, encourage mask use, but we don't want to put operators in a position to have to try to enforce mask wearing.
And will anybody be monitoring, like in the stations, once children start coming back to school and more people begin to go to work, you're going to have more people in the station waiting there for especially the subway and the buses too. Will there be a process for trying to ensure that there is still social distancing?
Yeah, what we're trying to do and what we'll be doing over the next couple of weeks is we will be placing decals on station platforms and places where our customers generally queue to demonstrate proper social distancing. We'll also be deploying a team of employees to different locations at various times of the week. We're calling them social distance coaches to encourage social distancing and mask use.
All right. Thank you.
I have questions for Dr. Height and then Dr. Kellum or Dr. Farley, whoever from your, these are just in terms of clarification, Dr. Height, for the readiness reports, can you clarify like who's going to be confirming that these schools are actually ready? Or are we at that position, at that point yet? I mean, I know we talked about checkoff lists and stuff like that, but I'm just trying to figure out how will we know that a school is actually ready based on all the requirements on the milestone list?
Yeah, there are a whole set of factors,
yes,
Madam Vice President, and there are a whole set of factors that we will be taking into account. And some are factors around ventilation, others are factors around PPE, or if in fact we have a sufficient number of cleaners in a school. Some are factors around if there are enough teachers that will be in place in order to educate young people. So there are multiple factors in multiple areas. And if you think about it, and I just use several across multiple categories, There are categories around transportation, there are categories around facilities, categories around health and safety, categories around instructional practices, professional development. So there are multiple categories. And then under those categories, there are indicators that will be red, yellow, green, and we will make that available to the public so that we are all tracking the information. But on the readiness indicators, that will all be done once all schools meet the green on each one of those categories.
So will those be public? Will they
Yes.
be shared? They will
Yeah.
be? Okay. And if for some reason a school goes into the readiness category of green and something falls by the wayside, then that could change, right? It could go back and forth. Okay. The quick question on the pre-screening, is that form going to be in all languages to meet the needs of the varying families? Because not everybody is,
Yes,
English speakers.
it will have to be in all languages, well, at least the primary 8 languages that we use. Yes.
Okay. And then, and I'm sorry, Joyce, I know you're going to beat me up, but I know that principals are being asked to develop these plans for their individual schools. And it is kind of like a big task. I know that we have principals that are going to be speaking tonight. Are they going to be receiving, or has there been some thought about what supports they're going to be getting to develop these plans?
Yeah, yes, Madam Vice President.
Vice President.
We have the, so we're going to be giving guidance. So you don't have any guidance around, can desks be closer than 6 feet? They can't. So that you know they must be facing forward. They must be set in a place. And so those things are kind of in stone. Okay. But the things around schedules and traffic patterns in buildings when children are going to and from a location in a school, or how they enter the school or leave the school, who is scheduled on what days, because the schools best know the families. All of those things we're asking principals to do. And we're going to begin having some weekly meetings with principals so that they have an opportunity to have questions answered, talk about the supports they need, and provide any other guidance that they have indicated a need for.
Okay, and I'm sorry, my last question is to Dr. Kellum. You talked about the testing, that if a child is determined to be, sick, they're going to quarantine them in a space somewhere in the school, right? And then there has to be testing. I know from experience that testing turnaround is kind of long. Is there any discussion in the city about how quickly that those tests will turn around so that families know whether their children are positive or negative?
Let me answer that.
Okay.
Thanks so much for the question. We are having very long turnarounds from 2 big laboratories that do maybe 25% of the testing in the city. We're working on trying to redirect those tests to other labs that have a quicker turnaround. The other labs that are local have a much quicker turnaround, more like 2 days. So I'm hoping that we will have that problem solved by the time the school year starts. If not, what we'll try to do is direct parents to sites where they send to laboratories with a quicker turnaround.
Thank you, Dr. Farley and Ms. Hinton. Our next group of board questioners will be Ms. Fix-Lopez and Mr. Huang. Ms. Fix-Lopez, I'll take you first.
Sure. Okay, so most of my questions are for Dr. Farley, and then maybe a couple for Dr. Height. Dr. Farley, so just a bit of background information. The school district currently has approximately $4 billion of deferred maintenance. And based on our reports, my understanding is that there's over $1 million of that is still related to ventilation. And so my question—
billion.
1 billion. Yeah, billion. I'm sorry. Thank you. My question to you is, does your recommendation take into consideration this issue of deferred maintenance that we have, in particular around ventilation?
Now, we understand people are interested in ventilation systems, but the ventilation systems shouldn't have a big difference in the likelihood of spread from one person to another. For the most part, this spreads from one person to someone else sitting pretty close by droplets that are coughed by one person or spoken by one person to that person nearby. And the ventilation system isn't going to make much difference to that. So that, there's plenty of other issues that the school district has to deal with around the school maintenance. but it shouldn't influence much the likelihood of transmission of this.
So are you saying that, so in the plan, there are mitigation strategies related to ventilation. Are you saying that essentially they're not necessary because it doesn't, so if we would take that out completely, it doesn't change?
I mean, I think it makes sense to maximize the ventilation that's there with whatever means we do, but I would not say that we should change the plan based upon the fact that we're not going to be able to greatly, change our outer ventilation systems or greatly increase ventilation in the schools right now.
Okay, and I just want to, just to clarify, make sure I understand, and sorry, my 4-year-old's playing with this hamster behind me all of a sudden. So just to clarify and understand that a little bit more, 1 second. Sorry. To understand that a little bit more, let's imagine that there were one classroom that does not have any access to fresh air. Is that classroom usable?
I would think so. I mean, I'll double check with our expert, but I don't think that would change our recommendations.
Okay, my next question then, and I'm not keeping time, so President Wilkerson, my next question would be, you said that if safety requirements are not followed, it may result in school closures. What are the triggers and benchmarks for that? So even down to, how would you be able to look at the cleaning that is happening in the schools and or decide if that is being done accurately and if it would trigger a closure or not? Or you mentioned the 6-foot distance of not being adhered to, or cohorts. So those could be issues. How are you going to monitor that?
Yeah, so just to be clear, we will not be monitoring implementation of the safety measures at the school level. There's too many schools. We don't have the staff to do that. We will be in communications with the school district administration, have them tell us as much as possible what they know about implementation of the safety precautions across the system. And that would be one of the contextual factors we may take into account if we're thinking about closing the entire school system. The 3 key factors are different from that, but that's one of the contextual factors we would consider.
Okay, last question. So in the plan, it talks about students, especially in high schools, moving, like their cohorts would stay stationary and the teachers would rotate classroom to classroom. And Dr. Hite, correct me if I'm wrong. So that's my understanding, is the students would stay stationary in their like homerooms or cohorts, and the teachers would move. But if your research is showing that the teachers are actually more susceptible to maybe catching the virus than the students based on the research, if you're moving a teacher to 10 different classrooms throughout the day, aren't they exposed to 10 different potential environments instead of just their classroom where they're the ones touching their materials and such? So which do you think would be more risky?
And this is your last question, Ms. Fix-Lopez.
You're watching me.
Dr. Callum, do you want to take that answer, or you want me to?
So I could say briefly that if a teacher is rotating between different classrooms, they'll still be wearing a mask and at full social distance from the children. And since a child is an adult, we expect them to better be able to adhere to social distancing recommendations and wearing the mask than the students. So I think they'll still be protected, even though, as you say, they will be rotating to different rooms.
Thank you.
Mr. Wong, do you have questions?
I have 3 for Dr. Hite. Teacher input for me is critical to where we land on a plan and how we execute a plan. And it's my understanding that you've been in regular contact with the elected representative of the teachers, PFT Local 3 President Jerry Jordan, and that the plan you've put forward has attempted to be responsive to the statement that President Jordan issued on behalf of the PFT. So I was hoping that you could speak to the frequency and content of your conversations with President Jordan. If you think there's anything in his statement that your plan could not be responsive to, and what, if any, other engagement you've had with individual teachers outside of your meetings with President Jordan.
Yeah, thanks for the question, Board Member Wong. And I want to clarify a point. So Jerry and I talk, but meetings are between and among staff. And I have Dr. Nunez, I think, who's on the line, who is one of the members of the team, along with several chiefs, a chief of talent, a chief of student services, Lynch, Shambo, Savoy Brooks, Dr. Nunez. They've all been meeting with individuals and including in those meetings guidance that we were receiving. And they also shared their survey results with us, and we tried to incorporate their survey results into our final plan. In addition to that, we tried to implement as many things as possible that they had indicated was really important, that were really important to the leadership and the members. So I would characterize those meetings as almost weekly with staff, between and among staff of the school district and of not just the PFT, but all of the other unions as well. And since then, we've tried to engage, we're continuing to try to engage with teachers, in some cases directly. There was a teacher town hall today. We have others planned that we're doing with teachers as well. I had a principal town hall yesterday, virtual town hall yesterday. We also had town halls that were done just for the general public, and many teachers participated in those. In addition to all the emails and that we received, all of the messages that we receive as well from teachers, we try to incorporate as much of that information as possible.
Okay, second question. Why did you rule out different approaches for different age ranges, say full remote for students above a certain age versus full in person for our youngest kids?
Yeah, so we did that. We started with that. I mean, so we started with a couple of plans, and we started with a plan that would have all children grades K through 5 every day, and along with all of the vulnerable categories. But even with that plan, what would be needed with respect to classroom space, given the social distancing requirements, did not allow, and everyone else in that model would have been virtual, and that's all of the children above 5th grade would then have been virtual. But what we would have still needed with respect to classroom space, given the fact that for some classrooms we would have to increase by 1 or 2 additional classrooms, depending on the size. We could not pull that, we could not do that. In addition, the number of teachers that it would have required would have cost us well over $100 million in additional expenses to do. Then we looked at kindergarten through 3rd grade with everybody else being on a hybrid model or virtual, and also could not do that for the same reason. So primarily looking at all that was missed when our children were not in school, and how many of our most vulnerable children, both at the early grades and through high school, fell further behind because they have been out of school for so long. We just felt it was extremely important to get as much face time with an adult or teacher as we could, even if it's only 2 days a week.
Okay. Third question, and I hesitate to get into the weeds, but I know that climate has been a much discussed topic amongst the board. So I wonder if you could comment on what screening students on the way in looks like in this plan, and how has that been integrated with things that you and Kevin Bethel have been working on to ensure a respectful and safe student experience?
Extremely important question. Thank you for asking that. And one of the reasons we wanted to do some of the professional development that we're doing with all staff members on those days before children come back to school was to ensure that we are focusing on not just adult wellness, because that's extremely important, but how to create the cultures and the climates that are responsive and receptive and welcoming for our young people, particularly given what we're asking them to do in this set of circumstances. And so climate is a big part of this. And as I indicated before, we are instituting an initiative called Healing Together, where we're doing a lot of social and emotional supports, trauma training, and just helping individuals to make sure we're creating welcoming environments, regardless of where children are attending school.
Thank you, Mr. Wong. Our next set of board speakers is Dr. McCulkin, Dr. McIver, and myself.
Thank you, President Wilkerson. I have a couple questions for Dr. Farley and Dr. Collum. I have a lot of concern in what was released publicly in regard to the plan for students Group A to go on Monday and Wednesday, and Group B to go on Tuesday and Thursday, and such alternating days. And I know there's room for discussion for that. And I just was wondering, Dr. Farley and Dr. Callum's take on the difference between the alternating days versus Group A going Monday, Tuesday, having a day in between for viral particles to die off and be clean, the schools be cleaned, and Thursday and Friday for the cohort B, because I'm concerned for a lot of reasons, but contact tracing, for example, if a teacher develops symptoms on a Tuesday or a student develops symptoms on a Tuesday, you can't necessarily just quarantine the one cohort, you'd have to quarantine both. So just wondering your thoughts on the two different plans.
Dr. Callum, you want to answer that or you want me to?
Why don't you go ahead and I'll chime in if I have stuff to add.
When we do contact tracing, we look at people who have had face-to-face exposure with the person who has the infection, and the high or medium risk contacts would be people in face-to-face for more than 15 minutes and less than 6 feet away. We don't look at somebody who has been in the same building the next day. The virus is not felt to last long enough to pose a risk to any degree 24 hours later. So the fact that we have a different cohort of children the next day should not increase the risk of those children, and we would not be quarantining those children who were there in that same building the next day from that case.
But if the teacher became positive on a Tuesday, they've been, become symptomatic on a Tuesday, they've been exposed to both groups of students in a time frame where they may have been infectious.
Correct. If the teacher were infectious, and the teacher taught on 2 days, then there would be twice as many cohorts of children that would be exposed to quarantine. That's right. I say that the chief benefit to infection prevention for the overall hybrid model is that there's only half of the children in any school on any given day. And so that means that you have smaller crowds, more room for space and social distancing.
Okay. I don't know if Dr. Callum wanted to add anything before my next question.
No, go ahead.
Okay, so my next question kind of relates to that. So we're seeing lots of buzzwords thrown around, like there's a lot of fear about how much ventilation and buzzwords about the word disinfectant and what that means. And it has almost become synonymous in the school setting for disinfectant to mean these electrostatic sprayers where you're spraying chemicals all over the classrooms, which is going to leave a residue on the desks and the floors. And I'm worried about the impact of all of those chemicals being sprayed, particularly if they're sprayed every single day. And so can you kind of define what disinfectant should be meaning? And are the electrostatic sprayers necessary, particularly if we did the Monday, Tuesday, Thursday, Friday? Does that need to be done every day as opposed to disinfecting high touch surfaces?
So I can start and say that our definition of disinfectant is what the EPA has on their list of approved disinfectants and what the CDC says will help get rid of COVID. I don't actually have a strong opinion about whether using the electrostatic sprayers or not. Dr. Farley, do you?
I don't. I think, we would follow national recommendations on what sort of disinfectants to use. But let me just reiterate the larger point that disinfecting surfaces at the end of the day is something that's part of the plan. We think it's important to do, but it's far less important than the masking and the distancing. For the most part, this is really transmitted around people who are in the same space at the same time.
I agree 100%. And that's why I worry about the use of spraying chemicals every single night in the classroom. And what impact are those chemicals going to have on children that have asthma, allergies, migraines, other diseases?
I would just say we have to take for their expertise that the EPA and the CDC are saying these disinfectants are safe. They are safe to use.
Even if they're sprayed every night. Now, I'm not talking about just
whatever those national
down.
Experts. I'm not an expert on different infections.
I'm not either.
But if the CDC and the EPA say those are safe, they were comfortable with that.
All right. And then the last question is playgrounds. So if we're going to allow students to play in sports, what's going to be the guidance in regard to playgrounds?
So
our kids outside.
For playgrounds, students can use playgrounds, but only as a cohort, so that the cohort shouldn't be intermingling on cohorts. There should be good hand hygiene before and after playground use, and that the playground should be cleaned as the rest of the school high touch surfaces are.
Great.
Next board member with questions is Dr. McIver.
Okay, thank you. I have 2 questions for Dr. Height and 3 questions for Dr. Farley. So the readiness indicators, Dr. Height, that you were, I'm going to read all of my questions and then you can answer. The readiness indicators, when are we going to know, or when are those going to be ready? That would be my first. But on your list of these milestones, we have ready facilities by August 15th and procure health and safety materials, I think, by then. So do we have a checklist of what would constitute that a school is ready to open safely? What are those very tangible things on that list? Who gives a sign off on readiness? given that we have 4 weeks to ready schools for safe reopening, can you tell me approximately what percentage of our 200 plus schools are ready to go today? How many will be ready to go a week from today, 2 weeks from today, et cetera? Are we readying them in stages? That's my first question. Second question has to do with the virtual academy. Who are the teachers being recruited to teach in the virtual academy? What do we know about their success and readiness for teaching virtually? Also, the virtual academy does not provide options for students in CTE programs or IB programs, which accounts for thousands of students in the district. What accommodations are being made for those students who opt for virtual learning? Why, given the number of IB programs in the city, are we not providing programming for these students by recruiting certified IB teachers from the district to provide virtual learning? So those are my questions.
I'll start with the first question on the readiness indicators. I cannot tell you this evening where all schools are with respect to where they fall on the readiness indicator, because readiness is in several categories. And so readiness is in the category of school environment and cleanliness. And so that's one indicator. There's another indicator for after all of the individuals sign up for the virtual learning, and then we would have some perspective of how many children are logging in for virtual. The readiness indicator dashboard will be available on August 3rd. So then everyone will be able to see school by school where we are with respect to those particular indicators on all of the measures that we would be measuring. With respect to your second question on the children who are signing up for virtual, who are the teachers? First and foremost, we need to know how many children we will have who will be signing up for those programs. Then what we will try to do is then attempt to match individuals to the students. First, those individuals who may be in vulnerable categories. Some will require some training in order to be in an all digital environment. And then there are others who are interested in teaching virtually or digitally that we could also utilize some process to make those to select those individuals. We've asked for people to express an interest if they want to be in the virtual space. The second part of that question was International Baccalaureate. International Baccalaureate doesn't allow us to use a virtual model. So it must be based on whatever school the children are assigned to. That's not our rule, that's IBO's rule. And so that rule is actually coming from the International Baccalaureate organization that doesn't allow. I'm sorry.
Even in this climate, where schools are going virtual, they haven't changed their
they have not
requirements.
No.
Okay.
But with respect to the other extracurricular activities, because of the cohorts that were defined, is why we were saying that children who participate in the virtual, it will be difficult for those individuals to then be a new student into the cohort, like on a sports team or extracurricular activity. With respect to the CTE, we just can't offer what is required for some of those children to be certified in a virtual environment. In some cases, that just cannot be offered. So we wanted to make sure individuals knew that as they were making their decisions.
Okay, and then my questions for Dr. Farley. The studies that were cited did not include the South Korea study that was just published that showed that children ages 10 to 19 spread the virus as easily as adults. What does this mean for our teachers and staff who are in vulnerable groups? And given the average age of the Philadelphia school teacher, that's my first question. The second also concerned the study, you cited the New South Wales study, but that does not compare apples to apples. In the New South Wales study, they only did face-to-face instruction 1 day a week and limited occupancy to 25% of normal. It seems that the Israeli study of school children is more aligned with our model. And in that instance, Israel recognized that the spike in COVID cases could be directly attributed to the reopening of schools. So I'd love comment on that. And the third question is,
I'm asking that you respect the other rules that everybody else.
I think I am. I think I am.
I've asked that board, I don't want to belabor this, the board members limit their questions and answers they receive to 5 minutes.
I just did 2 questions. Okay, this is my last question. If we are quarantine a cohort, do we have to quarantine their siblings as well, even if they are not in that cohort?
So those are great questions, and I'll start with the first two. So the South Korea study was a really well done study and an interesting one. But I think in the news, what often didn't get reported was the full study. It was just that one headline about kids 10 to 19 and then who they transmitted in their household. So this study was a similar premise to the studies I had described, where they looked at index cases across different ages, so people with COVID from their community, and then who in turn secondarily got COVID. The big headline was that 10 to 19-year-olds transmitted to their household contacts, meaning people they live with, people who they're in close contact with, people who they're not wearing masks around, at higher rates than we would have anticipated, more in the way that adults transmit. The part of that study that actually didn't get any press, but is also in the paper, is that kids who are 10 to 19, when you look at their transmission rates to non-household contacts, meaning the people that they don't live with, it's actually the same as adults, if not a little bit lower. It's less than 1%. And I think in a school setting, that I would attribute that more being like a non-household contact, because you're at a social distance and you're wearing a mask, as opposed to being a close household contact. That was a great question. Your second question was about Israel, which has been a lot in the news, reopening. So I couldn't find, and if you have any, I'd love to read them, any like true epidemiological studies from Israel. What I found in the news, though, shows that their approach to reopening was different than ours. That they opened up for 2 weeks initially in sort of similar to what our plans are, with social distance, with not all the kids in school, with just the younger students. But then after those 2 weeks, they opened up with everyone. They had 30 to 40 kids in the classroom. They were not social distancing. There was variance compliance with masking. So I'm not sure if it's a fair comparison to all the health and safety requirements that we have.
And quarantine a cohort? Do we have to quarantine their siblings? If we have to quarantine students in a
sibling, so we don't sort of quarantine contacts of a contact. So if the sibling was, if the index patient, meaning the one who has COVID, was the sibling, or the sibling was a sibling of the index patient, they would have to quarantine because they live together and they're in close contact. But if it's the sibling, if the brother was, say, in a different class where there was COVID, the sibling does not need to quarantine. Dr. Farley, feel free to correct me on that one.
That's right. So if you're quarantining a child, you don't need to quarantine that child's sibling unless that child's sibling was part of the cohort.
Thank you, Dr. Farley. I have a few questions. Dr. Hite, how much play is there in the school year schedule? You have a Herculean number of tasks that have to be completed in order for the district to open schools on the 2nd. How much give is there in the school schedule if we find that, that we're just not going to make the benchmarks, that the milestones that you've established?
I'm sure everyone is aware that we have word from the Pennsylvania Department of Education is that we will still have the requirements either for the 180 days or the 990 hours. And so that then doesn't give us a lot of flexibility. We have some days now that are scheduled as a spring break. We have some other days that are scheduled as winter recess or winter break. And those would be days that we could use. But if we push back into stopping or stopping the year later than June, I want to say 15th, then if we go beyond June 15th, we trigger a clause that is in the way we pay individuals. We pay 10-month employees over 12 months. And based on that pay schedule, that would, every day that we would go beyond the 15th would then have some cost associated with that day. I think that those costs are about $4 million a day.
Mm-hmm. And then if you could talk a little bit about ventilation. There's been a lot of talk about ventilation, and I appreciate Dr. Farley's comments about that not being as high on his list of priorities, but I think it is a concern. We do have an inventory of old buildings, and there are annually concerns about ventilation issues. How do you intend to manage that challenge?
Yes, I mean, and I think it's board member Fix Lopez's question. And one of the things, and while Dr. Farley said that it's not high on, we have to focus on other things. We are hyper-focused on ventilation and making sure that both there's opportunities for fresh air in and looking at the standards from EPA and standards from multiple organizations, including the AFT, and using that checklist as a checklist for professionals, not in the school district, but outside professionals to come in and measure to see if in fact classrooms and areas in buildings are sufficiently ventilated. And so we are planning to do that, and we are planning to do that in every space and have those things certified by industry professionals who are coming in to do that work.
And my last question, I'm not an educator, and so I'd appreciate your insights on why face-to-face learning is so important for children in our poorest communities, Black and Hispanic kids. You know, because when I think about it, we could be a year and a half before those children could be in classrooms with a full complement of colleagues and teachers. Talk to me about what that means in terms of the education.
Yeah, I mean, this is the thing I've been most concerned about since March 13th. We have young people who are already in vulnerable categories and who are already somewhat behind many of their peers. And now we know, based on evidence and research, that children from circumstances of poverty, particularly Black and Latino children, were disproportionately impacted with going to a virtual learning type of approach. And so my worry is the longer we stay in like a virtual approach without children having face-to-face interactions with teachers and other adults, that many of our children, particularly those who are most at risk, are falling further behind. And those things actually are aggravated more significantly if we're talking about children with special needs or children who are learning English. And those young people have not been with adults since we've been out either. And so I worry about those young people falling farther and farther behind without the assistance of some face-to-face instruction. I'll also add that as an educator, there's some trauma that particularly our youngest students are experiencing by not having the social interactions with their peers. And that also worries me. And it's one of the reasons we pushed the beginning of the school year back, because we're going to have to reestablish some communities within our schools so that children are recreating those communities, both with their peers and with the educators who are working with them.
Thank you, Dr. Height. This brings us to the end of board questioning. Next on our agenda is hearing from our registered speakers who are registered to speak on action items we're considering at this meeting. As a reminder, we'll be hearing from tonight's registered speakers in groups of 40 at a time and take a short break in between each group of speakers. Additionally, I'd like to acknowledge we've received a substantial amount of written testimony. Councilwoman Gilmore Richardson, Elizabeth Skokie, Howard Skokie, Joan Lucas, Joan Beaver, Catherine Butts, Lucretia Allen, Margaret Shin, Mary Henderson, Rachel Ellender, Sarah Kloss, Stanley G, and Teresa Kelly, Ruggiero, all submitted written testimony that'll be made a part of this record. We received comments from Sherry Michaud on topics of reorganization of the Academic Support Office and planning for instruction for English learners in fall 2020. Diane Payne, requested learning continue to be conducted remotely in the fall and cited several action items on the agenda she believes indicate the district is not grounded in reality. And finally, Carol Kalimnik provided comments on several of the action items up for vote, as well as this evening, and expressed unhappiness with the timing of materials being posted to the public. Additionally, board asked parent and community advisory council members to collect feedback from their communities in advance of the meeting. At this time, I'd like to ask board member Akbar to provide us with a summary of feedback that's been received from the advisory council.
Thank you, Madam President. Over the course of the past school year, members of the advisory council have provided reports on the feedback they have received from their communities at each action meeting. This month, we asked members of the Advisory Council to collect feedback specifically on school reopening. We received an extensive amount of feedback from our Advisory Council members. First, I want to thank them for their work in bringing this important information together. We will be posting all of the feedback we have received with written testimony submitted for tonight's agenda. I'd like to take this time to briefly summarize some of the feedback. Parents were asked the following questions. Will students be tested? Are nurses on site? If a student or staff member gets sick, what are the next steps for the school? What do we do with the children who have parents drop off children on the wrong day for in-person instruction and have to go to work so they can't pick them up? And how will outside partners and faith organizations help out? Likewise, teachers, parents, and community members raised the following concerns. One teacher stated, initially, I felt okay with a hybrid plan, but this changed shortly after the plans were released due to the gaps of information and reality that will be guinea pigs. I miss my students, I miss my classroom, and I miss my colleagues, but I am not ready to risk the lives of myself and others so we can pretend things are normal. A community member and member of the faith-based community also stated, now is the time when we have to come together as a city and community. We can't be afraid to use the village, and everyone is going to have to step up and do their part to ensure that this generation of students are not the next generation of individuals that don't have the proper skill set to be contributing members of our community 10 years from now. And lastly, one parent commented stating, one thing I struggle with is the idea of in-person schooling only being available to vulnerable kids with disabilities. My son has autism, but according to his IEP, he's supposed to spend most of the school day in a regular kindergarten class around typically developing peers. And if the only kids going in-person school are other kids with disabilities or kids who have who are otherwise vulnerable, how does this work? What does a least restrictive environment even mean in this context? Again, I want to thank all of the members of the Parent and Community Advisory Council who worked tirelessly to get us meaningful and genuine feedback from all stakeholders across the city. A copy of the full list of all feedback reported to the Parent and Community Advisory Council will be posted with written testimony of tonight's meeting. Thank you, Madam President, and that concludes my report.
Thank you, Mr. Akbar. When we have our first set of 40 speakers and the district has an opportunity to respond to the issues, we'll fold the concerns raised through our advisory council members into that group and look for some responses. We'll now continue with our student speakers and registered speakers who are registered to speak on action items we're considering this meeting. Ms. Rauch, would you please share our speakers policy and then call the first group of speakers?
Thank you, Madam President. On behalf of the Board of Education, I'd like to thank the public for the input on school district matters and issues, including those proposed for action this evening. To respect every speaker's time, we will be strictly enforcing the 3-minute per speaker time limit. There is an electronic time prompt that will be shared on the screen. When the timer goes off, your time is up. Student speakers, elected officials, and those speaking on action items have been prioritized on the agenda. Up to 3 speakers will address the board on each topic. Written testimony submitted in advance of the start of this meeting will be included as part of the record of tonight's meeting. When I call your name, please, your line will be unmuted by the host and you'll begin your testimony. And for the record, we do have more than 3 speakers on reopening issues tonight. As a reminder, we've grouped speakers in groups of 40, and we'll take a short break in between the groups for board members and Dr. Hite to engage in comments and questions. There are going to be 4 groups of speakers. Group 1 will include speakers 1 to 40. Group 2 will include speakers 41 to 80. Group 3 includes speakers 81 to 120. And then group 4 includes speakers 121 to 153. Everybody just note this, speakers 81 through 108 in group 3 are speaking on action items, so they will be called before the board votes on agenda items. The remaining speakers in group 3, even though it's still group 3, which are numbers 109 through 120, will be called after the vote. So you'll need to make sure you're still on at the right times. Please remember that there is a 2-minute time lag between our live stream and the Zoom platform. As we approach your speaker number, please make sure that you're by your phone, computer, or whichever device you're using to access Zoom. Due to the high number of speakers, if you miss your slot, we will not be able to move backwards tonight or to move people to the end. Okay, I'm going to call 5 speakers at a time just so folks are ready. The first speaker will be Ahmed Adam, then James Sumter, Margaret Stewart, Shyla Street, and Haley Ivory. So our first speaker is Ahmed Adam, please. Is Ahmed Adam here? Okay, we'll move to our second speaker, James Sumter. Question to our host, we're okay technically, so I can keep calling names?
Yes, please continue.
Okay, thank you. Margaret Stewart. Margaret Stewart. Shayla Street. It may be Shyla Street.
Oh, hello. Yes. Now it finally gave me the thing to unmute.
Okay. You can start. Thank you. And please say your name at the beginning.
Hello, my name is Shayla Street, and I'm a rising senior at Central High School. Black Lives Matter means so much more to me than we should not be killed by the police. It means the quality of our lives should not be lesser than. Schools play a major role in whether we actually make this aspiration into a reality. When I first started high school, I felt unwelcome at my own school. I remember being the only Black girl in a gym class with over 60 kids. I walked in every day with extra stress just because I was not willing to be silent about the racial injustices in my school. We demand a process for protecting students and staff who report violations of racism and discrimination. While at Masterman, I joined the diversity committee and pushed for Black student recruitment. However, even after the administration, teachers, and parents heard students talk about some of the experiences that are now being exposed on the Black at Masterman page, they deflected from these issues and said, we cannot lower our standards to admit more Black students. Lowering standards is not necessary, but having Black representation on admission committees is something we demand. We need teachers and school leaders who understand that uplifting the Black community raises the standards for everybody. Transferring to Central, I was so excited to finally be around Black students and teachers, not knowing that this school has similar issues to Masterman. It makes no sense that my class's Black student population is more than 10% higher than the next class's Black population. This is a district-wide problem. Black student populations are diminishing at magnet schools. It is so disheartening to hear alum talk about when these schools have Black populations that actually mirrored our city's demographics. Aren't we supposed to be moving forward and improving our schools? We can only do this if we include Black educators in this conversation as well. One of the best ways for Black students to be supported in school is by having Black teachers who are by their side. Teacher hiring committees must be made of faces that look like mine. These people must reflect the experiences of Black students. We demand it be required for Black students to serve on teacher hiring committees. After speaking with the Black Philly Student Alliance Group, I know that Black students face different challenges in all schools throughout the district. Although the experiences in magnet schools differ from neighborhood schools, there's one common factor. We are all Black students suffering who want the district to show that they care about our Black lives, education, and experiences by supporting and implementing our demands. This includes the demands of the Racial Justice Organizing Committee, Central High School's demands, and Masterman's alumni charter. Each of you on the board must do better for us. Thank you for your time.
Thank you. Our next speaker is Haley Ivory, and I also want to just alert everybody to the next group of 5, so you're ready. Tatiana Roldan, Brandon Archer, Michael Vital, Yuma Diabira, and Kayla Gibson. Is Haley Ivory here?
Yes, I'm right here.
Thank you. You can start.
Hello, my name is Haley. I am a 10th grade biotechnology student. While I am excited to return to school, I am very much scared of the dangers returning will cause. I live in a house with older people as well as very young children. While I am not so concerned for my own health like many other youth my age, I am concerned that I may spread the virus to my more vulnerable family members. I understand that I have the opportunity to go fully remote, but then I give up the opportunity to participate in the biotechnology program. In trying to reopen schools with one plan for all schools, students and families, I am afraid you missed the mark on creating an equitable plan, one that supports the diversity this district is comprised of. In addition to my concern around school reopening, I want to bring to your attention another inequitable move made by the school district. It has come to my attention that I will be rostered into a second English class called English Intervention to help prepare me for Keystone assessments. I am aware, as you should be, that the state legislature has approved and signed by Governor Wolf Act 1 of 2016, which removed scoring proficient on Keystones as a sole requirement for graduation. Actually, there's language that prohibits cutting CTE and other electives to allow space for interventions. This is exactly what has happened to me and many other students in the CSI schools. So now, instead of taking classes and preparing for a future in the medical field, I am forced to prepare for a test that I have no idea will serve to benefit me. Oh, and I should mention that I have a 3.8 GPA. As a freshman, I participated in a mini medical camp, and this year I am participating in the STEM Up program, both offered by Temple University. These are the type of programs that should be considered for students preparing for college and career. Thank you.
Thank you. Our next speaker is Tatiana Roldan.
Hi, my name is Tatiana Roldan. I'm a student at Northeast High School, and I am a member of a newly formed group known as the Black Philly Students Alliance, or the BPSA. We are a group of Black students and teachers across Philadelphia, and the reason behind our alliance is to shed light and bring change to the racial injustices taking place in our Philadelphia schools. It's 2020, and I'm allowed to take advanced placement courses as a high school student. I'm allowed to join clubs and sports teams with diverse members, and I'm even allowed to come to meetings like this and express my utter disgust with our current administration selections in hopes that it will change. However, it's 2020, and somehow racist and prejudiced administrators are continuously slipping through the cracks of our school's hiring process. The fact that a white science teacher can walk into a classroom full of minority students and repeat the word nigga and not lose their job is a problem. The fact that Black students are being asked by white teachers if blackface is even that big of a deal is a problem. The fact that I am just now hearing about the repulsive acts of racism that are taking place in not only Northeast High School, but at Masterman and Central as well is a problem. I, as a Black student, should feel confident that not only myself, but my peers are respected for who they are. This is why I am demanding a student voice on the Teacher and Hire Committee. We as students have to learn from the teachers you hire, so why do we not have a say on who the hell these people are? I am also demanding the implementation of a racial equity board in all Philadelphia schools, and beginning with Masterman. This board would be a safe space for students and teachers to report issues of racism and discrimination that they have faced in their schools. It's 2020, and I'm demanding changes in our school that should have happened years ago. It's 2020, and I am begging you to stop ignoring our pleas for help and use your position to do something. Thank you.
Thank you. Brandon Archer.
Hello.
Thank you. You can start.
Perfect. All right. Good afternoon. My name is Brandon Archer. I'm a senior at Masterman High School and part of the newly formed BPSA. From my last 6 years at Masterman, it has always prided itself on being racially aware, diverse, and an inclusive environment, but it has not been until recently that the veil was lifted in such a public way. I've requested to speak today because I'm calling on the school administrators, specifically Principal Brown, to accept the comprehensive charter proposed by the Masterman Alumni for Change, which calls for a transparent admissions process in magnet schools, a racial equity board, a dress code that does not over-sexualize our Black girls, adequate harm reporting procedures, and subsequently proper disciplinary action. Any system that punishes a child for speaking out against racist behaviors rather than the racist student, as has happened to me in the past, is dangerously out of tune and only further silences our voice. If these requests, which have been made by our Black students for decades, had been implemented, maybe there could have existed a reality in which I was not the only Black student in my regular and AP classes, a reality where I wouldn't be able to count the number of Black teachers we have on one hand, or a reality where I was not told to simply forget about the multiple instances of racial harassment and trauma induced by my classmates and faculty, from social media accounts being made about me, verbal harassment, or class assignments where a white teacher made us write our own plays, pretending we were slaves. It is not a question about if we need to implement these demands. It is a question about how long are you willing to wait at the expense of Black students. Our school's performative activism, from a failed diversity committee to trying to change students, rather than the racist institutions they've been placed in, must end. And it cannot be my sole responsibility or the 15% of us to resolve racial disparities in the state's top performing school. We have sacrificed our time, our youth, our mental health to constantly fight for, in addition to our academic responsibilities, and it is exhausting. Do you understand the gravity of this situation? I'm demanding that all of you on the board, in the school district, every teacher, care about our Black life, care about our Black education, and care about our Black experiences. Thank you for your time.
Thank you. Michael Vital or Vitali? Is Michael here? Okay, next speaker is Yuma Diabira.
I'm here. Can you hear me?
Yes, I'm sorry if I mispronounced your name.
Good afternoon. My name is Yuma Diabira, and I'm a rising senior at Central High School. I'm also the president of the African American Student Union at Central High School and a member of the BPSA. I've been in the Philadelphia School District for 12 years, and the same problems we had when I was in kindergarten are the same problems that we have now. In my 12 years in the district, I've only had 3 Black teachers. Black students who have Black teachers are 18% more likely to enroll in colleges. We need Black students that we choose to be added to the hiring committees at all schools. In my 12 years, I've learned more about my Black history from books than from any classroom. An expansion of our curriculum is not a suggestion, it is a must. It is no longer enough for us to say we are teaching Black history, we need to actually be learning it. All students should be learning of different cultures. The Philadelphia School District needs to do more. Teaching goes beyond reading books and writing papers. We need to be teaching students how to recover from their mistakes, how to learn from their mistakes. We need to be practicing restorative justice. We need to allow kids to make mistakes and know that with the right conversations and the right commitments, they can be reinstated back into their school environments without a target on their head or a label on their chest. We demand that the school district does better by students with all sorts of learning exceptionalities, from holistic approaches to special education to more gifted and talented programs in majority Black schools. Stop only giving these resources to schools you deem the top. Stop forgetting about the kids who lack only opportunity, not intelligence. We can't allow for our Black students to further be branded in classrooms. Central's Black student body has presented 10 demands to eliminate the anti-Black culture within our school. And our President McKenna has vowed to implement all of our demands, and we will hold him accountable for these commitments. Jessica Brown, principal of Masterman, needs to do more. She needs to accept this charter made by the Black students and alum who have attended the school far longer than she has worked there. The Black Philly Student Alliance stands with Central and Masterman to get these demands enforced within their buildings. Ms. Brown needs to know that she will be held accountable for both what she does and does not do. She needs to stop running around the issue. The students at Masterman have begged her for change. She has denied it. This is not just a Central or a Masterman issue. This is a public school issue. Dr. Haidt, you have to do more. We cannot keep hiding the blatant racism in our schools behind magnet school names and reputations. For many students, schools are the only safe place they have. This issue cannot be put on the back burner. It's about the physical, mental, and emotional safety of students and should be weighed as heavily as meeting about the current pandemic. The principals at these schools need to do more. Dr. Haidt, what are you going to do about these demands? And are you going to begin to hold principals accountable for failure to implement them? Thank you.
Thank you. Kayla Gibson is our next speaker. And then just so everybody's on deck afterwards, our next group is Miriam Sissoko, Stanley Gao, Alexis White, Samaya Smalley, and Representative Dwight Evans was listed, but he's in Washington and unable to provide his testimony this evening. So Kayla Gibson is next. Is Kayla Gibson here? Okay, and then our speaker after that, Actually, I'm not sure if it's Miriam or Miriam or Miriame, I'm sorry, Sissoko?
It's Miriam. Can you hear
Miriam.
me?
Yes, we can. Thank you. And I apologize if I mispronounced your name. Thank you.
Hello, my name is Miriam Sissoko, and I'm a recent graduate of Central High School. Earlier this summer, we all witnessed the racial unrest stemming from the brutal murder of George Floyd. Like my peers from the BPSA that spoke before me, I am here to address the racism that resides within the School District of Philadelphia schools. Mainly, I urge that the School Board of Philadelphia publicly commit to establishing mandatory anti-racist training alongside the active recruitment of Black teachers. During my time at Central, I witnessed and experienced multiple cases of racist insensitivity from teachers, faculty, and counselors. One instance I'll never forget was when a close friend of mine had an emotional breakdown due to the barrage of microaggressions aimed at him as a young Black man. Teachers and students treated him as a stereotype versus a human being with emotions, wants, and insecurities. They expected him to be angry and aggressive versus the soft personality he actually exhibited. When I grabbed a counselor, her response was lackluster. His issues were downplayed, and the counselor could not understand his position. It seemed as if she refused to see his race, and as a result, refused to see him. This white counselor dismissed that his feelings stemmed from race, further exacerbating the root of the breakdown in the first place. This incident is one of many that highlight why anti-racist training is pertinent to a healthy and prosperous school environment. Black students need to be able to address how race affects their mental health. They need to have a community that supports them fully. It is widely accepted that having Black teachers in classroom directly correlates with the success of Black students. Black teachers provide Black students with familiarity and teach with a softness that allows them to not be confined by their race. Over the past decade, the number of Black teachers in the Philadelphia schools have steadily declined, causing unknown damage to the psyche of Black students. Anti-Black racism festers in every single one of us like a cancer. The school district must take an active and ongoing approach to combat it. COVID-19 has exposed the inequities in our society, but has given us the opportunity for immense progress. I encourage school districts to support Central's demands, Masterman's charter, and the demands presented by the Racial Justice Organizing Committee. It is no longer enough for the school district to be race blind, but race brave. Thank you for your time.
Thank you. Stanley Gao. Stanley Gao.
Can you hear me?
Yes, we can. You can start. Thank you.
Hello, my name is Stanley Gao. I am an 8th grader from McCall Elementary School in Society Hill. The school district announced the school reopening plan last week and gave students and families two choices: digital academy or hybrid learning. McCall School has a high population of Asian students / families who know the risks of doing hybrid learning in the midst of this COVID-19 pandemic. Many of them want to choose the digital academy the school district is offering, but don't trust it. As an 8th grader at McCall, students that are capable of taking Algebra 1 and biology classes are offered those classes. I don't believe that the Digital Academy will teach those to me or teach it to a point I will understand it. So I thought of a plan, a possible scenario that will work well with schools and families that don't know what to choose. The plans for people who are wanting to do the Digital Academy will want their own teachers to teach it and to learn it with the same classmates in our homeroom. The school district may buy some cameras distributed to the schools. The school may install the camera in the back of every classroom. The students and family who want to do Digital Academy can learn virtually directly from the live recording camera in the back of the classroom while the teacher is teaching the students in the front of the classroom. I hope you take this plan into consideration. I want teachers and students to be safe as possible. Although education is important, education in person is better and more effective for most people. We all know safety is always first. I believe the virtual learning plan I stated reduces the risk closer to zero compared to the current in-person teaching or digital academy plans. I also believe this will benefit lots of families who are stuck deciding which type of learning they should choose. Thank you for listening.
Thank you. Alexa.
Ms. Rock, I just got a message that Kayla, who you previously called, was trying to get off mute and couldn't, and she was there waiting. Kayla Gibson.
Yes, I don't. We'll have to. I'll have to check. Our next speaker is Alexis White, and I'll text with our host to see if that's possible.
Board Member Fix Lopez, my apologies for the interruption, Ms. Rauch. Her system is out of date, and unless she joins by phone, we are unable to connect as per the messaging that went out to her this morning. Thank you.
Thank you.
Okay. Who is on now? Is this Alexis White? Is Alexis White here? Okay, moving on. Samaya Smalley.
Hi, I'm here.
Thank you. If you could start.
Hello, so I'm a rising senior at Central High School, and I'm here for the Black Philly Students Alliance. So everything I'm saying is an echo and reiteration of what me and my peers have been saying for years. So for years, we have tried to speak out on the discrimination and unfair treatment that Black students go through every day in their learning environments. Black students deal with microaggressions, harassment, and criminalization simply for seeking out education. And this is not something new, it's something I've seen and dealt with since middle school. Whether this comes in the form of peers freely using slurs towards Black students or teachers isolating and targeting us in classrooms, it's affected the mental health and general well-being of students in Philly. This is why I want to emphasize demand number 8 of the Racial Justice Organizing Committee, which is the need for standardized anti-racist training for Philadelphia staff. Not only are these biases directly harmful for students, but they facilitate an environment where white students feel comfortable disrespecting their peers and other students too. These implicit biases go as far as directly impacting the advancement of our education. Something that a Black girl or Black child would get suspended for is something that a white student will be reprimanded for. It even affects how we learn about Black history. African American history can be taught by teachers with biases, and it won't give the full effect as someone who is dedicated to the cause. Because these racial stereotypes and biases that many principals and teachers have, Black students aren't allowed to be opinionated, angry, or sad without facing criminalization from the people who are supposed to nurture and educate us. We aren't allowed to feel 100% comfortable in our classroom. It's not fair that some students are given an opportunity to flourish while others are targeted and disrespected by peers and staff. This has lasting effects, such as Black students' decisions to go to college. It contributes to the school to prison pipeline and other things that have been generationally oppressive over time. Black students are the future of Philly and the world, and we deserve to be treated as such. Thank you. That's all I have to say.
Thank you. Representative Evans is not here, so our next group is Council Member Helen Gim, then Jerry Jordan, Robin Cooper, Dayanaba Daiwa, and Cindy Farlino. So Council Member Gim, are you on the phone?
I am.
Thank you. You can start. Thank you.
Thank you. Good evening, everybody. I want to thank and acknowledge the hard work the district has put into its reopening plan. Despite this incredibly hard work and the best of intentions, though, we are headed into a school year full of uncertainty. So first, I would urge you to treat the testimony you hear tonight from the community as experts. Tonight, there are over 150 parents, principals, teachers, youth, and community leaders who are testifying about the urgent needs of our young people at this time. They are identifying areas of concern, places where there can be bridges and opportunities for collaboration. I am here to listen to them and urge you to also be accountable to and responsive to the very people who are key to making any reopening plan successful. I have to add that I'm also disappointed at the level of conversation between the district and PFT. The district must continue its conversations with PFT leadership and its president. Anything less will be insufficient. Second, I urge you to measure our preparedness based on the level of school-based health resources. I am concerned about the district's reliance on individual schools and families to self-screen for health problems when we have far too few health professionals in our city schools, and so many parents have lost employer-based health insurance. Third, I ask that you are vocal and specific in your call for the city to aid the district. The reopening of schools is the most far-reaching, proactive, and affirmative public health effort since the COVID-19 pandemic began. The district absolutely cannot do this by itself. And I want to apologize to the board that we should have been doing more as a city. We, the city, should be partnering with you to assist with trainings and coordinating with health professionals to assist with daily school screenings and the monitoring of health protocols by our health department. When a child is found to be COVID positive, we need to immediately figure out coordination with our city's health, DHS, and housing departments to ensure a child and family can quarantine safely. The Office of Children and Families must be a partner in finding community-based education hubs as potential alternative classroom sites to help expand the district's educational learning options. I hope to work with each of you to make sure that this happens. And finally, I urge you to prepare for the inevitable Plan B. I think we have to be incredibly honest that despite the most detailed plans laid out here before us in July, we need to know clearly that there needs to be a standard and threshold that will be used to determine whether schools actually open in September. More and more school districts are announcing that they are headed to a virtual fall. And we do have to prepare for a reality in which schools may not open or cannot stay open. I've focused on a demand for our city's internet service providers to guarantee that connectivity will not be based on a child or family's ability to pay for broadband access. We must hold our major providers, including Comcast, accountable to open up their residential hotspots to ensure that all students have a shot at their education. And the board's voice in this advocacy is imperative. Together, we should also demand that Congress pass the HEROES Act as soon as possible with a massive infusion of resources for historically underfunded school districts like ours. The care and keeping of our children is all of our responsibility, and may history remember us for that. Thank you.
Thank you. Before our next speaker, I just want to address Kayla Gibson and Board Member Fix Lopez's letting us know that she had tried to connect. All speakers who had registered received tips on how to access Zoom. And there are certain technical reasons why if people cannot connect, we're not able to add them back later, given all of the numbers of people we have. We would encourage her and anybody else who misses their slot to submit written testimony to the board. With that, we will move to our next speaker, who is Jerry Jordan.
Good evening. I'm Jerry Jordan, president of the Philadelphia Federation of Teachers. PFT members want to be in school supporting our students face-to-face as long as it is safe. And that's not selfish, it's human. But students and staff cannot be asked to jeopardize their lives and the lives of their families by passively accepting a plan that is, as it is currently written, entirely insufficient and lacks absolutely non-negotiable safeguards. The PFT has released a series of requirements for schools reopening rooted in protecting our young people and educators. And number one is virus tracking. Without a sustained positivity rate of lower than 5%, which Philadelphia is currently exceeding, combined with a sustained reproduction rate of lower than 1, it will be unsafe for buildings to reopen. These metrics must be the foundation of decision-making. And even then, we can only consider reopening buildings if the plan that the district intends to use is workable, rooted in science, and enforceable. And right now, the plan, as it is currently written, is terrifying. Terms like when feasible scattered throughout the plan will literally mean life or death for educators and students. The failure to adopt even the PFT's most basic requirement around square footage calculations is infuriating. I've heard stories of principals going into buildings and literally measuring rooms. While I applaud their effort, the fact that they are being put in this situation is reprehensible. Under no circumstances can it be left to the individual school administrators to measure, develop, and implement a program of this magnitude. Similarly, perilous issues abound regarding ventilation. Fresh airflow is critical. And by that, I mean scientific measures evaluated by scientists. There are hundreds of issues I could discuss at length regarding the district's plan. The PPE provisions are absurd. To supply employees with one complimentary cloth mask per year, with only some teachers receiving face shields and masks, is insulting. Further, the lack of specialized PPE for our teachers, nurses, and support staff who work with students with complex physical needs is reckless. Our plan right now cannot be based on an assumption. It is the end of July. we have upticks in cases and an irresponsible plan. This is why we have been adamant that the district must be planning a robust remote learning program now. What I've laid out today is a fraction of the concerns we're hearing from our members. We've received over 4,000 questions and regarding the opening.
Thank you. Our next speaker is Robin Cooper. Is Robin Cooper here?
Good evening, school board members, Superintendent Height. Hello, my name is Dr. Robin Cooper. I represent Teamsters Local 502, Commonwealth Association of School Administrators. This evening, you will hear the fervor, the outrage, and even the hope of some of our members as we address two topics that our membership is very passionate about: school opening and systemic racism. On the topic of school opening, our position is simple. Not one school should open for in-person learning until the district has developed a plan that addresses the many remaining unanswered questions concerning safety. On the topic of racism, our position is also clear. The district must address the systemic racism embedded in its policies and practices to ensure that all students and staff have access to opportunity, growth, and success. Currently, this is not the case, which is why CASA is and has been advocating for a diversity, equity, and inclusion department. As we share our hearts this evening, know that we are guided by the words of the late Congressman John Lewis. There is nothing wrong with a little agitation for what's right or for what's fair. Amid growing questions and much anxiety regarding the safety of students and school staff, on Wednesday, July 15th, the School District of Philadelphia announced that it would reopen its schools in the fall of 2020. This despite the uptick of new cases of COVID-19 in Philadelphia and surrounding municipalities that prompted Mayor Kinney to place a moratorium on the city's issuance of permits for outdoor gatherings on public property of more than 50 persons until February 2021. This raises the question, is it not equally threatening and unsafe for students, school faculty, staff, and their extended families for school buildings to be open for in-school, in-person learning in the fall? We are certain that the decision to reopen schools was not an easy one to make. Nonetheless, the call has been made to not only put students, staff, parents, and administrators in harm's way, but to also show that the school district and its Board of Education are more concerned with rebuilding the economy than protecting the lives of children who, among the statistics, are among our most vulnerable populations. According to the school district, fast facts, our student population is 52% Black, 21% Latino, 7% Asian, 6% multiracial, and 14% white. It should be noted as well that the school district identifies its student population as overwhelmingly economically disadvantaged. What's more, this intersection of race and poverty amongst our students places them and us in an even more precarious position than our affluent surrounding districts. Despite the district's mantra, the reality is the quality of students' education is determined by their zip codes. We should not have to teach students to death. Thank you.
Thank you. Dayanaba Daya, and I apologize if I mispronounced your name. Is the speaker here?
Hello, yes.
Yes, thank you. You can start. You can start,
Okay.
thanks.
Yes, good evening. My name is Jena Bajau. I am a parent of 3 children that attend Penn Alexander School. I am also an early childhood educator who teaches and nurtures young children's social emotional development, and with the district's plan, I may be forced to quit my job in order to ensure my children's education. And I also know most parents who are dealing with the same situation. I am here to let the school board know that we believe the 2020 reopening plan is not a feasible one. We understand that as parents of children at Penn Alexander, our school is one that has accessibility to a high amount of resources. But we also understand that our school is not the norm and that most schools in the district do not have access to the resources that we do. And we are here to advocate that this plan is not viable for anyone, given the condition of many schools across the city that are under-resourced. This building buildings will not be ready to provide a safe or healthy environment for our students and teachers in September. There are not comprehensive processes and policies in place in all of the schools to ensure that all students and the staff will be truly supported physically, socially, emotionally, and academically, both prior to the school year and throughout the school year. We ask that the plan be reconsidered and the district commit to starting the school year all virtually, then following up with an alternating A-B schedule. Have a definitive plan with internet providers to ensure that all students and families have easy access to free, stable internet. Also think of immigrant families and single parents and other workers who have to go to work in person and cannot afford paying for childcare. Thank you.
Thank you. Our next speaker is Cindy Farlino, and while Cindy Farlino is connecting, I'm going to announce the 5 speakers after that. Ariel Benitez, Leslie Mason, Tara Ryans, Shakai Dupree, and Tony Damon. And is Cindy Farlino here?
Yes, can you hear me?
Yes, you can start. Thank you.
Thank you. My name is Cindy Farlino. After 25 years of service with the school district as a teacher, as a director of instruction, and finally as a principal, I have retired. I am honored tonight to present the second part of the school district opening plan position paper by CASA that was begun by Dr. Cooper in her speech. While we understand and certainly emphasize with the burden that will be placed on parents who are often essential workers, we do not believe that the school district personnel should have to potentially teach students to death. And no, this is not speaking figuratively. Rather, it is a literal statement that underscores our very concern for our students, our parents, school personnel, and ourselves. This point seems to be clear to a number of other large urban school districts across our United States, including Los Angeles, San Diego, Nashville, Atlanta, Arlington, and Baltimore, all of whom have decided that the risk is not worth the demand. Unfortunately, and despite the scientific evidence and CDC recommendations regarding school distancing, which clearly state that virtual schooling is the safest option, the School District of Philadelphia's Board of Education and Superintendent have decided to ignore the scientific evidence and move forward with an ambiguous and ill-conceived plan. It's a plan that raises more questions than it offers answers, and it favors in-person learning. Thank you. And I also want to raise the public health approach, which is called the precautionary principle, that says we must err on the side of caution and protection of the most vulnerable. Thank you.
Our next speaker is Ariel Benitez. Is Ariel here? Okay, moving on, Leslie Mason.
Hi, can you hear me?
Yes, thank you. You can start.
My name is Leslie Mason, Principal, Thomas Mifflin School, and I will continue CASA's statement on school opening. We have shared and are sharing again the following strategies that we believe to be the best course of action. That includes that all students be taught virtually for the first 2 months of the school year as we carefully analyze the direction of COVID-19 virus, that the whole district training of school personnel to support the quality of instruction in a remote context, teacher collaboration and reflective practices to improve student outcomes, that students and parents have virtual access to school counselors and nurses, and that the school district behavioral health staff provide virtual support to students, families, and staff of the School District of Philadelphia. We must spend time now ensuring that our students have in-home access to virtual learning, computers, and free internet. In the words of Nelson Mandela, there can be no keener revelation of a society's soul than the way it treats its children. Thank you.
Thank you. Our next speaker is Tara Ryans.
Good evening. Can you hear me?
Yes, you can start. Thank you.
Good evening. My name is Tara Ryans. I am a Philadelphia School District Climate Manager. Regarding the topic of school opening, I stand with Teamster Local 502 CASA. As district administrators, our position is simple. Not one school should open for in-person learning until the district has developed a plan that addresses the many remaining unanswered questions concerning safety for students, families, communities, administrators, educators, and staff. In the words of the Reverend Dr. Martin Luther King Jr., there comes a time when silence is betrayal. Thank you.
Our next speaker is Shakai Dupree.
Can you hear me?
Yes, go ahead. Thank you.
Good evening. My name is Shakai Dupree Campbell. I'm the principal of Maya Middle School, member of Teamsters Local 502 CASA. Principal Campbell, do I need to enroll my son in cyber school? Is a question no principal wants to hear, but that I have been asked several times. A cyber school commercial comes on TV at least once an hour because they know parents are looking for a safe option to ensure student learning. Parents are looking to enrollment in cyber charter schools because they do virtual learning well. My parents are scared of the unknown because they don't know what's happening with the level of learning in our district. We have 16 cyber charter schools in the state of Pennsylvania, and according to data, their graduation rates, attendance rates, and state test scores are comparable to ours, if not exceeding us. So there is no reason to believe that our students can't learn in a virtual environment that is structured well. On March 13, 2020, face-to-face learning stopped and we went into triage mode where some students were given packets for learning, but for vast majority of our kids, there was minimal learning. Then the district went into digital learning, but we were not fully prepared with adequate learning expectations. And 5 months later, we are still not prepared. In these last 5 months, we have not tapped into certain resources like Blackboard to prepare for the inevitable. COVID-19 has forced us to engage in virtual learning. So there is no reason in the 21st century, in the 8th largest district in the country, all of our students are not one-to-one. Our teachers have not been developed in using simple technology learning tools such as Google Classroom and others. Throughout this whole time, we should have been focused on preparation to go virtual. Statistics show that due to an increase in COVID-19 cases, us becoming fully virtual may be our new normal. To that end, we need to spend the bulk of the rest of our time getting virtual learning right. What are we doing to invest in the curriculum, the technology, and the professional development to implement a strong virtual model where parents can feel confident in what is being offered? In the 21st century, every student deserves the right to be educated, whether face-to-face, hybrid, or virtual, through a strong instructional program. We need to begin by planning and supporting a significant district transformation that includes a learning management system, adequate devices for students and teachers, and network accessibility and connectivity. I am not naive to the fact that this is a tall order, but we have to meet this process with success. As I mentioned earlier, cyber charter schools are waiting to enroll our public school students at alarming rates. The state of public education is already experiencing significant funding issues, and the loss of some of our students will further deepen this crisis. Therefore, it is imperative to shift the focus to one that responds to the crisis and creates a digital learning environment that is both equitable and effective. If not now, when? If not us, who?
Our next speaker is Tony Damon, and then the 5 after that are Alma Shepard Matsuo, Deanna Hubbard, Keith Arrington, Sean Poole, and Olivia Jones. Is Tony Damon here?
Yes.
Thank you. You can start.
Good evening. My name is Dr. Tony Damon. I am the proud principal of Morrell Dobbins CTE High School and a member of CASA. Like many of my colleagues, I have serious concerns with the plan for school opening. As a school leader, I am committed to the education, health, and welfare of the members of my school community. However, the concerns that I will share have far-reaching implications beyond the Dobbins community and impacts a larger contingency of the school communities across the district. It also highlights the inequities that currently exist. For example, the AB schedule, where approximately half of the students attend school Monday, Wednesday, and the other half attends Tuesday, Thursday, may work for a small boutique school of 200 to 300 students, yet places far too many students in a school building that has 900 or more students. There are families that will have to make difficult decisions to opt for virtual academy for health and safety reasons. However, in doing so, they have to give up CTE and other elective courses that help students stay motivated and in school. While I'm on the topic of CTE, let me remind you that Senate Bill 1095 was signed into legislation in 2018. This shifts Pennsylvania's reliance on high-stakes testing as a graduation requirement to provide alternatives for high school students to demonstrate readiness for post-secondary success. Unfortunately, the School District of Philadelphia's practices are not in alignment with this legislation. This year, all CSI schools, most of which have a high poverty rate and a high percentage of Black and Brown students, had to completely cut and/or limit art, music, and in some cases, CTE offerings for 9th and 10th graders to allow for an English and math intervention class. As we seek to provide for the civil rights of all students and create goals to support student success, I ask that you keep this in mind and restore these much needed courses for our students. Lastly, if you are inclined to revisit the admissions process at any school, I ask that you look at the admissions process for all schools that currently discourage and discriminate students of color as suggested in the Pew Charitable Trust research shared in 2017. Thank you.
Our next speaker is Alma Shepherd Matsuo.
Hi, can you hear me?
Yes, thank you. You can start.
Great, thank you. My name is Alma Shepherd Matsuo. I'm an English teacher at Merle Dobbins High School. I want to speak to my concerns about the seeming contradictions that have been brought up between the district's plan that was released and then the number of town halls and virtual sessions that have been done. One example of this contradiction that I've heard just today is this emphasis on ventilation. The district's original plan seemed to have a strong emphasis on ventilation, which is something that many of my colleagues, including myself, both appreciated and felt concerned by because of our understanding and experience of the limits of good ventilation in our school buildings and previous attempts by many teachers to have those concerns addressed only to have them not be addressed. Now I'm hearing from today's session that ventilation is not necessarily an issue. So I'm curious which one it is. Is it that ventilation is a big issue that's going to be a big part of the plan to ensure the safety of our students and staff? Or is it something that's not that big an issue? I'm seeing other diametrically opposed issues when it comes to things like masks. We see and appreciate that the district is willing to offer masks up to students, which is wonderful. And yet teachers were told they were going to get one cloth mask as a complimentary item. When that was brought up earlier with the district's town hall just a few hours ago, we were told that it was really more of a gesture of goodwill and that masks these days are really more of an accessory, similar to, earrings, suspenders, things like that. So I'm wondering which is it? Is it that masks are a necessary item, something that essential workers like doctors and nurses are provided by their employers, something that the district understands is important enough to provide to their students? Or is it an accessory that's something that was offered just as a goodwill, the same way you would offer a pencil or a free USB port? Some of these diametrically opposed things I'm also seeing when it comes to the discussion of why we're sending our kids back to school. I recognize that many of the reasons that are focused around sending kids back are to make sure our students are taken care of with their socio-emotional needs. The school environment can often be a really welcoming place for students where they can be cared for and ideally be given strong support with their social groups and their personal needs. And yet that student who spoke earlier, Haley Ivory, she's my student, and she was absolutely correct when it comes to the number of tests. The district does not have a great record of prioritizing student socio-emotional learning needs when it comes to these buildings and comes to these settings. My freshman students last year had to take about 5 different assessments in a matter of 8 weeks. So how now are we going to be prioritizing the socio-emotional needs of our students? And what are we doing with the curriculum that's going to be focusing primarily on those needs if we are finally acknowledging that those are some really dire needs by our students and are some of the biggest reasons to have students in the school buildings? Thank you very much for your time.
Thank you, Deanna Hubbard. Is Deanna Hubbard here? Okay, moving to our next speaker, Keith Arrington. Okay, Sean Poole.
Yes, can you hear me?
Yes, you can start. Thank you.
Good evening.
I am one of the assistant principals at George Washington High School in Northeast Philadelphia. I also am honored to serve as one of the assistant principal stewards for Teamsters Local 502, the Commonwealth Association of School Administrators, or CASA. I have been a teacher and administrator in Philadelphia's public schools for 25 years now. I know that many of our students and their families rely on our schools for more than just education, and that the overwhelming majority of our students, families, educators, and support staff want to return to some kind of pre-COVID-19 normal as soon as possible. But unfortunately, it is nowhere near the time for that. And while there are no easy choices to make here, the decision to keep all school buildings closed to students nationwide until they truly can reopen safely is the sanest one. We as a nation are in the middle of something one of my beloved former principals, now retired, would call a hot mess. While we may not have helped to create it, it is impossible for us to ignore it. We are now more than 1/3 of a year into our country's exposure to COVID-19, a deadly contagious virus with no known cure or vaccine, and yet we still have no comprehensive national quarantine program in place. This is in spite of the fact that our country has more than enough resources for all of its citizens, except our most essential workers, to remain safely in quarantine throughout this crisis without having to worry about where we will get our next meal, rent payment, mortgage payment, utility payment, or other important concerns. Meanwhile, even our essential workers still are often forced to perform their jobs without adequate personal protective equipment, additional pay, and/or the other supports they require and deserve. The undeniable fact that the government of the US, the richest country on the planet, has done the worst of all nations in containing COVID-19, continuing to post by far the highest numbers of cases and deaths, speaks volumes about the quality of our nation's overall leadership, planning, and programs. Nevertheless, we in the School District of Philadelphia cannot pretend that the situation I've just described does not exist, and that therefore it somehow will be safe enough to reopen our school buildings to staff and students next month. Doing so only will make this deadly situation worse, not better. Our state, local, and school district leadership should accept this reality and begin planning together now, in close collaboration with the district's administrators and teachers, the best possible remote learning programs and other student and family support programs that we can, instead of using what little planning time remains this summer on the truly impossible task of safely reopening any of our school buildings this early into this ongoing pandemic.
Our next speaker is Olivia Jones, and I want to let everybody know that while we have 10 speakers left in this first group, the board is going to send out sign-in information to the next group of speakers, so speakers 41 to 80, and we ask that all speakers in group 2 please check their email so that they'll be prepared. Thank you. Olivia Jones.
Hi, can you hear me?
Yes, thank you. You can start.
Good evening, board members and fellow virtual attendees. My name is Olivia Jones. I'm a member of Masterman Alumni for Change, but today I'm speaking as a member of CASA, Teamsters Local 502. Like the larger Advancing Education Safely plan, there are many missing details in the district's return to play plan. How are coaches expected to monitor symptoms and train athletes simultaneously, clean athletic facilities and equipment prior to individuals' arrival, provide in-person COVID-19 screening surveys to students without cell phones, and record all athletes' survey responses while also running a practice or coaching a game? Of course, we all agree that physical activity and athletics are important to students' mental health as well as to their future opportunities. Yet increasing the interactions amongst individuals and with shared services unnecessarily risks the lives of all school community members and our families. Since your decisions are based on scientific data, let's review comparable school reopenings around the world where children were rushed back to school for the sake of the economy, while cases were still high or rising. In China, Beijing schools reopened in phases in April and May. All staff were required to be tested prior, but 137 new cases in 6 days prompted officials to close schools again in June. In South Korea, schools reopened in May. 1 day later, 79 cases were reported. Officials closed 200 schools. In France, schools also reopened in May. Students were socially distanced with 15 in a class, but 70 cases were linked to the reopening, so buildings were closed. In Israel, schools reopened in June, but closed after 2 weeks because 244 students and staff tested positive, 130 in a single school. In Texas, 55 cases arose at child care centers upon reopening mid-May. That number leapt to 1,799, 592 of whom were children on July 9th. Just last week, Nueces County reported 85 infants tested positive. It is clear children do contract the virus when participating in the community. Premature reopening of schools accelerates a spread in larger society. Germany, Austria, and Denmark were successful because they logically ensured a low baseline rate of infection first. New US cases are at 71,000 a day, and summer travel is out of our control. Hence, US passports being banned from 33 countries. I ask you, esteemed school board members who will not be in schools daily, what number of school-related coronavirus cases will you tolerate before shifting to virtual learning again? Who will guarantee medical treatment for lasting respiratory, cardiovascular, and neurological damages of survivors? How many deaths of students and our staff will you find acceptable? I'm the caregiver of 2 young children and a disabled spouse. Who will care for me if I become sick? What insignificant words will you tell my family if I die?
Thank you. Our next group of speakers will be James Murray, Kayla Johnstone, Maya Johnstone, Claire Murphy, and Pat Kingsley. So James Murray, are you on?
I am here.
Thank you. You can start.
Good evening, everyone. My name is Dr. James Murray, and I am the principal of the William Rowan School. Regarding the topic of racism, I stand with Teamsters Local 502, CASA. As district administrators, our position is clear. The district must address the systemic racism embedded in its policies and practices to ensure that all students and staff have equal access to opportunity, growth, and success. The world watched as a police officer held his knee on the neck of George Floyd. Since that time, there has been a dismantling across the nation of the symbols of the systems that have historically held people of color as inferior. In the school district of Philadelphia, there is systemic racism that has been in existence for years through practices that have been consistently reinforced under the current administration and throughout the district. These biases, attitudes, and beliefs serve as a launchpad for policies and practices in this district that continue to perpetuate the achievement gap for Black and Brown children. These practices need to be identified and eliminated immediately for the betterment of our students and the well-being of our entire city. As such, we are calling for the abolishment of all practices that serve to perpetuate institutionalized racism and desperate outcomes for Black and Brown students. Thank you.
Thank you. Our next speaker is Kayla Johnstone. Is Kayla Johnstone on? Okay, moving on, Maya Johnstone.
Hello, can you hear me?
Yes, thank you. You can start. Yes, please start.
Is it Kayla or Maya? Which one are you calling on?
Kayla was called first.
Yes, that's Kayla. Oh. Good evening, Dr. Height and board members. I'm a proud principal of FS Edmonds and a product of the Philadelphia Public Schools.
We're unable to hear you.
Kayla, they can't hear you. Sorry. Good evening, Dr. Height and the board members. I'm the proud principal of FS Edmonds Elementary School and a product of the Philadelphia Public School System. I want everyone to be mindful of the monumental acts of our teachers who will literally be asked to fight this pandemic every minute while in school, juggling to master providing instruction, which includes a new reading framework for many and create a culturally sensitive environment. Earlier, you mentioned in a new initiative, Healing Together. Teachers have yet been trained for the new initiative or the Healing Together initiative. Moving forward, I hope our teachers and our school staff are consistently thanked for being frontline heroes. So on the behalf of principals everywhere, I just wanted to take this time in advance to thank teachers and school staff for working selflessly for our students. It is my hope that we use the remaining weeks of this summer to prepare effective PDs for our staff. Also, I think the district must act with a sense of urgency to describe exactly how the hybrid will operate. As of now, I understand that the students have 12 hours per week of face-to-face instruction, whereas they usually receive 30 hours. This is disheartening as our children are already on the wrong side of the achievement gap. We cannot implement a system where our students will lose 18 hours per week of instruction. Virtual instruction lends itself to students receiving more instruction during the week by their homeschool teacher. If we truly believe children come first, then we must act like it. Thank you.
I'm sorry, I was on mute. Our next speaker is Maya Johnstone.
Good evening. My name is Dr. Maya Johnstone. I'm the principal of Wagner Middle School. I will be continuing CASA's position regarding systemic racism in the district. As such, we are calling for the abolishment of all practices that serve to perpetuate institutionalized racism and disparate outcomes for Black and Brown students. Students being suspended for minor infractions at twice the rate of their white counterparts, which contributes to high dropout rates. Discriminatory admissions policies that discourage Black and Brown students from applying to schools of choice. Ensuring that students have equitable access to aesthetically attractive, clean, safe, and healthy schools that are free of pests, lead, mold, and asbestos, regardless of zip code. The district's failure to properly recruit and retain teachers, particularly teachers of color, has led to a recruitment policy which results in a placement of disproportionate number of TFA teachers in schools and learning networks 2 and 4, serving primary Black and Brown students. The elimination of hiring practices that allow for the exclusion of African American teachers under the auspices of they are not a good fit. African American personnel being disciplined at 5 times the rate of their white counterparts, policies that allow for the exclusion of African American personnel for career opportunities and advancement. In order for systemic racism to properly be addressed by the School District of Philadelphia, the creation of a diversity, equity, and inclusion department is critical, with the sole responsibility to ensure that all entities are committed to educate all students. A DEI department will ensure that diversity is acknowledged and respected. Equity is a standard practice, and inclusion for all is basic standard. We are calling on the district to hire needed personnel to staff the department and address this critical issue. Further, we are calling upon the district to involve true stakeholders in hiring personnel for the strategic office. A committee or coalition, an ad hoc group is not sufficient because it lacks the permanence and the necessary checks and balances to ensure accountability. Like other large districts, this must be an office with key personnel designed to ensure that all schools, all positions, and all career opportunities are void of racism, implicit bias, and discrimination. Additionally, a DEI office should report directly to the school board in order to ensure objectivity, transparency, and addressing issues impacting Black and Brown students and workers. Nepotism, cronyism, and preferential treatment towards special interest groups must stop. It's time to end discriminatory practices that have long led to the segregation of students, negatively impacted the hiring process and advancement of Black and Brown.
Thank you. Our next speaker is Claire Murphy.
Hello, I'm here.
Okay, you can start. Thank you.
Hello, my name is Claire Murphy, and I'm a parent of a rising kindergartner at Houston Elementary. We've been very involved with the school and planned on her starting this fall, but now we just don't think that it's safe for children, teachers, or household members. We had been hopeful about the digital option because it originally sounded like we could remain enrolled at our school and be part of the community while staying safe at home, but I'm very concerned about two things. First, the description says that it will be 5 full days, 100% digital, but the plan gives no details about what that actually means. A kindergartner should not and would not do all their schoolwork at a computer for hours. I have a lot of faith that the kindergarten teachers at her school would know this, but we got absolutely no details on this proposed digital program. There should be options for kindergarten students to use real books and do writing and drawing on paper and do hands-on STEM and art projects, or just go and play, have a snack, rest with lots of extra time. There are huge ranges in reading and math levels at younger grades, and they should have individual or small groups at their levels and not have strict video call attendance requirements. I worry that a lot of parents who have other options will just withdraw from the district. My second issue is that it's not mentioned in the written documents, but on the Facebook Live yesterday, it was implied that there could be leveling and staff movement based on enrollment in the Digital Academy, which is extremely concerning. Staying enrolled and supporting our neighborhood school and transitioning back when it's safe would be our only reason for choosing the Digital Academy instead of withdrawing. All of this uncertainty has caused a huge dip in enrollment this year. Our school and families organization has made huge gains in the last few years, and this could undo all of that. The school board should do everything in its power to make sure that leveling and funding allocation next year is not based on the enrollment in the hybrid this year. Parents will be locked into this choice that might damage their school. If you don't announce going all virtual as soon as possible, students and good teachers might have to leave and not come back. I understand that this is an extremely difficult situation, but hopefully this is temporary, and we need to make sure that we still have a neighborhood public school to return to when this is all over. We should keep schools together and go all virtual before people leave in droves. So I wanted to ask, is there any specific information about digital requirements and curriculum broken down by age? And will the school board be able to ensure that neighborhood schools do not lose teachers and funding based on parents choosing to keep their families safe this fall? If the goal is small class sizes for safety, why would you take away teachers? Thank you.
Our next speaker is Pat Kingsley, and I'm going to ask the 5 speakers after that to be on deck. Stephanie King, Charlie McGeehan, Alexandria Henry, Helena Miller, and Regina King. Is Pat Kingsley on the phone?
I am. Thank you.
Thank you.
Well, I am the proud parent of a son and daughter, both of whom go to public school in Philadelphia. And I'm calling in to suggest to you in the strongest possible terms that you vote against any proposal that would have children attend live in-person classes in Philadelphia until we have got on the front end of the pandemic. What we know about the pandemic, a new virus to humanity, is that there are certain circumstances that exacerbate the transmission of the disease. That includes indoor activity, close proximity to other human beings, and prolonged contact and exposure. Indoor activity, close proximity, and prolonged contact. That is exactly what happens at school. There's a known dose-response relationship between exposure to the virus and infection. And kids that are in school together in the same classroom, breathing the same air, will infect each other. There was a suggestion that there are certain panaceas, like a Lysol spray or masks, which don't solve the problem completely. The primary mode of transmission of the disease is not from surfaces, and masks help because they absorb the energy of a sneeze or a cough, but they don't keep your fellow students in the classroom from breathing out. And it's those water droplets that are expelled that stay suspended in the air for hours, which cause infection rates to rise. The experience from across the globe, the experience from summer camps in the United States all demonstrate this to be true. If children are one of the doctors suggested that a basement classroom with no ventilation at all could be safe. That is absurd. Another of the doctors I heard say the Israel study should be rejected because it merely suggested that children can contaminate their family members. That is precisely the danger that opening the public schools provides. If there is infection, 20% of those people infected will be will suffer severe symptoms, including perhaps prolonged cognitive and respiratory issues, and 1% may die. This is a life and death decision. The virtual academy does not offer the benefit of continued education because it disassociates students from their teachers and their friends and their fellow students. And the perceived benefits of in class, I think, are imaginary. Forcing kids to sit apart, masked, without talking to each other, without interacting, eating alone at their desk. The virtue of in-person school is not there. Finally, if the board is going to require some in school, I would suggest that they have a choice, that parents be given the choice between going in person and online at that school.
Our next speaker is Stephanie King.
Hello, can you hear me?
Yes, you can start.
Thank you. Good evening. My name is Stephanie King, and I am the president of Kearney Friends at General Philip Kearney Elementary School in Northern Liberties. I am here to speak out against the reopening plan in general and specifically the Digital Academy. Respectfully, the Digital Academy plan is terrible. How will you keep the students connected to their school communities? Who will the teachers be? What will the instruction look like? And how can parents be expected to commit to an option with these questions unanswered? But more importantly, why are you putting parents through this? Why are we wasting our time on this absurd plan when we could be planning to start everybody online with our own schools and teachers? We could have been spending this time improving online instruction and increasing internet access. We could have made a plan like what others suggested earlier, using each school's own teachers. We could have been building up our school communities and preparing them for the coming year instead of watching all the middle-class white parents setting up pods and everyone else wringing their hands while we wait to see if you're going to force us to throw our kids and teachers into a volcano. You are forcing parents into an impossible choice, one that will decimate their neighborhood school communities such that there will be no community left. Kearney has teachers torn away from it every year through leveling, so I can only assume that we will lose teachers to the Digital Academy. However, our school has already been so thoroughly leveled that in grades 2, 6, 7, and 8, we've been reduced to one homeroom of students, making it impossible to social distance in those classrooms or provide the students with strong and consistent instruction in synchronous and asynchronous learning. We already have to fundraise for paper, so I have no faith that the masks and sanitizers offered by the district will be sufficient. I also didn't hear the part where internet would be provided free of charge to all Digital Academy students. So this choice is not really a choice at all for some families. I've spent hours upon hours trying to get families at our school online, doing your job for you. Some managed to get internet essentials, while others were still excluded for unpaid bills or documentation. Now they will be forced to send their child to in-person instruction regardless of whether a student or a family member has a serious health consideration. I am sure a great number of people worked hard on the Digital Academy plan, but you seem to forget that parents and students love their schools and their teachers. We don't want to send them off to die, and we don't want some knockoff cyber charter. Please do the right thing and start everybody online and keep us and our schools alive.
Our next speaker is Charlie McGeehan. Is Charlie McGeehan here?
Oh, hello? Hello?
Yes,
Can
this
you
is
hear me?
Charlie McGeehan. Yes, you can
This
start.
is me. Can you hear me?
Yes,
Can you hear me?
Yes, thank you. You can start.
Okay. Good evening. My name is Charlie McGeehan. I'm the building rep at the U School. We need to be able to both deal with COVID-19 and with racism at the same time, so I'm going to do that in my 3 minutes. I'll begin by saying that the only safe and logical decision, as all 36 speakers so far have said, is to start the year 100% online. I want to express my full support for the Racial Justice Organizing Committee's 10 demands for radical education transformation. I am glad to see that the district is starting an equity coalition, and I am hopeful that we can get comfortable saying the word anti-racist. I am concerned that educators in our district are being told that this coalition requires, and I quote, volunteered work and support that may go beyond the traditional work hours. If this district is truly committed to anti-racist work, you need to put money behind it and compensate people for their time. A team of 3 people from all of our 214 schools paid for 50 hours at the PD rate would cost less than $1 million. When we can afford to spend $31 million every year on school police, but you ask employees to volunteer their time for equity work, what message are you sending? You need to take up Philadelphia Student Union's call for police-free schools right now. Spend a little of that money compensating folks for their work on anti-racism and the rest hiring community members and training them in restorative justice like the students have asked for. As for the reopening plan, I trust it less every day. The plan will be implemented in a way that keeps students, families, and educators safe. Not a single student spoke tonight in favor of the plan. I want to focus the rest of my testimony on emphasizing, just like Stephanie did, exactly how bad the Digital Academy plan is. When the only logical and safe option is to start online, this choice system is going to decimate school communities. It is truly an awful idea. The original documents said that these students would remain a part of their school community, but what we heard yesterday from Dr. Haidt was that this would actually result in leveling of students just maybe before the leveling time. And that's going to be a massive disruption of our school communities. We also heard yesterday that the students had to stay 2 quarters even if the district went fully online, but Dr. Haidt reversed course on this tonight. And this idea is heartbreaking to me as a teacher. It is a truly awful position to be in, to know that our students and families who make the safe decision to start the year from home will not get the opportunity to work with the teachers at our school. And we already do much of our learning online, so it is incredibly frustrating for that to happen. And it doesn't have to be this way. We can start online, we can be safe, we can establish drop-in centers for students, but creating a whole new school is an absolute disaster. So as you sit to consider whether we should return to school buildings, you are meeting from home. This needs to change. The school board needs to be meeting in the same room, socially distanced under the same expectations of our classrooms. And ideally, you can use the least well-ventilated space that we'll use in September for students and educators just to model for us. We need to start the year online. It is the only.
Our next speaker is Alexandria Henry.
Yep, I'm here. Can you hear me?
Yes, thank you.
Awesome. Good evening. I'm an educator at Meade School in North Philadelphia, and I strongly believe that if we value the lives of our learning community, then we will not reopen schools. Now, according to the New York Times, Black and Latinx people are 3 times more likely than white people to become infected and twice as likely to die of coronavirus. The school district of Philadelphia is 73% Black and Latinx, meaning the students and families who we serve are in the most danger. We cannot open schools. Virtual learning is challenging, and the complaints from families and community members about virtual learning are completely valid. So let's address those complaints by first understanding the problem. This is a health problem as well as a racial and socioeconomic problem, and we need to treat it as such. For example, as previously mentioned, our budget can potentially receive an additional $70 billion from state and federal funding, such as passing the HEROES Act. Now, rather than invest in preventative measures for face-to-face learning, such as weekly PPE, appropriate and sufficiently stocked sanitizing supplies for every school, additional staff for sanitizing with appropriate equipment and supplies to clean every bus, hallway handle, and school, plexiglass barriers, how about we instead meet the needs of the community that we serve? Let's instead invest in high quality routine training on teaching and supporting virtually, providing school supplies for home use. Let's invest in financially supporting families who will lose their jobs for needing to stay home. Let's follow New York's model of regional enrichment centers to provide safe childcare for essential workers, citywide access to Wi-Fi, technological literacy support for families, students, teachers, counselors, and emotional support staff. Y'all, we must invest in and protect the communities we serve, because no person should have to decide if their life or the life of another is worth sacrificing for a quality education. Thank you.
Thank you. Our next speaker is Helena Miller. Is Helena Miller here? Okay, and then
I'm here.
oh, okay, thank you. You can start.
All right. My name's Helena Miller. I'm a parent of 2 students at Penn Alexander School in West Philly. I want to start by just giving a shout out to the prior speakers who've spoken with heart and research. I want to give a special shout out to the students who are speaking towards anti-racist efforts in their schools. And I hope that their voices and their messages don't get lost amid the impossible situation we're also discussing about reopening, or the plan for reopening schools in Philadelphia. I just want to start by saying I'm not only a parent of 2, I was a classroom teacher for 13 years. And I'm trying to wrap my head around the complexities and understanding that there's no risk-free answer to this problem that we're facing. I'm trying to speak from a perspective where we're prioritizing teacher and staff safety while still balancing the social, emotional, developmental needs of our students. I'm privileged enough to be able to send my kids to a school that is much more resourced than most of the schools in Philadelphia. Yet I am concerned that we still aren't providing the proper PPE to our teachers and our staff, and that for schools to reopen, we are assuming that we will be able to provide adequate janitorial staffing and cleaning supplies. I understand that you support this as well, but since those things were already in question last year at our highly resourced school, I can't imagine that this is going to be easily remedied this year. And I just wanted to hear more about how we are going to provide and create and secure the budget to make sure that our teachers are safe and our students are safe. You mentioned us also in terms of student and teacher safety, that you had considered the K-5 or K-6 students meeting in person all the time because they are less at risk both to get and to transmit the virus. And that you scrapped that for financial reasons, I believe. I had to half listen because of course I was parenting at the same time. I'm just wondering if that could be revisited, as well as the idea of meeting Monday, Tuesday, having a cleaning day, and then having the other students meet Thursday and Friday. Again, it's just a more safe approach if our teachers are and students are going to be going back to schools. So I just urge you to at least reconsider those things that would both align with the safety for everyone, as well as the social emotional need of the younger students who do benefit so much from the in-person education. I, again, appreciate everyone's efforts. I know this is impossibly hard, complex, and that there are risks no matter what decision that we take. And thank you for hearing our voices.
Okay, thank you. That brings us to the end of our group 1, our first 40 speakers. I'm going to just announce the first 5 of the next group so that they will be ready. But we are also going to be taking a moment for questions and comments by the board and the superintendent.
I'm sorry, did Regina King speak?
Oh, I'm sorry. Regina King withdrew her registration.
Okay, thank you.
I'm sorry I didn't announce that. After, pardon me?
I was going to turn it over to Dr. Height.
Yeah, I'm just going to announce the first 5 of the next group because timing may be funky from their end.
Okay.
Lachey Terry, Cleo Oakman Green, Nicole Dolan, John Nichols, and Maurice Jessup. This way we shouldn't have a problem with people knowing when to get on. Thank you, Madam President.
Okay, thank you. I'd like to give Dr. Height an opportunity to respond to issues raised, or Dr. Farley and his colleague, if their responses to the issues raised. We'll take a very abbreviated break for members who need to take an abbreviated break, and then we'll flow right into the second set of 40 speakers.
Thank you, Madam President, and all of the speakers, numbers 1 through 40. So thank you for speaking, and thank you for your comments. I'll be brief and try to theme these into categories so that we can keep this moving. One of the things that many of the students who spoke, and number one, thanks to all of the students who spoke about the need for both student voice and teacher hiring at their schools, the need to hire more teachers of color. And I think that while we have had an active increase and active initiatives to hire more teachers of color, I think more importantly, we should also be talking about more teachers of color in the schools in which those children attend. So the Mastermans, the Centrals, the other special admission schools should also have more teachers of color as well. Although we've seen an uptick in those number of teachers, I think it's really important that young people who want to be a part of teacher hiring should have that absolute opportunity to do that, just as if I support student leadership and student voice. The other thing I want to call everyone's attention to is a anti-racism declaration. And I know there's a lot of stuff on that website, and this has been on the website, but this notion about anti-racism and how we talk about racism in the school district of Philadelphia and how we learn to talk about it, how we are developed in order to be able to call that out, how we must engage in many of these difficult conversations becomes critically important as we move forward. And I'm not going to go over the declaration, but I think it's just really important for individuals to understand that I too find this as an issue that we must take on systemically, and I'm committed to doing that. And that someone spoke about the Equity Coalition. It was an invitation to all individuals within the district, representing multiple groups of individuals, not just a certain group or another, but all individuals to come together and really talk about how do we focus on many of the short-term things that need to happen. You heard about equity and anti-discrimination in practices and in hiring and in discipline. But we also have systemic policies that need to change, like rules around special admission schools and the criteria that may be different in school A versus school B. And we have to address that issue systemically. There are a couple of categories as well that individuals mentioned. And one, I do want to clarify, it was one of our principals who spoke, and the principal talked about cyber charters. And there was a comment made about because cyber charters perform better than actually cyber charters underperform, and their performance as well as their graduation rates are below our neighborhood schools. And so that is problematic. And I just think we should all be speaking about those distinctions with facts as we talk about cyber charters. And I would not recommend families to do those types of things. I think the other thing that's really important is that there's another principal who mentioned the Keystone requirements for CSI schools and the direction to cut classes for interventions. And this must be a misunderstanding because that was not the guidance. And we will work with all of the schools to clarify that. And the direction is not to create intervention programs or periods that are at the expense of other courses, particularly courses for which students chose to attend those particular schools. The ventilation point, I think, is really important, and thanks to many of the speakers who talked about that. We are assessing the ventilation of all of our buildings, so it's still very important. And we want to maximize ventilation using the guidance and best practices from OSHA and CDC and other organizations. The clear distinction here is when asked, Dr. Farley and the Philadelphia Department of Public Health referred to improving ventilation as part of a strategy to mitigate, but he talked about that should not prevent us from just focusing or solely focusing on ventilation, but make no mistake about it, we are focusing on ventilation, and where we don't have the appropriate ventilation, we will take those rooms, classrooms or areas of the buildings offline. The masks are essential or accessory, and all teachers will get more than just one mask. I mean, and I think that we can solve that problem. And if that's a concern of many individuals, we have to solve that. We have to solve that problem. The all virtual to keep schools together and not lose teachers, I completely understand that. And our curriculum is designed so that the expectations are the same as the instructional design in the hybrid model, but children will just be digital. The schedule takes into account the amount of screen time that students, teachers and students have together, and then there are opportunities for direct small groups, peer collaboration, and independent tasks. With respect to the collective bargaining agreement, though, we have to negotiate who will be assigned to a group of students that may be in person versus who are assigned to a group of students who will be all digital. As I indicated yesterday on Facebook, and I thought here earlier today, while the teacher may be different than the homeschool teacher, students will still be assigned to their home and neighborhood school. And that is intentional for the obvious reasons. If we ever come out of this, we want children to be able to go back to their schools. And so I think there were a couple of others that I think are really important. And the anti-racism training, everybody receiving that, we actually are working on professional development in order to do that. And so we will be mandating that everyone will have mandatory anti-racism training and anti-bias training as well. And then we are, and I want to emphasize this, actively recruiting Black teachers, and particularly Black male teachers. And so I do think that I was just trying to make sure we had as much information as possible. And we will provide more information about the Digital Academy. And the parent of the kindergarten student, talked about the description of the Digital Academy. I've heard that several times, and we will provide more information. We hope that will help parents make a more informed decision about what to do. This notion of leveling, I think, is really important. And my comments on the Facebook Live were really about, someone asked the question, will teachers still be leveled, or will we still have leveling? And my response was, based on how many children sign up for the Digital Academy or the 100% virtual, will determine how we place teachers based on the collective bargaining agreement and other things by which we have to abide. And so, but children will still nonetheless be assigned to their home schools. And what I indicated by saying we hope that we're doing all of this on the front end is because any teacher movement will then be based on how many children are signing up for the Digital Academy. And we have had schools that said, hey, can we run our own Digital Academy? And so we're exploring that as an option as well. Wish we had more information about all of these things, but information will be evolving as these questions evolve. And I think that is really important to express as much clarification around these issues as we possibly can. Madam President.
Thank you, Dr. Hite. Dr. Farley, are there any points you'd like to make at this point? I'm not sure he's still with us.
I don't believe he is, Madam President.
Okay, thank you. I guess we can go on to our next 40 speakers.
Yes, thank you, Madam President. Sorry, I lost track. Okay, our next speaker is Lachey Terry. Is Lachey Terry here? Okay, our speaker after that is Cleo Oakman Green. Is Cleo here? Okay, moving on. Nicole Dolan.
Cleo is here. I'm sorry. Hello?
Oh, okay, you can start. Thank you.
Good evening, everyone. My name is Cleo Oakman Green. I am a parent of 2 children who attend the Philadelphia Public School District. I just wanted to come over here really briefly and just to express my concern in regards to my students returning to school. I feel like it's in the best interest that the school district hold off with enforcing that schools or the students return to the building. If virtual learning happens, I will hope that they will have an opportunity to participate in the schools that they are assigned to attend for this upcoming school year. I hope that the staff would have the proper tools so that they can teach my students. I hope that everyone will look into the fact that safety is a concern. At the end of the day, we want everyone to be safe. I want you to be safe. I want the teachers to be safe. I want the parents to be safe. I want everyone in the school district to be safe. But I ask that you just process and think whether or not it's a good idea to have any students return in the building. Aside from the virus, there are other issues that have not been addressed. So enforcing the kids to come to school, it could be life-threatening, not only for them, but for other staff. So take this opportunity, please ponder and make the best decision. Thank you.
Thank you. Our next speaker is Nicole Dolan.
Yes, hello.
Hi, you can start.
My name is Nicole Dolan, and I have 2 rising first graders at Chester Arthur Elementary. My preference is for a fully virtual model through my home school rather than the digital academy for all the reasons that have already been stated by others this evening. I feel like any choice my family makes is a matter of hedging our bets on how long schools would actually remain open in a hybrid model. That said, before the August 4th deadline for the Digital Academy, I hope it will be communicated what the families in the hybrid plan should expect in the event of being instructed, for example, by a doctor, to quarantine as a family. What can those students do to learn from home on what would have been their in-school instruction days? They won't be able to simply do what the students working from home that day are doing because that will be redundant with one of their other virtual classroom days. Separately, I believe Mr. Akbar already asked my other question, so I just wanted to confirm that I heard Dr. Height's response correctly. So is it true that if a student's home school shifted from the hybrid model to a fully virtual model, and if that student was in the digital academy, then that student would have the option to shift to their home school's fully virtual model, even in the middle of a quarter? Thank you for your time and consideration.
Our next speaker is John Nichols. Is John Nichols on the line? Okay, then our next speaker after that is Maurice Jessup. And if the next group can be ready, Susan Crosby, Tara Cashin, Yvette Benning, Jennifer Vaught, and Diane Adler. Is Maurice Jessup here? Okay, Susan Crosby.
I'm here.
Okay, thank you. You can start.
Good evening. My name is Susan Crosby. I am an attorney, a City of Philadelphia employee, and commissioner and the secretary of the Mayor's Commission on Women. But today I'm speaking to you as a parent of a rising second grader and an incoming kindergartner at Alexander Adair Elementary. The school district's plan for advancing education safely is completely inadequate. It was apparently developed without the input of the teachers union and without a plan for how to properly fund the recommendations. The district had months to develop this so-called plan. Yet the critical information that parents need to make an educated decision about their children is missing, particularly in regard to the Digital Academy. There is zero information in the Digital Academy plan that describes what a day in the life of a student will look like. The question of synchronous versus asynchronous learning is left unanswered. There is no information about how the teachers in the Digital Academy have been prepared to teach in a virtual environment. Regarding the hybrid option, the only information that we have are the broad guidelines presented in that plan. We still have no idea how each individual school actually plans to respond to and enact those guidelines. While I agree that face-to-face learning is the ideal situation, what will that look like in a socially distanced environment? All the intimacy that makes face-to-face learning so important will be missing. Furthermore, how are we to expect that our students will be provided with safe and clean conditions when before the pandemic, our kids frequently reported that bathrooms were lacking toilet paper and hand soap? The plan as presented doesn't give parents enough information to decide. Yet despite the lack of any substantial information, we have less than 2 weeks to make what may literally be a life and death decision for our children. This is completely unacceptable. With this in mind, I urge the Board of Education and the school district to consider adopting a 100% virtual approach that focuses on creating a nurturing online educational experience for everyone, rather than dividing resources across 2 different options that won't adequately serve anyone. Thank you and good evening.
Tara Cashin.
Hi, can you hear me?
Yes, there's an echo.
Hello?
Yes, you can start.
Can you hear me?
Yes, we can hear you now. Thank you. You can start.
Okay. We are asked to be flexible, but yet the district provided no are the classes going to be live? They're going to be recorded. How long
Wait.
are we going to have to be doing it?
We're having trouble hearing you now. You're going in and out.
We need to be assigned to a teacher. For kindergartners, I know many parents are frustrated because they are trying to register kindergartners for the virtual and they don't have student IDs yet. Are they allowed to do the virtual program? For out of freshman kindergartners, this is a big deal. Will students be grouped in the virtual academy with other students from their home school? Will other programs still be provided? iReady, Lexia. Will they be able to take art or gym or music virtually through their home school? My child has speech. Are they going to be able to stay with that same speech teacher, not have to make new connections doing a virtual program? If we choose to do the hybrid, but then we feel uncomfortable after starting, are we allowed to switch? Can we have all the information about the virtual program prior to August 4th? Let's see. Okay. It's just very disconcerting because students are going to be stuck with unfamiliar teachers and not have their home school. You're making us choose between what we feel is the safest and the death of our home schools with leveling. If we choose virtual, we may not have teachers to support come back to. If enough people choose safety over school, then there is no school. You're asking us to make a decision with what we hold most precious, but you cannot change. We cannot change until January with information. I think being flexible is understandable in this situation, but you're not asking for flexibility. You're asking for blind trust. And frankly, it's outrageous and 100% stressful. Other districts have decided to go 100% virtual. Wouldn't our time be better spent preparing our current teachers remotely better so we don't have a repeat of this thing? Then in January, circle back to the hybrid model to see if the numbers will be ready for that. How many teachers, principals, staff, and parents will have to say they don't feel safe for the district to listen? I personally don't have 100% faith that we will be prepared in time. What am I supposed to tell my children when they need to know what they need to prepare for? Thank you.
Yvette Benning. Is Yvette Benning here? Okay, the speaker after that is Jennifer Voigt. Is Jennifer here? Moving on, Diane Adler. And while Diane Adler is joining, the next group of 5 after that will be Gwen Staton, Delise Williams, Shonda Hill, Emiliano Rodriguez, and April and Brett Dunlap. Is Diane Adler here? Okay, Gwen Staton. Is Gwen Staton here? All right, Delise Williams. Delise Williams. Moving to the next speaker, Shonda Hill. Shonda Hill. Okay, Emiliano Rodriguez. Emiliano Rodriguez. All right, next is April and Brett Dunlap. They'll be sharing their 3 minutes. Or April and Brett Dunlap waiting.
Are we having technical difficulties?
Here.
Okay.
Okay, who is this?
April Dunlap.
Okay. Okay, you can start. And actually, right before you start, I'm just going to announce the 5 speakers after you. Kala Johnstone. Actually, that's a duplicate. Never mind. Lisa Haver, Zoe Rooney, Gary King, and Nick Bernardini. So April and Brett Dunlap, you can start now. Thank you.
All right, good evening. My name is April Dunlap, and I will be speaking on behalf of myself and my husband, Brett Dunlap. We are parents of an incoming 7th grader. The school district's 2 options for schooling for the 2020-2021 school year leave parents between a rock and a hard place. The options are to either expose their children to coronavirus by sending them physically to school or send them to school remotely with a total different school experience where they won't have their normal teachers and friends. As parents, we do not feel comfortable sending our child physically to the school during this pandemic. We are appreciative that there is a digital option. However, we are not happy with the digital option presented to us and what it entails. For one, our son attends a high-performing magnet school, and the fear is that he will not be on the same level as his peers who attend the hybrid method. The school district has not made it clear on who will exactly teach the students and how they will balance learning for students who are more advanced as well as those who are at a disadvantage. How will the school district handle students who may feel like they are ahead? Another issue with the Digital Academy is that students cannot transfer out until the 3rd quarter. It was initially said that students could transfer by the 2nd quarter. And let's be honest, it could be determined early on that a student is not doing well with online learning, yet they have to spend half of the year with a method that does not work for them. How does the school district plan to deal with an issue such as this one? Why can't students just switch out per quarter? One of the most distressing parts of the Digital Academy is that the fact that students cannot switch out of it, even if the hybrid model goes fully online due to the virus. How is that fair to students? The school district should not punish these students for something out of their control. I'm quite sure that students would love to be online with their friends at their school and feel a sense of community. These students have already dealt with so many changes. Their educational norms and social interaction have been stripped from them due to the virus. For this reason, they should be at least able to merge with their peers in the hybrid model if the school district has to go fully remote. Finally, in our opinion, the best option for the school year would be to go fully online at least until January and then reassess in the spring. With the growing coronavirus numbers all over the world, it makes more sense to do so. Safety should be the #1 goal. If large events in Philadelphia are canceled until February, how is it safe for students to go to school with such a large population in one building? Please reconsider your school district options, and I thank you for your time.
Thank you. Our next speaker is Lisa Haver.
Good evening.
You can start.
Thank you. My name is Lisa Haver. I'm a member of the Alliance for Philadelphia Public Schools. There will be 1 hot minute between the first group of speakers and the second before and after the vote, when the board will vote in 2 or 3 blocks on 26 action items. The reopening plan number 15 is just one of them. The board did not post the cost of the plan, but according to Dr. Haidt, it will run between $60 and $80 million. The rest of the items add up to another $90 million for a total of $160 million to be voted on just at this one meeting. That does not include the $1.7 million in grants and donations from foundations, including Neubauer, Bill and Melinda Gates, and William Penn Foundations, all of whom have played a major part in the corporate disruption of public education in this city and others. APS urges students, educators, and parents to pay close attention to the contracts approved by the board tonight. The board did not post the agenda until Monday afternoon, 3 days before this meeting. There were no July committee meetings at which to discuss any of the items. The board and the administration know that the decision about reopening buildings is a life and death one, but we cannot allow the board to quietly and with little deliberation change the course of teaching and learning with these expensive contracts. And we cannot let individuals and corporations profit off of this crisis. Item 21 presents just one example. The board is voting to accept $265,000 from Gates Foundation and William Penn Foundation to pay the Partners in Innovation Company to quote unquote transform a number of district schools. Although this amount only pays for a fraction of the program, the item description says Partners in School Innovation will continue to provide intensive on-site school level support to 3 participating schools through targeted professional development. What does on-site mean right now? How will any of this work when we don't even know what school is going to look like? This is not the time for the board to hurriedly rubber stamp questionable contracts for services the district cannot use. The board promised months ago to consider only essential items during this contract. The board should table most of these items and concentrate on protecting the health and safety of our students and educators. Thank you.
Our next speaker is Zoe Rooney.
Good evening. My name is Zoe Rooney. I'm a parent and an educator and a member of Parents United for Public Education. For a meeting that wouldn't usually happen in July, that was added.
Zoe, can you talk a little louder? It's hard to hear you.
Sure, is that better?
A little bit, thanks.
For a meeting that wouldn't usually happen in July, that was added in response to a that was due to the need for urgent action. This agenda has a lot of business as usual. It is upsetting when lives are literally on the line to see non-urgent items listed, especially given that there haven't been any committee meetings, not even a pretense of public discussion, and the items were posted a mere 72 hours before this meeting. If you wanted to follow your word about focusing now only on the most urgent of business, you would table anything not directly related to reopening until the August meeting, and only after committee meetings when they're discussed in public. I've adjusted my testimony from my original plan because I'm really disturbed by much of what I heard earlier in the presentations and by some of the softball leading questions from some school board members. As you may know, another educator and I put together a crowdsourced document of questions submitted by students, families, and school staff about the reopening plan. There have been more than 730 submissions, and the document contains more than 400 questions. The huge response to this and other unofficial feedback shows the failures in communication from the district, as well as how folks don't feel that they're truly being heard. An FAQ with partial answers and unrealistic promises doesn't show you that you are hearing people. You seem to think that you have created, quote, solutions that address folks' questions and concerns, but because you don't actually hear us, you continue to not only miss the mark, but fly wildly off course while leaving the people who need strong leadership the most in the lurch. I am frankly shocked at the partial information, misinformation, and lack of concern showed earlier in this meeting about facilities issues such as ventilation. The information shared by people who are ostensibly charged with protecting public health ran directly counter to other sources of guidance from sources such as the EPA and Harvard School of Public Health. I'm disgusted that you're pretending to suddenly care about the students who need the most supports when you've been blatantly unconcerned through years of your own policies that you've refused to address that have allowed school segregation to increase, closed schools in poor Black and brown neighborhoods, and put on the complete travesty that is your extended school year that does an active disservice to students with significant special needs. What I see you doing is putting a Band-Aid on pandemics. This is true in your response to the pandemic of white supremacy, in the way you are asking for free labor from people of color on your equity coalition. This is true in your quote unquote plan for reopening in the midst of this pandemic, the way you are making choices that will be sending students and staff into unventilated, unsafe schools where they will almost certainly face illness and death. In relying on Band-Aids instead of real solutions, you are letting these wounds fester until they cause the trauma that you've let schools inflict on Black and brown students. and the destruction of our public schools you are currently inflicting through this reopening mess. This is your leadership and your legacy. Thank you.
The next speaker is Gary King.
Hello, can you hear me?
Yes, you can start. Thank you.
Thanks. So let me just start with, actually, I'm a parent of two. I have a second grader, entering second grader, and then entering kindergartner. And I'm also an early literacy advocate, part of the grade level reading campaign. So I support those initiatives in 6 of the public elementary schools here in the Northwest. And I've been looking at the plan like we all have, and I just don't get it. I don't, let me just say from the top, I understand that this is a very complex problem out of our own making. So I'm going to give that caveat. I get that you are trying to balance a lot of different considerations, but what's the rush? That's my question. What's the rush? My wife and I have have a saying that we use a lot in our own personal lives, which is we have to learn how to disappoint the right people. So I don't know what's driving the hybrid plan and the push for this, but I hope that one of the big takeaways from tonight, based on what I've heard, is that people are scared. And I work with 6 of the principals in this area. I work with a lot of the different literacy staff, and I know a lot of teachers personally. The staff are scared. The parents are scared. So any benefits that we're going to get because kids are supposedly socializing 2 days a week are going to be minimal at best. And all at what? For the potential of losing more lives. I mean, the infection rate was lower in March when we closed schools, and we're about to try and, put this hodgepodge of a plan together and go back in September, which I don't understand. If it was enough for us to close the schools in March, then why is it all of a sudden with more deaths and a higher infection curve, okay to go back, right? So I think, I hope Dr. Haidt and board members that you're hearing this and that you really go back to the drawing board and come back with something that makes sense to the stakeholders in question, namely my kids, our kids, our staff and our teachers. I just don't think, driving off a cliff like this, a potential cliff like this, makes any sense to just get caught in an endless cycle of shutting, possibly shutting down a week or 2 into things, especially given earlier comments about the experiences that other school districts around the world have had. So I don't know what the rush is. Let's push for more funding and push Comcast to open up their public.
Thank you. Our next speaker is Nick Bernardini. And after that, the next 5 on deck will be Linda Rubin, Sonia Rosen, Eric Moran, Devrin Washington, and Andrea Moselle. Is Nick Bernardini here?
I am. Do you all hear me?
Yes, thank you. You can start.
So good evening. My name is Nick Bernardini. I'm a 12-year educator in the SDP. I'm a member of the Racial Justice Organizing Committee, the Caucus of Working Educators, and I am the building rep for Samuel Fells High School. I hear Dr. Haidt saying students remain in school, but enrollment in the Digital Academy will still affect the teacher placement. I find this a little preposterous. Leveling is particularly destructive process as it relates to school community and culture, as others have already mentioned. In addition, and maybe most importantly though, leveling disproportionately affects neighborhood schools whose enrollments drop every year because of other SDP policy and programs that support charter and magnet enrollments. Neighborhood schools are predominantly Black and brown, so this is indeed a racial equity issue. Over the last 48 hours, it has come to light that the district plans on leveling schools this year by incorporating the number of students that opted for the virtual academy. As reported earlier today by Kristen Graham, over 2,000 students already signed up. That's just in one day. Students from our building will be with random teachers from the district who have no rapport with them, no connection, and potentially will have to be placed with all unknown students as well. Teachers from my own building will be in turn pulled to teach with students that they don't have any relationship with and that are in other schools around the district. So are we blowing up schools now to accommodate a full separate digital academy? further killing neighborhood school funding and teacher placements in the schools that not only need more funds, but more teachers and staff to operate optimally and effectively. Again, we are essentially defunding and pulling staff out of those buildings that need more of both funds and educators. How does that work towards building relationships and community moving forward? How is that equitable? In the least. I think it's time that we reevaluate how leadership looks at education philosophically. You can't say you believe in developing positive school culture and community in school buildings and then make decisions that are diametrically opposed to those ideals and not be called out on. This is yet another unnecessary move that imparts more stress, confusion, and upheaval to an already incomprehensible situation. Going virtual from jump would at least ensure school teachers and students continuity, give everyone a little peace of mind, and enable us to prepare. Reopening schools for in-person instruction that will inevitably be subpar compared to previous years and straight up dangerous for students and staff is the wrong move here. Face-to-face instruction is remarkably better than online instruction. But what this would look like is not face-to-face instruction. It's anxiety-riddled, unorthodox, uncomfortable, masked, shielded, and distanced instruction. Instruction like this is only an extension of the trauma this ordeal has caused. I co-sign all the sentiments of the previous speakers and implore you to reconsider the use of digital academy model and instead opt for full-time school-based remote learning until our society is in a safe enough place to reopen schools fully. There are no good educational plans here, not one, but there is a safe plan.
Linda Rubin.
Good evening. My name is Linda Rubin. I'm a retired school counselor and member of the Alliance for Philadelphia Public Schools. First, I want to say that I do not envy anyone on this board having to make these decisions with so much at stake and so much unknown. This opening plan may look operable as a written report, but as with written reports, the execution often follows a totally different trajectory. COVID is not the flu, as so many other cities have discovered when they reached out too far, too fast. Therefore, I ask you to vote no on this health and safety plan for reopening schools and delay in-school options. This is one case where we can do more systemic harm if even some of the what-ifs occur. And by the way, this new completely separate online option for only some students will destroy a cohesive district-wide program and damage future integration. Deliberately separating some students from their home schools and their teachers will be even more traumatic for them. Delay opening schools for 2 or 3 months to provide extra preparation, to make our buildings cleaner and safer, and to give yourself time to consider what else could go wrong and plan to mitigate it beforehand. We all remember the unsettling stress and learning disruptions caused by last year's environmental problems. Remember last year when you learned how productive it was to include parents and teachers in the actual planning? Do that too. Other cities have suffered having to shut down after reopening. This is one reason there's a growing number of large school districts delaying the opening of their school buildings while reassessing their options. Delay, to give the schools without optimal air ventilation time to cool down, especially in 90-degree heat and humidity that strikes down our students and staff as it is. There's going to be enough physical discomfort from wearing masks and with children trying to remember how to follow the non-normal behaviors of social distancing without adding the sweat-induced fatigue and nausea such hot boxes can cause. I'm a counselor, you know me. I understand and advocate for a child's need for socialization and normalcy. Schools provide our own special kinds of emotional growth. I also understand the confusion, fear, and emotional trauma that could damage students' trust that we don't have their backs. We don't want a lot of "you said" and "you promised" when this is over. This school year is going to be hard enough on children and adults. Let's do what we can do to minimize the mistakes. Delay opening schools. Vote no on the health and safety opening plan. Thank you.
Sonia Rosen.
Hi, can you hear me?
Yes, thank you. You can begin.
Hi, I'm Dr. Sonia Rosen. Besides being a parent of a 6th grader, I'm also a teacher education faculty member at the University of Pennsylvania Graduate School of Education. There's several issues I have with the SDP's plan to reopen for face-to-face learning in the fall. First, we are essentially expected to trust in the district's ability to secure adequate PPE and maintain cleaning protocols when they have never had the capacity to even make school buildings marginally safe from dangerous environmental hazards in the past. Second, there is no way half the students can be in a school building at once and still maintain adequate distance, which is 6 feet apart. I can't help but note the hypocrisy here. Would the school board meet under those distancing conditions? Why are all of you not currently in an STP classroom, sitting together, sitting a few feet apart while wearing your masks? Why are you asking teachers and students to take safety risks that the school board and district administrators are unwilling to take? Third, this plan has laid out conditions that strip learning experiences down to their most bland, antisocial, teacher-centered components, rather than exploring ways to create more dynamic online environments in which students can at least interact in meaningful ways around texts and ideas. Online learning pales in comparison to face-to-face learning, yes, but this brand of face-to-face learning, where students are constantly being policed and having to police their own behavior, where students have to remain in rows 6 feet apart from their peers at all times, and where teachers and students feel like their lives are always at risk, is not the foundation for rich learning experiences. And as the Digital Academy is currently designed, it will remove children from their school communities and the teachers who know them. Fourth, you will be implementing this plan just a few weeks after all the college students from the area's 80+ colleges and universities fly or drive in from around the country to return to their dorms, which means it will be exactly at the time when we will likely see a surge in Philly's COVID-19 numbers. Fifth, it is delusional to think that we are not going to end up having to shut down all the schools anyway at some point in the fall, which will mean that the district will then revert to a poorly planned, fully online model without having spent the time and resources to ensure more equitable access to remote instruction. It's a lose-lose situation. We need you to reject this reopening plan and urge administrators to shift their energies towards creating a remote learning plan that is comprehensive, safe, fair, and equitable for students, teachers, and families across the district. A new plan should consider several possibilities. Opening school buildings to a very small number of students who meet particular criteria. For instance, students that are experiencing homelessness or those who have learning needs that cannot be met online, while all other students engage in remote learning. As a recent Philadelphia Inquirer article suggested, we could establish small learning cohorts of 8 to 10 children whose caregivers are working outside of the home during the day, with those children meeting in libraries or other public spaces to engage in remote learning, supervised by an adult who is paid for the job. Time and energy should be put into supporting teachers to develop strong online curricula and exploring pedagogies that include a mix of synchronous and asynchronous online learning. There are many resources out there to support this work. Teachers need access to good, reliable online platforms like Zoom and Canvas, which are being used successfully in K-12 classrooms and universities across the country. You owe it to the city of Philadelphia to vote down this plan and to institute online learning.
Eric Moran. Is Eric Moran connected? The next speaker is Devrin Washington.
Hello, can you hear me?
Yes, thank you. You can start.
Okay, thank you. My name is Devin Washington. I am the senior policy organizer with Movement Alliance Project, formerly Media Mobilizing Project. And I primarily work on issues related to digital inclusion and the access to internet in Philadelphia, and have been organizing around this issue since the shutdown began, especially at the intersection of like education and internet access. So yeah, I think the plan for the school district to reopen, as is stated, is not feasible. Not only are the proposed safety precautions unrealistic, but our students, their parents, and the teachers are not prepared to even attempt to adhere to the strategy given the material conditions of our students, the school staff, and the communities they come from. There are more than enough people who have already spoken to these conditions, so I want to focus on the 20,000 students who do not have internet access at home. And most importantly, I don't want us to lose sight of another reality that even for many of the students who have internet essentials at home, their broadband plans might not be capable of allowing multiple students to simultaneously participate in remote instruction, just because of the lackluster internet speeds. And in addition to that, for those 20,000 students who do not have internet access at home, without a comprehensive plan that guarantees free access to broadband for our students, this back to school program or plan will fail. So yeah, as it stands, this plan glosses over the blaring gap in broadband access in the city of Philadelphia. As a city who has struggled to climb its way out of deep poverty for decades, if not centuries, we should be clear what this plan amounts to for students who cannot afford internet and their families. So like primarily, like how does a grandmother who's charged with the care of her grandchildren and who struggles with digital literacy meet the daily online system reporting requirements that are detailed in this plan? how is it that we are to prepare to give, or we're supposed to give families 2 weeks to prepare to build the digital literacy they would need to assist their students or their family members to complete the coursework and all of these things that are necessary in order for students to even, partake in online education. But even if digital literacy was not an issue, this plan codifies access to the internet as a human right. Americans have a right to free public education. And if the school district of Philadelphia or the city is unable to pay the ransom placed on the education and futures of our students by Comcast and the other large.
Our next speaker is Andrea Moselle, and after that will be Kiana Thompson, Michael Andrews, Chris Lehman, Michelle Rossi, and Kim Ellerby.
Hi,
Is Andrea Moselle here?
Yes, I'm here.
Okay, thank you. You can start.
Hi. I'm speaking to you tonight as a community member, a parent, a grandparent with a background in early childhood education. I am also a member of Power Interfaith Education Strategy Team. I want to briefly share some of my impressions and concerns about reopening schools, including what I've learned from participating in conversations that we've had with the individuals who are most impacted by decisions the district and board make. I am struck by the shared concerns and growing anxiety of these stakeholders around going back to school in a way that is both safe and encourages and supports learning. They are particularly worried about whether the district will be able to meet the challenges our already underfunded and under-resourced schools are faced with. We know that our student body mirrors the profile of those who the media tells us daily are the hardest hit by COVID-19, and that structural racism is playing a role in that impact. There is deep concern about making sure that we make solid plans that recognize the issues facing the district's most vulnerable students and families. One of the ways the district can help calm some of these fears is by committing to full transparency and regularly updated information for all stakeholders, and going forward to getting their input before decisions are made and plans completed. You can start by publicly addressing the current status of ongoing toxic building issues and their impact on environmental safety, and then continue to provide regular ongoing updates about the status of that work, as well as the other cleaning and maintenance work outlined in the district's plan. And since virtual learning will be part of the program for most students, whether they choose the 100% virtual or the hybrid plans, additional focus should be given to ensure more success for all children and families. These include address connectivity issues using all public and private options so that every child has a working computer and high-speed internet access adequate to use district tools and to participate in all lessons. Support quality teacher training around online teaching. Give them time to work on creating the new curriculum and integrating online and face-to-face learning experiences, and continue to offer ongoing supports and resources for teachers. And lastly, provide parents with robust options for training around online learning and technical support like the help desk so that they aren't lost when they try to work with their own children on the lessons they are being given online. Thank you.
Thank you. Our next speaker is Kiana Thompson.
Hi, can you hear me?
Yes, thanks. You can begin.
Good evening. My name is Kiana Thompson, and I'm a member of CASA Local 502. In light of the current health conditions, I am urging you to put a pause on the school reopening plan until it is safe for staff and students to return to buildings. I suffer from scleroderma, a chronic autoimmune disease. In 2004, I suffered a crisis that nearly killed me. But even at my sickest point, I did not feel the level of fear and anxiety that I feel now with the thought of opening schools prematurely. The idea of my organs being under attack again because I simply went to work is crippling. While the city of Philadelphia has banned gatherings of over 50 people, administrators are expected to place ourselves in the midst of hundreds of people each day with no knowledge of who in our buildings may be positive for COVID-19. There is little consideration for those of us who are high risk and have compromised immune systems. The current plan requires that we work in isolation to make crucial decisions without input from our school teams who are all on vacation. Part of our responsibility is to enlist feedback from our stakeholders and be able to consider their needs as we make these decisions. These school plans are too important to put the responsibility on one principal who has been overwhelmed with making and executing plans on Chromebooks, hotspots, schedules, caps and gowns, yearbooks, virtual graduations, EBT cards, addresses, and systemic racism, nonstop since March. Please let science and data rather than politics guide our reopening. Even Trump has finally admitted that the situation will get worse before it gets better. Many students will have to ride multiple buses and subways before even getting to school. We have no way of managing who they come into contact with in their travels. We cannot dine inside a restaurant in the city right now, but we are expected to place students in cafeterias with no air conditioning and windows that don't open. The plans call for classroom cleaning every 4 hours. Many of our classes change every hour. How will classrooms be disinfected? In light of these deficiencies in the plan, among others, I request that we open schools 100% virtual for students in September. Plans need more time to be developed among all stakeholders. Please examine the risk versus the reward. The current plan requires students to attend in person about 8 days a month. The reward of 8 days of face-to-face instruction cannot compare to the losing of a life. In the long run, we will be forgiven for some gaps in learning. We've seen students be able to progress 2 grade levels in 1 year, but we will never be forgiven for the death of even one member of our school community due to irresponsibly rushing to open schools. Thank you.
Michael Andrews. Is Michael Andrews connected?
Yes, I am.
Oh, okay.
Thank
Go
you.
ahead. Thank you.
Hello, my name is Michael Andrews, a retired special educator of 23 years in the School District of Philadelphia. I also am the president of Phi Delta Kappa International University of Pennsylvania, Chapter 19. However, tonight I am speaking as one of the representatives of Teamsters Local 502 CASA. So please allow me to reiterate that according to the School District of Philadelphia Fast Facts, our student population is 52% Black, 21% Latino, 7% Asian, 6% multiracial and other, and 14% white. It should be noted that the school district identifies its population as overwhelmingly economically disadvantaged. What's more, the intersection of race and poverty among our students places them and us in an even more precarious position than our affluent surrounding districts. Despite the district's mantra, the reality is the quality of students' education is determined by the zip code. While we understand and certainly empathize with the burden that will be placed on parents who often are essential workers, we do not believe that the school district personnel should have to potentially teach students to death. This is not speaking figuratively. Rather, it is a literal statement that underscores our very real concern for our students, our babies, school personnel, and ourselves. The point seems to be clear to a number of other large districts that include Los Angeles, San Diego, Nashville, Atlanta, Arlington, and Baltimore, all of whom have decided that the risk is not worth the demand. Unfortunately, and despite scientific evidence, the CDC recommendations regarding social distancing, which clearly state that virtual schooling is the safest option. Children do get coronavirus. Children are carriers. Children of color and poor will be most affected. There are some populations of students, particularly those with complex needs, that cannot or will not social distance and wear their masks consistently. Programming for 17 to 25 students in small classrooms do not adequately allow for social distancing. So I beg you, as the leaders of the Philadelphia School District, the School District of Philadelphia, to please act with the singular basis of children first, and remembering that safeguards of our parents, guardians, and community partners are essential. Thank you.
Chris Lehman.
Hi, good evening.
Go ahead. Thank you.
Okay, thank you. Hello, this is Chris Lehman. I'm the founding principal of the Science Leadership Academy and member of CASA. Dr. Haidt and members of the board, as I'm sure you know, it is not my normal way to speak at board meetings, but I do feel that I have an important perspective to bring to this moment. I first want to honor and recognize the unbelievable challenge you have in front of you as you navigate what is best for the entire school district, students and staff alike, during what are unprecedented times. I do not envy you for the decisions that you must make. With that though, I do feel compelled to speak as both the principal of SLA and as the parent of a rising SLA junior. Last September, despite the best of intentions and despite the incredible hard work of so many people, we did put the staff and students of the 2 schools in our building at risk. Despite the best thinking of the time that we could manage it safely. Students and staff did get sick, including my son, who was hospitalized for respiratory distress caused by exposure to the building. The trauma to our community and to our family that resulted from that situation is real, profound, and long-lasting. And I do not wish that on anyone. And yet we are, again, it feels like at a moment where we have to consider what the plan is to make sure we can keep everyone safe. It is a Faustian bargain to have to choose between risking your child's health and their education. It is an impossible choice to have to choose between your passion for teaching and your health and the health of your family. And yet those are the choices we are faced with in this moment. And it is with that lens that I urge you to reconsider the current plan and instead open our schools virtually in September. Thank you so much for your time.
Michelle Rossi.
Hello, can you hear me?
Yes, thank you. You can start.
Thank you. My name is Michelle Rossi, and I am the parent of a student at Thomas Mifflin School. And I don't envy any of you who have to make these decisions. But I do want to express my alarm at the idea of returning our children, teachers, and staff to old school buildings with terrible ventilation, when we know that COVID-19 is a virus that spreads through the air through droplets from coughing, sneezing, and merely talking. I fully support teachers and staff who refuse to endanger themselves, our children, and our whole community working in that environment. It is my request that the Philadelphia School District start the 2020-2021 school year with a robust, wholly online model for learning for all students. So far, the discussion of a safe and healthy opening of our Philly public schools has emphasized cleaning, social distancing, and personal protective equipment. But no amount
You just cut out.
Amount of disinfectant, hand sanitizer, or I'm here.
You cut in and out a little bit. Go ahead.
I'm not sure what's going on, but I'll continue. But no amount of disinfectant, hand sanitizer, or masks can remedy the ventilation problems in schools that suffer from decades of deferred maintenance and where documented problems with mold and asbestos were not fixed prior to this pandemic. The EPA's website notes that although improvements to ventilation and air cleaning cannot on their own eliminate the risk of airborne transmission of the COVID virus, the EPA recommends precautions to reduce the potential for airborne transmission of the virus. And these precautions include increasing ventilation with outdoor air and air filtration as part of a larger strategy that includes social distancing, cloth face coverings or masks, surface cleaning, disinfecting, hand washing, and other precautions. In the real world, many classrooms and lunchrooms are in our school's basement level where there are no windows. Most classrooms lack air conditioning, and often air conditioners merely recirculate the stale air. In classrooms with windows, the windows don't open or only open a few inches, and these rooms are sweltering at the start of the school year. In the school district plan, fans are proposed as a feasible solution to these ventilation problems. I fear fans will only spread this virus more effectively, and schools will quickly close again, forcing everyone into remote learning. I don't want to send my child, her classmates, or her educators into this environment. And I wonder how many school board members with children will be sending them into Philly Public Schools in September. And I wonder, do their children's schools look like my child's school? At the same time, I don't find the proposed online alternative, the Digital Academy, where my child might be assigned to teachers who have
Our next speaker is Kim Ellerby, and the 5 after that are Cecilia Thompson, Britannia Carr, Danita Bates, John Lucas, and Maddie Luber. Kim Ellerby, are you here? Is Kim Ellerby here? Okay, Cecilia Thompson.
their children's schools look like my child's school.
Can you hear me?
At the same time, I don't find the proposed online alternative, the Digital Academy,
can
where
y'all
my
hear
child
me?
might be assigned to teachers.
Hold on. Do we have 2 people talking?
Ms. Thompson, we can hear you, but if you're listening through another source as well in the background, it's coming
5 after that.
I need
Cecilia
to.
Thompson. Ms. Thompson, I think you need to turn your TV or radio off in the background so that we can hear you instead of hearing the prior speaker, given the 2-minute lag. Is Kim Ellerby here?
Can y'all hear me?
Yes, we can hear you, but please make sure you turn off your television, or else we're gonna keep hearing.
Their children's schools look like my.
We're gonna
child's
keep hearing.
schools.
Can you hear me?
At the same time,
I'm trying to fix it. I turned off. Can y'all hear me?
Hold on.
I
Do we
turned
have 2 people talking?
I turned off
We
everything.
can hear you, but if you're listening through another source as well in the background, it's coming
5 after that.
I need to.
You need to turn your TV off or your volume or radio off in the background so that we can hear on your television hearing the prior speaker.
Okay. Can y'all hear me?
Yeah, now we can hear you without hearing ourselves too. Okay. Thank
Okay.
you. Yeah, go ahead.
I apologize for that.
That's okay. Go ahead. Thanks.
So, couple things. One, in a survey that I sent out to get feedback, over 1,100 people responded, and they are saying the same thing. Teachers, parents, and community members are resounding. They're scared. They don't want the schools to open where families and adults have to come into a building. They don't feel confident of the cleaning procedures. Some schools didn't have running water or hot water to begin with. While they offered many suggestions, I hope that the board takes some time to view the document that is attached for the record and see the many positive suggestions, but everybody's scared and nobody wants to have their loved ones come in, number one. Number two, when it comes to individuals with special needs, while there were conversations with advocates, conversations with other stakeholders, this population has still not been heard, especially those with complex needs who do have pre-existing conditions. The answer to not properly preparing for them is not to say, okay, y'all going to come in 4 days a week because we're going to make up for the lack of education since March. Nobody wants that, and you've heard that resoundingly, and you'll probably hear that throughout the rest of the night. But also, for some, this is still an IEP decision. The IEP is another method for them to be educated other than methods that I had suggested. The district will still be bound by those IEP team decisions. And finally, I don't know, on your website, you're hiring cleaning people. $28,000 is poverty wages. Because these people will be risking their lives if they're to come into school, because they'll be cleaning, from my understanding, all day. And if this is going to be an option, please consider starting them out at minimum at 35,000, which is still not a lot, but given the times we're living in, it's a better living wage. And it's called the School District of Philadelphia. Please don't let the D stand for school for the disabled and the disenfranchised and those who don't have other options. Thank you for the opportunity to speak this evening.
Our next speaker is Ratanya Carr.
Thank you all for this opportunity to speak today. This is uncharted territory, and I am very appreciative of all of your hard work and sacrifices. I'm the parent of 2 school district children at Penn Alexander, an HSA board member, a physician, and a lab scientist who has kept abreast of the COVID-19 research, the rapid pace of which is unlike any area of science in my lifetime and probably in most of your lifetimes. Yet we have learned a few foundational things. The virus thrives when people are in close contact. Virus burden can be reduced with disinfection protocols like proper hand washing and surface sanitization. Masks reduce risk. Ventilation is key. Outside is better than inside. Contact tracing mitigates disease spread. So after attending all of the virtual town halls, reading the district's plan, and finally learning this week about my own school's lack of readiness, which is probably one of the most resource schools in the district, I was disappointed and alarmed by what I learned. There are plans to convert classrooms into high-risk mini restaurants, a provision of only 1 mask to teachers in high school who are the highest risk group, self-screening processes without a plan for facilitation for all families. Schools are not equipped with bare minimum essentials like soap, reliable faucets, adequate facilities maintenance personnel, adequate ventilation or outdoor space, or even enough nurses to carry out COVID-19 related care on top of their usual duties. All of this lack of preparedness amidst an absence of a robust contact tracing plan in Philadelphia, rising COVID-19 numbers, and as of yesterday, no distribution of increased funds to schools to even purchase supplies in time for reopening. While I agree we can't keep schools closed forever, when we do open them, we need to be able to replicate what we know works. So in my view, the decision for the board comes down to 2 questions. With what you know today about the lack of resources, high-risk policy recommendations, deficit in personnel, incomplete PPE plan, increasing viral burden, and suboptimal contact tracing, would you recommend that your best friend send his or her only child to the least resource school in the district? If you can confidently answer yes, then you should support the plan as it is written. If your answer is no, then you should not send any child to in-person right now, and at a bare minimum require an amplification of the safety plan. Be prepared to double or triple what you have allocated to the efforts and have the district come back to you at a much later date while they redouble their efforts getting teachers ready for virtual education so that we can be the best in the nation. Secondly, with the plan, are you prepared to return all district staff and board members to in-person duties prior to arrival of everyone else so that they can test out these protocols real time? If your answer is no, that signifies that you are not yet comfortable with increasing in-person interactions. And if that is the case, then you should vote no, as it will be very difficult to convince the rest of the members of the district to return in person if you yourselves are not comfortable. Thank you so much for allowing me the opportunity to speak.
Danita Bates. Is Danita Bates connected? Okay, Joan Lucas.
Hello.
Yes.
My name is Joan Lucas. I'm a retired educator and a member of the Power Interfaith Education team. Tonight, I am expressing my own opinions and not those of the group. While I appreciate the serious difficulties that arise in connection with remote learning for teachers, students, and families, I feel that it is far too dangerous to reopen schools while the pandemic continues. I attended 2 of the town halls offered by the district earlier this month and heard several teachers and parents express concern about the possibility of a return to school. One notable comment pointed out, as several people have tonight, The irony of talking about students meeting face to face while we adults find it necessary to conduct these meetings online. Since the town halls, I've read commentary from teachers and teacher unions expressing concern about returning to in-person teaching and learning at this time. One very moving opinion piece in the New York Times by a secondary school teacher said, "Every day when I walk into work as a public school teacher, I'm prepared to take a bullet to save a child. In the age of school shootings, that's what the job requires. But asking me to return to the classroom amid a pandemic and expose myself and my family to COVID-19 is like asking me to take that bullet home to my own family. This is where I draw the line. It isn't fair to ask me to be part of a massive, unnecessary science experiment. I'm not a human research subject. I will not do it." Teachers who are reluctant, or as this one, unwilling to return to their classrooms in the current circumstances do understand how difficult it is to maintain high quality education in a 100% remote arrangement. When this was attempted suddenly in the spring, it didn't go very well. But now that some time has passed, it should be possible for teachers and students and school districts as a whole to make needed adjustments. I do not doubt that in-person learning is preferable in most circumstances, but currently we would be exposing children and teachers and their families to too much risk. Please let them stay home and stay safe until we have been able to overcome this risk. Thank you.
Sorry, I was on mute. Our next speaker is Maddie Lubert, and then the group after that is Emma Connolly, Eileen Broderick, Felicia Bryant Dawson, Leah Wood, and Alexis Zhao. Is Maddie Lubert here?
Yeah, can you hear me?
Yes, go ahead, thank you.
Good evening, Dr. Height and members of the school board. I'm Maddie Lubert, an English teacher at Kensington Health Sciences Academy and a member of the Caucus of Working Educators and the PFT. I'm also an alive person that hopes to remain living for the foreseeable future. I'm going to speak very personally tonight because I cannot extricate the issues related to our reopening plan without acknowledging my own human involvement. This week brought the 20th anniversary of my older brother's unexpected death. He was 17 and I was just 7. Needless to say, every part of my life was affected by this event. Hopefully, not many of you can relate to the impact of a childhood loss, so I share this to illustrate what I know. To experience loss and grief as a child is alienating, painful, and really damn hard. Most adults are not equipped to help a child through this process, and as a child, it often feels impossible to ask for the support you need. If the school board approves the district's current reopening plan, we'll be forcing hundreds or thousands of children into this rare and painful experience as they helplessly watch beloved family members, school staff, and classmates die preventable deaths from COVID-19. I wouldn't wish this experience on any child, and the fact that we do not have to do it this way only deepens the violence and trauma being committed. Too many of our students have already had adverse childhood experiences, and their chances of surviving more trauma should not increase exponentially by attending school. You may also remember that my mother and my sister are both classroom teachers in our school district. My big sister works in a school with known asbestos contamination, among other environmental issues, and my mom has to bring a tote full of inhalers and EpiPens to work every day due to her adult onset asthma, which she contracted working in another ancient and toxic building for nearly 20 years. My father, who I don't want to feel left out, is also an educator in the field of mental health and works directly with School District of Philadelphia students as a psychiatrist. That means all 4 members of the Lubert family are being placed directly in harm's way by the rush to return to in-person school. If you know any of the Luberts, you know that we are deeply committed to our work with young people, perhaps to a fault. We each thrive in our settings and are recognized for the relationships we build with children. I'm confident that my mom, dad, and sister are just as eager as I am to return to our typical work settings where we are most effective. However, I don't think any of us want to die or do irreparable damage to our bodies in order to do so. Dr. Height and the school board, you have the power to save thousands of lives in Philadelphia. While we still have time, please channel all of our resources towards preparing for high-quality virtual schooling and providing safe physical spaces for our most vulnerable students in need of assistance or shelter during the school day. My tangled up personal experience is just one example of how harmful this plan will be. Please stop biding your time until someone more powerful steps in when you know the moral, data-driven, and safest option is not in-person instruction. We cannot rush back to school in the service of capitalist greed. Thank you.
Emma Connolly.
Yep, can you hear me?
Yes, thank you.
Good evening. My name is Emma Connolly and I live and teach in South Philadelphia. As I have processed the school district's reopening plan over the past week, I continuously return to what we are getting and what we are giving up under this plan. We are giving up the health, safety, and lives of our students, their families, and staff. Our schools do not have proper ventilation. The current limit of 25 students, when feasible, is far too high, and there are no plans to test staff or students. Family members rely on older relatives for childcare, putting them at risk under the current plan as students are traveling to school 2 days per week. We are also giving up the opportunity for students who learn 100% virtually to stay connected with their peers and teachers in their home school, as the current vague plans for the digital academy suggest that they will be assigned to different teachers. Finally, we are giving up the opportunity to fully devote ourselves to making remote learning work, as we will be dividing our attention and resources between in-person and virtual instruction. What are we getting in return for these enormous sacrifices? 2 days of face-to-face instruction per week. During those days, I will be frantically cramming in directions in the hopes that I can prevent my students from being lost in the sauce on their assignments on the days they are at home. Students will be facing forward, unable to work in groups or travel to different classrooms for interventions. I will spend my precious few instructional minutes reminding students to keep masks on and practice social distancing because they are children and they will forget. Looking at the whole picture, this seems like a horrible deal for students, families, and school communities. Students could receive more coherent instruction safely through 100% online instruction. Additionally, we could think about setting up outdoor kickoff conferences to make sure students know how to use their technology and are able to get physical curriculum materials to ensure a smooth start to the school year. The current plan is truly the worst of both worlds. Thank you.
Eileen Broderick.
Yep, I'm here. Can you hear me?
Yes, thanks. You can start.
Hi, my name is Eileen Broderick, and I'm a proud second grade teacher at McClure Elementary in Hunting Park. I believe in the children of Philadelphia, which is why I became a teacher after managing and running high-rise office buildings in both Philadelphia and New York City. I know what it takes to run teams of engineers, janitorial staff, and the oversight needed. We had budgets, but unlike the school district, we had private, wealthy families who could dig into their pockets at any moment to give more money whenever needed. Money doesn't fix all. There were times when supplies couldn't get there, and when staff would call out and subs couldn't fulfill the jobs or complete it to the level of service required. When that inevitably happens this fall, staffing issues, supply issues, and funding issues, the consequences for improper cleaning and not having PPE in our schools will be deadly. My school was shut down for asbestos this past spring, and the district promised us so many things, the smallest of them cleaning done by a professional cleaning crew. We would come back in and it would be perfect. This was one school. We had to walk the buildings ourselves, teachers, because at almost every turn we were lied to, taken advantage of, made to feel bad, and misled. I never will feel bad for protecting my students and myself from dangerous building conditions. I've taught at the same school for what will be my 4th year. Getting the most simple supplies seems like a Herculean event. There has never, let me repeat, never been soap in our students' bathroom for maybe longer than 1 day. My classroom is right next to the bathroom and teachers constantly are asking to use my phone to call for toilet paper. There are times we had to borrow toilet paper from nearby schools. Maybe that's a management issue within our school, but it isn't a teacher or student issue. Yet we are the people who pay for these management issues, the supply chain issues, the sorry, we didn't take out your trash or clean the bathrooms or because our cleaner was out issue. Now this fall, we will be returning to a school and we'll be running down the block begging for life-saving PPE. When they don't have it, what will happen? Do I now have to buy and keep a stash of face masks in my desk instead of toilet paper? I love masks. Everyone should wear masks. Ventilation is a true issue. Dr. Farley said tonight, yes, we can be in a classroom without windows or ventilation and be okay. My classroom reaches over 90 degrees, and with children in class, I am truly worried about heat-related issues.
I ask you, would you put your children in my classroom where it reaches over triple digits with no ventilation? Teachers did our part when we closed down. We moved to remote learning. We worked endless hours to get students technology, internet, and set them up. I have always put my students first, and I will not stop until there's a plan that gives our students and staff a safe place to learn, be that at home, at school, or somewhere in between. Instead of rushing into an overly ambitious plan, let's take the time now to become the leading district for remote learning.
Hello?
Hello, is this Felicia Bryant Dawson?
It is.
Yes, you can start. Thank you.
Thank you very much for this opportunity to address you. My name is Felicia Bryant Dawson. I am the mother of twins who are rising fourth graders at Adair Elementary School. I don't believe my family situation differs from many of the families you've heard from today. My husband and I have both been working virtually since March. We diligently took to assisting our children at the end of last school year to help them meet their academic requirements. I'm not going to lie and say that it was easy working full-time and providing significantly more academic support than we were accustomed to with just doing nightly homework. Both of my children's teachers were very accessible, approachable, and worked tirelessly to make this system work. This new option that's being proposed is frightening to many of us. We're not sure how our students are going to be able to work in a totally virtual academy and continue to build the models that we're looking for. Students should be able to attend their home schools. They should be able to work with the teachers that they're accustomed to, have some continuity. So much of what's happening in students' lives right now is just absolute upheaval. We're doing our best to try and make their regular day-to-day lives as consistent as we can, but this is just one more change. Asking students to go into a group with teachers they've never seen before, students they'll never see again, and learn in a completely different manner is really just unacceptable for them. We need to think about the teachers. We need to ask them not to put themselves at risk to perform their best. They need to be able to execute their best learning in the classroom. And as soon as the first student sneezes, a panic is going to ensue amongst the teacher, the student, and all the people in the classroom. This isn't what we want for our kids. This isn't what we want for our district. This shouldn't be what we want for anyone. I wholeheartedly believe that the relationship between students, teachers, and families is what makes a school and a student successful. I would encourage you to forgo the digital academy entirely. Continue to build upon the spring model, allowing for 100% virtual learning to happen so that students can work with their home schools, their home teachers, and be able to have a more successful academic transition. I appreciate your time, and I look forward to you voting this down. Thank you very much.
Thank you. Leah Wood.
I'm here. Can you hear me?
Yes, thanks. You can start.
Hello, my name is Leah Wood. I am a classroom assistant at Feltonville School of Arts and Sciences and one of the Parapower organizers. Paraprofessionals serve the district's most vulnerable students. We are your SPED assistants, ASL interpreters, and SSAs. We educate all students. We break down lessons and make it understandable for students. As a one-to-one, we not only help our assigned students, but also their classmates. We work directly with students who need the most care. Those who need help with toileting, feeding, those who spit, kick, bite, hit, and elope, as well as teach. We are your bilingual counseling assistants and your family and community engagement parents who work with and in the community. We talk to parents who are immigrants, English language learners, and parents of children with special needs. We coordinate services for families and educate them on the things that are important for their child's education. We are essential, yet we are often ignored and treated like a nuisance. We deserve healthy schools. We deserve non-toxic schools, schools free of pests, asbestos, lead, mold, and have proper ventilation with windows that open and working air conditioners. Many special needs students have issues, and this could kill health issues, and this could kill them. Have we remediated the lead and asbestos yet? I'm scared of bringing COVID home to my immune-compromised son. We have no confidence that this district will adequately supply the things we need to keep us safe. In a normal year, schools barely have enough soap, hand sanitizer, paper towels, and toilet tissues. We already buy gloves, Lysol wipes, paper towels, and hand sanitizers. We couldn't even get Chromebooks for remote learning. We were told Chromebooks were for teachers and students, as if we don't teach. What about face shields? Will we get enough PPEs? I'm doubtful. This means we'll be forced to take money from our already strapped paychecks to purchase our own PPEs. We make up to $30,000 a year. That is not a living wage. We created a relief fund to help our fellow paras who are in danger of utility shutoff, food insecurity, and homelessness. What more do you want from us? This reopening plan doesn't take into account working parents, especially teachers and staff who will be on different schedules than their children. It doesn't take into account that parents must stay close to our students. We cannot social distance. Do we get the option of being remote? We don't want to die. If you're not willing to send your own into our schools, don't send ours. And finally, since Comcast played matchmaker for the consultants developing this reopening plan, I'm quite sure there's a plan for giving free high-speed internet to district staff and students. If not, it's a waste of time, money, and trees. Parents go above and beyond for our students, more than the people in this district who have more. When will you do the same? Thank you.
Hello, can you hear me?
Yes, is this Alexis Zhao?
Yes.
Thanks, you can start.
Hi, my name is Alexis Zhao. I'm a fourth grade teacher at Arthur in South Philly, and I'm the parent to a rising kindergartner at Penn Alexander. Anyone who believes that this plan will be implemented with fidelity in all of our schools is naive. Our classrooms are crumbling mouse, asbestos, and roach-infested hazards on the district's best days. To say returning now is important for socialization is ridiculous. Pre-COVID, my fourth grade classroom was a safe space where students had autonomy over their bodies and their actions. At any time, students could be found on beanbag chairs, using lap desks in the library, working in partners and groups on the rug. Students' voice and collaboration were at the center of their learning. Sending us back now as cases are rising and people are still sick and dying, there will be no positive socialization happening. There will be no centers, no groups, no partners, no freedom to move around. There will be no community supplies, which our students need because they can't afford them on their own. No pencil sharpener because I can't sanitize it enough to ensure kids don't spread germs while using it. Classrooms that were once a source of safety, joy, and comfort will become a source of fear, anxiety, and stress. Our students do not deserve to be forced into these environments. Students who are used to collaboration will be forced into isolating rows 6 feet from friends with teachers lecturing at the front, afraid or unable to circulate the room because of distancing. That's a best case scenario, and that is not school. And it will not look like this in our kindergarten, autistic support, or behavioral support rooms where students are unable to follow these new norms. How can we sit in this Zoom and 440 people get to work virtually from home because it's not safe to have gatherings while we debate sending our children into buildings with 150 to 2,000 people at half capacity? I seriously wonder if the people who wrote this plan have actually met a child. Yes, some of them will wear masks and distance, but others, like my kindergarten son, will play with them, drop them, lose them, chew on them, fling them across rooms. Our middle schoolers, because I taught that for 2 years, will scream coronavirus anytime anyone coughs, while others will lick their hand and chase people yelling COVID because this happened in the spring. It's going to happen in the fall because these are kids. There's too many questions and not enough answers that genuinely keep students' best interests in mind. How can you say Philly kids aren't getting sick while ignoring the variable that schools have been closed? How can students be safe on packed SEPTA buses? How can our kindergarten, autistic support, and behavioral support teachers and paras keep themselves and their students safe? How can teachers be expected to monitor face-to-face and online at the same time? Students will have less access to teachers now than they did in the spring. How are you going to ensure that our virtual students are getting the same quality instruction and community? This plan does not ensure equity in education for our students. Let us be virtual until January. Let us plan now for high quality virtual instruction. If anything, let teachers stream from our classrooms. I've been to too many student funerals. Don't make me attend anymore. Thank you.
Thank you. Madam President, that concludes group 2 of our speakers. Part of group 3 will also proceed before the board conducts its votes, but this is the time for comments.
Is Dr. Height there available?
I'm sorry, I am here.
Oh, okay.
Yes. So sorry about that. So once again, thanks to all of the speakers from 41 to 80 who spoke passionately about these issues. And I actually was gonna take a moment to theme some of the things we heard during that segment as well. I think one thing that's really important is that what people are describing as the digital academy would be the virtual program. So I want to make sure that's clear. So let's say we shifted the plan and went all virtual, it will be the same approach. But what I'm hearing from many individuals is that they would much rather their children be associated with the teachers from their school, and there are reasons why we are not able to do that. And we're working with the PFT to figure out a way to do all of those things. Most of this was themed on the same thing, but it was around the digital academy and the digital academy and face-to-face. I just wanted to add that if in fact we went all virtual, it'd be very similar to what we're setting up as what we are describing now as the digital academy. The only distinction would be the children would be assigned to teachers from their own school. And so I do want individuals, if people haven't read clicked on the plan and seen the details of the Digital Academy, I strongly encourage individuals to do that. And there's not a lot else to add on this point. I just wanted to talk about a Digital Academy. The other thing is about staffing though, and because we heard quite a few questions around staffing. And I think that one thing that's really important on the staffing point is that given what we have to deal with, and I appreciate the callers who acknowledge how complex this is, because it is. It's complex. We've never been through this before. We're trying to establish opportunities for children to be in person because we still do have families, although afraid. We also have families whose children did not do well when we were all just virtual in the spring. And many families asked and requested support. In addition, we have to think about structures for who will help families that are essential workers if in fact we're all in a virtual model. But one of the things I wanted to talk about is that we're still finalizing a plan for what staffing will look like. And I know people want all of the answers, but I have to say some of those answers we don't have at the moment. And as we're finalizing that, one of the things we are trying to do is also prioritize those teachers who have vulnerabilities or live with individuals with vulnerabilities, who will not under any circumstances be able to teach face-to-face. So therefore, those individuals would be assigned to teach virtually. And if you're thinking about in-person and virtual together, then that is a function of how many people sign up for one program versus the other. And so we're trying to work that out. We're working with the PFT to come up with a process for how that will work. But I just wanted to call to everyone's attention that the Digital Academy, let's say like we just shift and go all virtual. What is described in the Digital Academy will be the approach for the all virtual. And the only distinction would be that would assure that children are assigned to teachers from their respective schools. So with that, Madam President, I think we can move on to the next set of speakers as well.
Thank you, Dr. Height.
Okay, thank you. We're proceeding to the next group. The first 5 speakers in this group will be Tamika Diggs, Karina Hirschfield, Alexandra Fields, Derek Hauk, and Jennifer McKenna. Is Tamika Diggs here?
Good evening.
Thank you. You can start.
Good evening. My name is Tamika Diggs. I am a parent of an incoming 8th grade student at Penn Alexander. I am also the parent of the 10th grader at Parkway West High School who is a student in their autistic support class. I have been a part of Penn Alexander since 2002. I am the mother of 3 sons who sought the best education for them. I understand that our school is one that has accessibility to a high amount of resources. As parents at Penn Alexander, we understand that our school is not the norm and that most schools in the district do not have access to the same resources. As a parent who also has a child with different complex needs in a school that has limited resources, which is Parkway West, I know this all too well. We as a collective are here to advocate that this plan is not viable for many. I am here to also advocate for parents whose children have different needs, whether they have IEPs, 504 plans, severe medical needs, behavior needs. What are we to do? How will the district decide which child attends 4 days and which child attends 2 days? Why would we want our children to attend any of those days given the current plan in place? What about the transportation for special needs, which is sorely lacking when we are not in the middle of a pandemic? Will the students be able to have their educational needs, their one-to-ones? How about TSS workers? A lot of kids who have specialized needs also have medical needs. So are we to sacrifice our children's health with an illness that we don't know much about? Are we to have our children filled with anxiety where they can't function in and out of school? Am I to send my autistic son to school who has severe medical needs, praying he doesn't get sick because someone else is asymptomatic? Currently, the district does not have comprehensive processes and policies in place in all the schools to ensure that all students will truly be supported physically, socially, emotionally, and academically, both prior to the school year and throughout the school calendar year. Please reassess this current plan for the upcoming year. While remote learning isn't what we wish for, it is the only option. It just needs restructuring and planning before it's implemented. However, it is the safest for our children, staff, and teachers. Thank you. Good night.
Thank you. Karina Hirschfield, I actually understand that they will not be speaking tonight. So Alexandra Fields.
She is present, Lynn.
Oh, Karina Hirschfield is present?
Yes. That is correct.
Okay, I'm sorry.
Can you hear me?
Yes, you can start. Thank you.
Okay, great. Hi, so I'm Karina Hirschfield. I'm a school counselor, advisor, and coach at the Science Leadership Academy. Since the release of last week's opening plan, I've struggled to get past one fundamental issue that profoundly affects our ability to embrace it. Simply put, we have no trust in the district leadership. Without that trust, skepticism, lack of communication, and continual questioning of motives and decisions will undermine even the best plan. At the start of last school year, Science Leadership Academy was required to move to a newly renovated building shared with Ben Franklin High School. The moment I set foot in our new building in mid-August, I knew something was wrong. Incomplete roofing, walls, bathrooms, and ceilings, dust particles and piles of debris everywhere, unfurnished classrooms, missing window guards, bare wiring, sharp metal, beams exposed, you get the idea, and much more made it apparent to staff, parents, and students that the school was not ready to open safely. Despite our concerns and the obvious state of the building, the district leadership repeatedly assured us that it was indeed safe. The district blundered. And as Principal Lehman mentioned a few speakers ago, the district put our school communities in harm's way. The insistent concerns and advocacy of our parents, students, and faculty and union leaders, you know, the ones that Dr. Haidt is not currently co-planning with, led to the discovery of airborne asbestos fibers in the building. Our deepest fears were realized. Our school was uninhabitable. We did not return back to our building until 5 months later. Contemplating the vital task of opening schools safely with a cloud of COVID hanging over all of us, I cannot escape the deep distrust that permeates our country at the local, state, and national level. I wish to ask the school board, after our experience with the delayed construction and the asbestos ever present in our schools, what have you done to earn our trust? I have 2 simple requests to help rebuild the trust required in these unprecedented times. First, I ask that during the planning process, the school board and all administrative committees commit to in-person meetings in order to model the behavior you're asking our school communities to adopt. If it is safe for us to go back into our buildings, then it should be safe for this team and all leadership teams in the district to meet in person. Second, whether we open in person in September or begin online and move to in-person later later in the year, I request the school board and district leaders commit to model for our communities a live run-through of the in-person school plan. This run-through should reflect an entire mock school day, including going through metal detectors, adhering to social distances, walking through hallways, eating in the cafeteria, bathrooms, everything that, all the safety measures that are being proposed. If you agree to these simple acts, the school community can begin to trust you. You will lead by example and learn.
Thank you.
Hi.
Alexandra Fields?
Yes, can you hear me?
Yes, thank you. You can start.
Great. Yep, hi. My name is Alexandra Fields, and I'm speaking tonight as an English professor, a literacy consultant, and most importantly, as the mother of 2 McCall School children. I understand that the district is faced with a difficult predicament, but I am here because I am dissatisfied with the proposed reopening plan. My first concern lies with the hybrid model. Parents want to know how their children will be supported during those 3 days of home-based instruction, when it is clear that their children's teachers will be busy teaching other children. Parents of children with IEPs want to understand how their children will be serviced on virtual school days when their children's teachers are teaching another cohort. Teachers want to know how they are supposed to support their own children during the days when their kids are home, but the teachers themselves are expected to be in the school teaching. And let's be real. As a parent, I know how tricky it is to enforce mask wearing with my rising first grader. And yet this whole plan is predicated on the idea that hundreds of thousands of kids will be able to keep masks on for almost 6 hours a day. How is that realistically enforceable? My second concern is with the centralization of the Digital Academy. Since all children will be receiving the majority of instruction from home, whether in the Digital Academy or hybrid model, shouldn't the bulk of district funding go into creating a robust online curriculum? And how can you expect us parents to even make a decision between a 100% online model and a hybrid model without being given all the details? You said tonight, Dr. Height, that you will give us more information on the Digital Academy, yet you expect us to make a decision by the first week of August without yet having that information. We want to know who will teach our children in the online model before we decide on the Digital Academy. We want to know if learning will be synchronous or asynchronous. And we want to know how our decision to enter into the Digital Academy will impact our homeschools and the leveling of teachers. The Digital Academy is highly problematic, and online instruction should be run within each homeschool and not through a centralized district model. Most importantly, the district should be looking into how it can best support children with the most critical needs first, by identifying a wealth of home-based resources, using schools as resource hubs for children with critical needs, and by spending much more time asking families and teachers directly what resources we need in order to feel capable of managing the next year successfully. You have an opportunity to create a plan here that not only keeps our families and teachers safe, but also addresses larger equity issues that the district has struggled with for years. In schools, we always talk about holding our students to high expectations. Students will rise to whatever level we ask of them if we keep the bar high. This plan does not place the bar high. Frankly, by trying to do it all, it does everything poorly. Let's try again, and this time let's not start with a top-down model, but instead start with a fully online model that gives more power back to the schools and teachers who know the needs of their community best. And please eliminate.
Our next speaker is Derek Hauk.
Hi, I'm Derek Hauk from Building 21, proud member of the PFT and Caucus of Working Educators. Quick look at the scoreboard. Looks like we're up to 1 million speakers in favor of virtual and Dr. Height by himself saying hybrid. You're really out here telling kids that if you love your teachers, you got to risk your life to go to your homeschool. If you want to stay safe, go to the Digital Academy and talk to strangers. I'm glad to hear it seems Dr. Height is realizing this major objection now. The next thing is our school staffs are at the bare bones and cannot withstand the kind of reshuffling that Dr. Height is proposing. There's one teacher at my school to teach all of Algebra 1. If that person goes digital, now I teach their class too on top of all my others. This timeline where you're going to be juggling rosters well into August leaves us no time to prepare for whatever subjects we're teaching whenever we happen to find that out. Next, have you pictured the instruction going on in these face-to-face classrooms? Students are 6 feet apart, masked up. Any collaborative small group stuff we might try and pull is going to require students to do it on their technology device, remotely. If we're essentially teaching remotely anyway, why risk lives to do it? Please don't be fooled by one person saying that any of this is better for kids than committing to a 100% virtual start and giving staff time to appropriately plan. Time that we did not have in March when Governor Wolf had to step in to keep our kids safe, when Dr. Haidt appeared comfortable continuing to send them to school. Others were saying at the top about how our students are so far behind and so on. Let's not let deficit thinking frame our mindsets. The headline here is not that remote learning fails students, though improvements can be made. The people tonight have been abundantly clear, 1,000,000 to 1 so far, that it has been the years of divestment in public education, specifically in building maintenance, that have made remote learning the only safe, viable option at this moment. We really can and really want to improve remote learning. Give us the time to plan for it. You all right now are showing us the promise of remote learning in voting to open schools over a digital platform. I cannot fathom a more effective virtual masterclass in dramatic irony. You have students out here, parents out here, teachers, staff, principals. It's everybody who's in the school buildings. Are you going to dare vote against this coalition? Please join us. I just also wanted to express solidarity with the students who spoke out on the racism in the district. We can start helping them by keeping them safe.
Next speaker is Jennifer McKenna. And after Jennifer McKenna, we'll have Geraldine Ivory, Karen Williams, Amy Seismansky, Rebecca Bodil, and Tamia Scipio-Smith. Is Jennifer McKenna here?
I am.
Thank you. You can start.
Thanks for having me. My name's Jennifer McKenna. I'm a parent of a first grader and recently joined We Caucus. These are extraordinary times and require extraordinary actions. Not one student, teacher, or school worker should be sacrificed in order to open in-class education. We are at a place that we just can't say truthfully that we know really anything about. There's no evidence that concretely states that it's safe to have teachers, staff, children in schools. We simply don't have an understanding fully of this virus and its short and long-term implications. Asymptomatic carriers spread the virus with aerosol droplets via closed room situations, exacerbated by ventilation issues, and also possibly by uncovered toilets. Most schools don't have toilet coverings. If a child cannot enroll in Philadelphia schools without an updated vaccination list, how can they come to school now when we're in the midst of a pandemic with no vaccine? Schools regularly have deficits in supplies of soap, paper towels, toilet paper. A lot of people have covered this before, but there's no way to consistently guarantee that these supplies will be available. And offering families to take care of temperature checks before coming into classroom settings, it's just not feasible. Families don't have thermometers. Families will be desperate because of childcare needs. They'll send their children in sick. We are not guinea pigs. My friends are teachers. They are terrified. We cannot sacrifice them. If we are pushing to reopen schools in person due to political pressure or worried about withholding of funds, we have to revolt and review our deepest guiding principles. South Korea, Hong Kong, these are models that show us that in-person teaching is not correct. We need virtual learning with our teachers. The virtual academy, it's just too far removed to be efficient. We have wasted enough time trying to come up with plans that are not going to work for our kids, for our teachers, for our administrators, for our school workers. Please vote no.
Geraldine Ivory. Is Geraldine Ivory here? Karen Williams.
I'm here. Can you hear me?
Is this Geraldine Ivory or Karen Williams?
This is Karen Williams.
Okay, go ahead. Thank you.
Hi, my name is Karen Williams. I'm a teacher at Rowan Elementary. I just wanted to express my frustration with the school district's decision to reopen in September. I can say from firsthand experience as a former student, a teacher, and parent of 2 enrolled students that many of the district's buildings are not safe. As a matter of fact, some of them are very toxic. They're not suitable or even prepared for the return of staff, students, and or any community partners. I want to take you guys down a walk of memory lane. I distinctly remember the stench of urine in the hallways and basement of the buildings at Kendall Elementary when I was an elementary student. It was appalling and embarrassing. We often felt dirty as students, and to make matters worse, the children were said to be at fault. The fear of using public bathrooms remained with me up until my adulthood. I still find myself holding my urine during the day until I return home in order to avoid the stalls in school buildings. 20 plus years later, I returned to the district as a school teacher. And guess what? The smell continued to haunt the school. I have purchased countless deodorizers and cleaning supplies to combat the odors, clean the mice drop-in and leftover food from breakfast programs, as well as to manage and prevent unwanted pests. And by the way, none of these actions are required of me as an educator, but I care. I have been in 4 other schools, and guess what? Those buildings were in the same unkept conditions. Many excuses were given to teachers when we expressed our concern. Shortage of cleaning staff, maintenance staff, not enough cleaning supplies for the entire building, well, except, of course, for the front office and the surrounding area. We have become so immune to the poor condition of these buildings that even most people pretend not to notice when they visit. It is so sickening and so disheartening that anyone thinks this is okay. So forgive me, because I very much doubt that our district has the capacity to keep the building clean during a pandemic or have a plan to address the outbreak of COVID from spreading on common shared surfaces and spaces, and continue to remediate lead and asbestos. In addition, the ventilation and heating systems are beyond repairable. Many windows have been still shut for security reasons. Hand sanitizer, Lysol wipes, tissues, paper towels have always been in shortage, so much so that we request parents to purchase each year on the supply list. Given the history, how could you really expect us to believe that we will be safe according to your plan? How do you request the entire school culture in our city to put their health at risk? Our families, our communities, our Black and brown children that we serve each day. I'm requesting that you reconsider your plan, reassess the population again, since the data you collected was over a month ago, and COVID data has remarkably changed since then. And an increase for social distance measure. I'm requesting that a committee board is formed with all the stakeholders, the parents, the teachers, and community members involved to oversee the plan and procedures implemented in a phase with a more reliable time frame. Please know I desperately miss my students, and I want the best for them and for dedicated educators like myself. I have no reservations about my objective and will continue to advocate for equality in schools. I also stand with the Racial Justice Organizing Committee as a new member and ask that your district endorse the Black Lives Matter Week of Actions and attend demands of radical transformation.
Amy Szymanski.
Yep. Can everyone hear me?
Yes, you can start.
As the PFT building representative from Vox Big Picture High School, I demand that all reopening funds be directed towards preparing teachers to deliver the highest quality virtual curriculum and programming. Returning to school will risk everyone's health and potentially their lives. By the district's own admission, returning in person will lead to inevitable outbreaks and subsequent shutdowns. The district's solution is to play God and decide who lives and who is expendable. But the fact of the matter is, a shutdown is inevitable. When flu season hits, any expert would predict a second wave as bad, if not worse, than what shut us down in March in the first place. Why play around with people's lives for a few months in the interim? Few, if any of us, were trained to be remote teachers. If we wait to be forced into remote learning rather than intentionally building systems of instruction and accountability in virtual classrooms, we'll end up with the same pseudo-learning that plagued the district this spring. I rebuke Dr. Height's response, though, that students were unsuccessful this spring because of the remote model. Students had no academic work for a month and a half, and when they finally did, students knew from the jump that there were no grades. Don't we think that that contributed to students' lack of success? Teachers also weren't trained to be strong remote teachers, how to still push inquiry, check for understanding, and encourage peer-to-peer discourse through a screen. Don't we think that that contributed to students' lack of success? There are ways to successfully teach remotely. What is the district doing to ensure teachers can host strong classrooms online this fall? Fundamentally, teachers should not have to choose between sacrificing their life or keeping their job. I'm young and healthy, but frankly, young and healthy people are dying of COVID too. Has the district asked every school district employee and each of their loved ones if they're willing to die for students' education? Because that's what the current plan demands of them. Dr. Height has stated that it will cost nearly $80 million to return to unsafe buildings when we could be spending that money on training, resources, and digital platforms for stronger remote teaching. Currently, the plan consists of pretending life is normal for 2 days a week until the first exposure in a child's school, or God forbid, a death, disrupts everything again and forces us to return to blundering our way through remote learning. Let's be proactive and prepare for the inevitability of virtual teaching instead of demanding staff and students sacrifice their lives for the sake of a shoddy hybrid model. One last point, I would like to point out that schools with strong advisory models better weather digital learning this spring. In both remote and hybrid models, advisory models provide all students with a consistent group of peers and all families with a consistent staff contact person at school. This consistency facilitates emotional and logistical support to each and every student in a way that is both effective for families and sustainable for teachers. In a face-to-face model, advisories will also limit student and staff exposure. So at the very least, in the event of exposure, only me and my advisees would have to quarantine, as opposed to all 150 students I teach, along with every teacher and student that each of them saw after being exposed. This model is mildly safer and more humane than the model the district is currently proposing.
Rebecca Bodile, is Rebecca Bodile? I'm sorry if I mispronounced your name. Is this Rebecca?
Yes, this is her.
Thank you. You can start.
Hi, Rebecca Badilli, and I am an art educator at Bryant Elementary in West Philadelphia. At this time, I do not believe that it is safe to return to our school buildings in the fall. Until this pandemic is under control in our state and city, returning to our school building for in-person learning puts all of us at risk for illness and even death. There are a number of students and staff who are high risk themselves or live with other individuals who are high risk. It is unfair to expect us to return to buildings that were poorly maintained prior to this pandemic. The proposed reopening plan does not adequately address the needs of teachers directly. Many others have already spoken to these issues, but I wanted to specifically highlight how this plan impacts specialists. As of right now, specialists such as art, music, and gym teachers are expected to travel between classes, effectively becoming super spreaders of the virus. The district's reopening plan relies heavily on the idea of students moving in distinct and separate cohorts. Specialists and any other educators required to push in disrupt these groupings and allow for the spread of the virus between cohorts. If I am asked to see 6 classes a day, I am being exposed to 6 times as many students as a classroom teacher. What is the acceptable caseload for any staff member to come into contact with each week? I care deeply about our students, our staff, and our community, and I want to protect their health and safety. Many of our students do not have reliable internet access. Much of our staff does not feel properly equipped to conduct online classes successfully, and many of our families are struggling with basic needs like food, housing, childcare, and healthcare. Instead of spending time and money on a plan that endangers all of us, I want to urge the school district to address these critical needs. If we turn our focus to virtual learning now, we can train teachers and staff to effectively teach online this fall. We can work on creating a program that directly addresses the needs of our communities. Until this virus is under control in our communities and we have equitable access to COVID-19 testing and contact tracing, I truly believe that virtual learning is the only safe option. Thank you for your time.
Thank you. Tamio Scipio Smith, and after that we'll have Margaret Chin, Nikhail Anand, Chelsea Trainer, Ellen Fu, and Cindy Stone.
Hello, can you hear me?
Yes, thank you. You can start.
Thank you. Good evening. My name is Tamia Scipio Smith. I'm the Education Policy Director at PCCY, Public Citizens for Children and Youth. I commend Dr. Haidt and the school board for completing the district's reopening plan. However, in the face of enormous uncertainties about the school year ahead, as a child advocacy organization, we want students and teachers to return to a high-quality learning day that is accessible to all students, yet prioritizes their health and safety. Here are 3 key ideas to ensure a successful transition back to school. First, our teachers must be prepared to teach all students when school starts. We urge you to make the mental shift that schools will not likely be safe to return to in September. Students of all learning abilities will be home for much or all of their time. Although many teachers have adapted to online instruction, they have not had enough training to ensure that they can actively and engagingly teach their students remotely. Starting now, teachers should be receiving comprehensive and robust professional development to ensure that they have the skill set to use online learning platforms, help students and their parents navigate lessons, virtually teach in real time, and prepare lessons for students to watch later. They should also receive training on how to better assist our most vulnerable students, those with disabilities and English language learners and their parents. Moreover, teachers need ongoing training to keep their skills fresh and our students learning all year long. School districts like Broward County, Florida, the 6th largest school district in the country, is already doing just this as they prepare to welcome students to virtual school this fall. Second, our students, teachers, and families' health and safety cannot be compromised. Students should not go to buildings unless science says it's safe to do so. Everyone has on-site temperature checks before entering. There is sufficient space to maintain social distancing. There are enough staff and products to rigorously clean and sanitize classrooms. All students and staff have access to hand washing and sanitizing stations, and students only participate in non-contact sports. I have submitted our full list of recommendations to ensure the health and safety of students and staff from PCCY and our Fund Our Facilities partners for your consideration. Finally, I'm calling on all testifiers, citizens of the city, and other community members to join PCCY in demanding more money from schools for the federal government. We are repulsed that the federal government is threatening to withhold funds from schools that aren't ready or equipped to physically open in the fall. Moreover, school districts like Philadelphia simply do not have enough staff to comply with current safe distancing requirements. It is a disgrace to keep this desperately needed funds from our school districts when they are needed to train teachers, get students online, keep them learning, and implement the necessary protocols in buildings and classrooms to keep students safe. We must do all our part by contacting our federal lawmakers and demanding that the federal dollars get to where they're needed, regardless of if we operate virtually, a hybrid model, or in person. Yes, the road ahead is difficult, but not impossible. With teacher and staff training, common sense solutions to protect the health and safety of our school communities, and adequate funds to properly implement them, Philly, together, we can do this. Thank you.
Margaret Chin.
Good evening.
Okay, go ahead. Thank you.
Good evening. Thank you for this opportunity to express our concern for school reopening. I'm Margaret Chin, retired school district administrator, principal, teacher, and emeritus president of Asian American Educators. But most important, I have 2 grandkids in our public school. I'm also sharing concerns of parents and students in our Chinatown community. My focus is on 3 areas. 1, the quality of the digital learning. We need to strengthen the quality of the online instruction to be age appropriate and engaging. Asking a kindergartner to watch a video and then respond to questions is not teaching and learning, especially when the student has to type the answers in the Chromebook. Teacher-students interaction is vital. Meeting with students once a week for 30 minutes is insufficient, especially for younger students. Interactive teaching and learning can take place if well planned, and we have the time before school starts. 2, monitoring of student progress. How are students evaluated with digital learning, especially students who have limited access not only to computers, internets, and even adult supervision? We need to have a systemic feedback periodically for the parents and not just at regular scheduled report cards. Most parents, guardians are trying to work and help the children with their digital learning. That is not an easy task. So clear directions, messages on a consistent basis can help. Even though some directions are translated, but it's still a hardship for parents to teach or help the children with the contents. 3, cleanliness of schools and transportation. We're very concerned about the safety and cleanliness in school. The district needs to articulate how to ensure student safety in this pandemic and how safety measures are provided for students who ride a bus to school. I thank you for your attention. Our students' learning and safety are of our utmost concern. Good evening.
Thank you. Nikhil Anand.
Yes, good evening.
I'm sorry if I mispronounced your name. Go ahead.
Thank you. Thank you to the school board for your work in these difficult times. I'm a parent of a rising 3rd grader and a kindergartner, and I am looking at this coming semester with some apprehension. Balancing the needs of public school children to be in school, for their learning needs, to achieve racial justice, and to keep children and teachers and staff safe is difficult, to say the least, especially in these unprecedented times. I support the call for older school children to learn remotely. Recent reports indicate that teenagers contracting COVID-19 and passing the infection on to others, adults and other teenagers, is not dissimilar to other adults. Teenagers are also better able to learn in an online environment with their regular home school teachers. And I ask the board to swiftly commit to this model, commit resources and the expertise to this model. Primary school children, however, present precisely the opposite problem. A July 11th article in the Washington Post draws on evidence from school openings in several other countries to show, and I quote, that documented cases of younger students, that's students under 12, transmitting the virus to their classmates or to adults so far appear rare. And I think some of the presentation earlier on this evening indicated as much. Children under 12 are also unable to adapt to remote learning. A panel of scientists and educators at the National Academies for Science, Engineering, and Medicine have concluded that online learning is ineffective for most elementary school children and special needs children. Taking into account the social and long-term risks of children not going to school against the risks of contracting COVID-19 or passing it on to others, teachers and staff, the American Academy of Pediatrics urge that schools be open, particularly for students under 12. Given this, I would like to ask the school board why face-to-face school was not proposed for primary age kids 4 days a week. If this was a financial decision, might the board revisit face-to-face learning should additional funding, either from the federal government or pilots from city nonprofits, be forthcoming? Thank you.
Chelsea Trainer.
Good evening. My name is Chelsea Trainer, proud third grade teacher at Lewis Elkin Elementary. Many people have spoken before me and more will follow about the myriad issues school communities have with the school district's plan. I want to focus on issues with the Digital Academy because virtual is our only safe option. It's insulting to imply folks would be here speaking up against the plan while not informed. I read it and read it again. It's not good enough. In theory, the hybrid plan begins to offer a safe return to schools, but in practice, past experiences speak for themselves. We've little evidence of the district being able to follow through on ensuring environmental safety for all building occupants, re-lead, asbestos, and air quality, as we've seen at Elkin, Pierce, McClure, Ben Franklin, SLA, and many more schools that time will not permit me to list. You prove a history of excuses, not execution or equity. Acknowledging the district's inability to execute plans for health and safety under normal circumstances means the only way the district can guarantee health and safety during a global pandemic is through virtual teaching and learning. So right now, joining the Digital Academy is the only way families can ensure their safety. But the current plan for the Digital Academy fractures school communities. The Digital Academy ignores relationships built between students and teachers and families in years past. School staff and families depend on the social safety nets that school communities provide. You are forcing families to choose between their children's physical safety and health and their academic, emotional, and social development, as well as future academic and occupational opportunities. Dr. Farley told us that it's not if, but when someone will be infected in school. And when that's the case, are students stuck in the Digital Academy with teachers that don't know them, their families, or their histories, while other students whose families could not choose Digital Academy get to be digital with their friends and teachers they know and love. At its current state, the plan for Digital Academy fails to adhere to the district's self-proclaimed guiding principles of continuous high-quality instruction and educational equity. I implore you to consider an alternative Digital Academy model where individual schools are able to assign teachers to teach remotely to that school's students, allowing students to participate in the programming and instruction their families signed them up for, such as CTE, AP, IB, and dual language with the teachers they know and love. There's no equity or high quality instruction without digital access to these programs. And one more thing about your commitment to equity. You say you will focus on removing and ending racist practices. Your students, educators, parents, and other community members are doing amazing work through the Racial Justice Organizing Committee and other groups. They've compiled a list of 10 demands that are essential in ensuring our schools, and as a result, our city, are places that allow for Black and Brown students, educators, and families to thrive. Purposeful action needs to be taken in order to eliminate adverse outcomes derived from perpetual structural racism. Thank you.
Alan Fu.
I'm here.
Yes, you can start. Thank you.
Good evening, board members. My name is Alan Fu, and I teach 5th grade math at Taylor Elementary. Every country that is reopening schools have managed to contain this pandemic. The United States haven't. We are taking a different risk about reopening than most other countries. Our testing capabilities are still limited. There are long wait times for results. Most of our students live in multi-generation homes, greatly facilitating any spread. They may spread the virus to other adults in their households. This is like Florida rushing to reopen businesses before they got community spread under control. Now, major cities in Florida are hot zones. We cannot put the onus of reopening planning on principals and teachers. We are not healthcare experts. I appreciate the outline of a plan that the district have made public, but much of the day-to-day procedures and health and safety decision-making, they are left to principals and teachers. We should not bear the responsibility of making a colleague sick or dying. If you want us to return to work, a much more detailed, comprehensive, and easy to follow plan would engender more trust than that we are returning to a safe environment. Like most of you, I'm a firm believer that children learn best face-to-face. There is no replacement for a teacher kneeling next to a student, explaining and soliciting feedback. However, the entire premise of students falling behind is somewhat true, but also misguided. Falling behind from what exactly? Is there an absolute line ascribed by and agreed to by all parties that second graders should be able to do some abstract test by hour 3, day 74 of schooling? Nope. Some people in power decided this is just how things should be. Others have used the falling behind scare to justify many bad policies. And now we're using falling behind to enact a plan that put lives at risk. The district is offering a false choice: children falling behind or a high degree of possibility of infection at work. We educators can move that goalpost. Online teaching and learning is not ideal, but risking our lives based on assumptions that this will all work out, this is beyond foolhardy. I can't teach if I don't feel safe. Thank you for listening.
Thank you. Our next speaker is Cindy Stone, and after that we will have Rachel Beauchene, Rachel Allender, Deb Cunningham, Laura Keene, and Jennifer Lewis. Is Cindy Stone here? Is Cindy Stone connected? Okay, our next speaker is Rachel Beauchene.
Hi, can you hear me?
Yes, thanks. You can start.
Good evening. My name is Rachel Beauchene, and I'm a proud teacher at McClure Elementary, one of the many schools closed down for hazardous asbestos conditions this year, which unfortunately puts me in a not so unique position to speak to the district's ability and willingness to keep our school communities safe. As educators, we are required to use data and evidence from past performance to inform our decisions. All evidence from the ongoing asbestos crisis proves that time again, the School District of Philadelphia is a day late and many dollars short when it comes to the health and safety of our school communities. Nothing in this plan shows me that this time will be any different. We would be fools to ignore the evidence and trust that the district will follow through on protocols when we know for a fact that they have not done so in the past. We need to focus the time we have left on creating a robust, equitable, meaningful digital learning experience for all students this fall. The disastrous Digital Academy, combined with a lack of proactive planning for a virtual start to the year, will be devastating to our school communities. Instead of keeping communities together, this plan is pushing students and families away by forcing them to choose between their family's health and staying in communities whom they know and trust. This will lead to smaller school enrollment, less school funding, and will be absolutely devastating to the future of Philadelphia public schools at large. We cannot allow COVID to be to Philadelphia what Katrina was to New Orleans. Learning about these plans that greatly impact my life and that of so many people who I love through media outlets and Facebook is insulting and disrespectful to the thousands of employees who not only deserve to get this information directly, but should rightly hold a prioritized seat at the decision-making table. Whatever you were told tonight, school board, we were not invited to the table. If the district had involved stakeholders in a meaningful way, you would have learned about the hundreds of holes in your plan before releasing the embarrassing document to the public. While I truly do appreciate the involvement of medical experts, you left out the experts that live, breathe, teach, and learn in our schools. I would never dream of entering a doctor's office and presume to understand how it works. Doctors do not understand the realities of our schools. We keep hearing that masking and social distancing are the most important factors, but there is no acknowledgement that these things are not only impossible and unrealistic in our schools, but they are not conducive to quality education. All the benefits of face-to-face instruction go out the window when it becomes mask to 6 feet to mask instruction. This form of social distance schooling is not only dangerous, but it is more detrimental to our students' education than if we spent this energy focused on making virtual learning successful, which we can do, but not if we continue to waste our time pretending that the stopgap plan is going to work. By refusing to plan for a full remote opening, the district is not only putting off the inevitable, it is risking lives and destroying school communities. Thank you.
Our next speaker is Rachel Allender.
Can you hear me?
Yes.
Great. I am Rachel Allender, the parent of a rising senior at Central High School. Thank you to the school board and those who have set up this meeting for the opportunity for me to speak. I have reviewed the health and safety plan for the 2-day, 3-day hybrid and believe in its current form it is unrealistic and cannot be implemented with adequate levels of safety for any members of our school community. I have submitted in writing a series of questions that point to the impossibility of using the plan to have a successful school year in which the schools aren't disrupted by endless quarantines and abruptly reclosed as too many community members are exposed to the coronavirus and become sick, or worse, die. In my time today, I would like to speak to a deeper core concern about the plan and offer the start of a more realistic and responsible approach. An equal solution is not an equitable or just solution. If being in the school is dangerous for someone, it is dangerous 5 days a week, not just 3 out of 5 days a week. If being at home is untenable for someone, it is untenable 5 days a week, not just 2 out of 5 days a week. As a school district, we need a solution that accommodates every person's most basic needs from a health and safety perspective. It is paramount that our framework for accommodation acknowledges all needs as equal, valid, and meaningful. If in fact we determine that some students need a place to go, I propose a different kind of hybrid model, one that is entirely online 5 days a week, but gives cautious access to physical buildings. They could be schools or maybe more wholesome buildings where students can go who need them. Students in the buildings would be supervised and have access to computers, internet, food, and other needed services. Students at home would have access to their whole curriculum, even when under quarantines or while recovering from illness. All students would receive their curriculum from the school in which they enrolled and remain members of the same learning communities with their homeschool teachers and peers. All students would be entitled to remain at home for the whole year. The more students who are able to remain at home, the better our public and personal health outcomes will be. The less people who are in the buildings, the safer it will be for the students and staff who need to be in those buildings for some particular reason. I've only offered a rough sketch, but there's an opportunity to provide a more just, equitable health and safety school year experience for all involved. I hope that today the board will say no to the current plan and insist that we work towards a deeper level of care, consideration, and commitment to well-being to all members of our school community. Thank you.
Deb Cunningham.
Good evening. My name is Deb Cunningham. I have had 3 students go through the school district of Philadelphia. I myself am a graduate of a Philadelphia public high school. My youngest child is finally a rising senior at Central High School. I have served on committees, home and school associations as a room parent. I've made thousands of cupcakes for bake sales, driven thousands of miles for activities. I've spent countless hours with homework and projects. My children have had amazing opportunities as Philadelphia public school students. They have learned who they are and what they want in life. They have formed bonds and gained so much from the mentoring of the adults in their school communities. I am grateful for the education my children have received from some of the best and brightest teachers and staff in the country. Throughout all of this, though, there were some times policies I disagreed with, I have always believed the decisions were being made from a place of service to the people of Philadelphia. Those disagreements never led to a loss of faith in our district until now. There are so many questions that this plan leaves unanswered. Why does the Digital Academy require a 2-quarter commitment? How will students be ensured they are academically prepared to rejoin their classmates if they opt for online? Why are you requiring families to make an uninformed decision without any way out for a full semester? There is no course catalog, faculty list, administrative information, or course descriptions. There is no guarantee that specific AP classes, languages, or electives will be offered. There is already a guarantee that IB and tech classes will not be offered. How are families, particularly families of high school upperclassmen, supposed to make an informed decision? Being told that they will be able to catch up or supplement their high school career when some semblance of normality returns is not an option for these families. They don't have time to wait for you to come up with something better. These families are an extreme disadvantage when considering the many robust, comprehensive, remote, distance, hybrid, and in-person plans offered to their counterparts in more affluent districts nationwide. We are being asked on blind faith to trust you, to trust that the teachers assigned to digital classes are qualified to teach those classes, to trust that colleges will make allowances, to trust that buildings with decades of health and safety issues are somehow now healthy enough to house and protect students and staff. These are not choices, these are ultimatums. Families and staff are presented with choices that do not offer a full, robust, and healthy educational environment. Families and staff are being asked to choose between their education, careers, and their health, lives, and futures. These plans fail the families, staff, and communities you have been entrusted to serve. We have all given up so much already. Please don't let it be in vain. Thank you.
Laura Keene.
Good evening. My name is Laura Kane. I'm a proud parent of school district graduate, high schooler, and a middle schooler. I'm also an experienced educator with over 20 years in high schools. Clearly, these are unprecedented times as our students, staff, and schools are engulfed by 2 pandemics, the spread of COVID and the recent violent reminders of centuries-old and ongoing systemic racism against the Black community. I first want to applaud the students who persuasively presented their request to the district to aggressively address systemic racism. And I urge the district to take action, such as requiring student participation on all hiring committees in this 2021 school year, creating a diversity, equity, inclusion office at the district, and funding district-wide anti-racism training series for teachers this year and all staff as well. Secondly, I recognize the district for its efforts on the daunting, enormous task to create a school reopening plan. That said, this plan simply will not work. I strongly implore the board to vote no on tonight's proposed calendar and the opening plan. The district needs to shift all effort into mobilizing staff and teachers to create a virtual learning opening plan that will be delivered by each school, not by a central digital academy, agnostic to school communities. I'm the 99th speaker. I've been here since 4 o'clock with all of you. I applaud everyone's attention. It's unanimous. Every educator, parent, and student has shared the existing plan is merely a theoretical report and not actually feasible. It is not based in reality within a school building. The facilities examples have been many tonight. supplies for the building, cleaning. For 13 years, I've been buying sanitizer, tissues, and copy paper. That's usually what I start doing in August. Ventilation matters have been extremely focused on tonight as well. Clearly, the indoor prolonged activity is highly tied to coronavirus transmission. If we're not allowing restaurants to open, why are we allowing schools? Classroom sizes that merely cannot fit 33 students with even 2 feet between them, let alone 25 students with 6 feet. A point that I want to emphasize as well is that school culture and students' social emotional needs are real. And this can be met as long as the school communities are intact. There are strong relationships that are there to support students through this uncertain times. And forcing separation is a cruel choice to offer families. Finally, staffing realities also cannot be met with the realities of what's going on with leveling as well as substitute teacher issues. Finally, the one thing we can count on this year is uncertainty. Let's embrace it. We have 40 days to go. August isn't a time for feasibility studies, it's a time for plans. I clearly implore the vote of no by every board member to require the district to immediately speak honestly and in reality about what options can happen to support students virtually learning this year.
Thank you. Our next speaker is Jennifer Lewis, and then after that, we'll have Robin Lowry, Sally O'Brien, Dave Munson, Tony Staton, and Shaharan Santana. Is Jennifer Lewis there? Is Jennifer Lewis connected? Okay, Robin Lowry. Do we have Robin Lowry connecting? Okay, next speaker is Sally O'Brien. I'm sorry.
Can you hear me?
Is this Robin Lowry?
Yes.
Okay, go ahead. Thank you.
Hi, good evening. My name is Robin Lowry, and I've been a health and phys ed teacher in the district for 27 years. Thank you for problem solving in unprecedented times, but please show your support for the families and students and staff and vote no to the reopening plan.
Hey, you want to recess before we vote on anything? Without
Sure.
voting on
Right,
anything?
Madam President, you're not on mute. Yeah, we'll stop the clock or we'll restart. But Madam President, we just want you to know you're not on mute, so please make sure you're on mute. Okay, and I think the clock has been reset. So Robin Lowry, you can go ahead. Thank you.
Okay, health and phys ed. Thank you, Dr. Height, for clarifying the digital versus virtual, because it sounded like yet another way to break up schools. Schools have been unsafe, unclean, and under-resourced for a long time. Broad Academy superintendents have been destabilizing our schools from inside since Vallis, and now you ask us to trust that schools are going to be safe and clean and that our concerns matter, and we are right to be suspicious. You also ask us to believe in a new focus on equity. Will equity start with ending standardized testing, charter zombification, giving all schools playgrounds? What voices are going to be listened to for this equity? Experience tells me that teachers discredited and shut out by the district and union leadership longer than the Broad Academy has been training administrators are going to be ignored. Will you roll out the trope that we're only interested in our jobs if we're reluctant to go into unsafe schools? You can show this support for your community by voting no tonight. I'm concerned about the athletics plan, number 18. It says all student athletes should clean individual equipment and clothing after every use. Do you mean athletes are going to bring their own sports equipment? What if they don't have any? Will the district provide it? You expect them to launder workout clothes after each practice? Are you going to supply the washers and dryers? Or do you think students can just pop clothes in washers at home? What students are you talking about? As a PE teacher, am I supposed to disinfect equipment after every class? Who buys the cleaners? Will I have time to between the next class before the next group arrives? I have a washer and dryer in the girls' locker room. Am I going to have to do laundry for students? And then we get to topic 17, this healing plan. A few social, emotional, trauma-informed, mindfulness-based initiatives can't restore dreams and desires of Philadelphia students growing up in unsafe, inequitable, and under-resourced schools. Focus area 3 says relationships and community, which you clarified, but the Digital Academy didn't sound like that was going to help build relationships and community. Remember, our students are still recovering from the trauma this district imposed through the Renaissance, then charter takeovers of schools. We have high mobility. So if a student's housing situation changes and we're virtual, will they be able to stay with their current school? Because you could do that virtually. Is that part of a plan? I say vote no to the reopening plan. As a yoga teacher for 30 years, I can tell you mindfulness isn't a magical pill. My guru says that even for children, even yoga, roller skating is yoga. Mindfulness is paying attention, and they pay attention, children pay attention in coloring and singing and storytelling and precious activities that take classroom time, but they also need to be in a safe environment in order to start that mindfulness. So if we're really invested in mindfulness, we have engaging teachers, art, music, and phys ed students need more of that. And we could plan a whole new district. Let's be creative and start planning together.
Sally O'Brien.
Hello, can you hear me?
Yes, you can begin. Thank you.
Okay, thank you. Good evening, Dr. Height and members of the school board. My name is Sally O'Brien. I am an English teacher and PFT building rep at Kensington Health Sciences. And my 5-year-old son, who has an IEP for autistic support, will be entering kindergarten at Locke Elementary this fall. As the parent of a young child with special needs, I am acutely aware that virtual learning has major drawbacks. That's why since the spring, I have desperately hoped some kind of in-person kindergarten would be available for my son this fall. However, this past week, I have changed my mind. I cannot in good conscience support anything other than a 100% virtual start to the school year. In large part, this is due to safety. I share the concerns of all the other speakers tonight. However, I was moved to testify because I also believe the district hybrid plan will result in major staffing shortages and instability for students. My first year teaching was 2015-2016, the year of the Source 4 teachers substitute staffing debacle. That November, another teacher at my school quit. For several months, my colleagues and I had to cover his classes in shifts because there were no substitutes. I was annoyed about losing my prep time, but the real problem was, of course, that students learned very little under those circumstances. The substitute situation has improved since then, but in recent years, my colleagues and I have still often had to cover someone's classes because a sub did not pick up their absence, especially during cold and flu season. Probably the most egregious example was on Friday, March 13th, when a huge percentage of staff had to stay home in Montgomery County. My principal did a heroic job arranging coverage, but even so, not a lot of learning happened for students on that very chaotic day. We are now facing a staffing crisis orders of magnitude more severe. Realistically, how many substitutes will want to cover for a teacher suspected of having the virus? Our most reliable subs are retired teachers. I doubt they will want to work under these conditions. What happens when teachers have to self-quarantine or take leave to supervise their young children on virtual learning days, or care for sick family members, or become ill themselves, or resign? Furthermore, subs often struggle with classroom management under normal circumstances since they don't have relationships with students. Even if we do somehow manage to cover everyone's classes safely, how can we possibly ensure that student learning will not be disrupted? The district plan puts lives at risk for a version of in-person learning that is guaranteed to be chaotic, limited, and unstable. And as usual, already marginalized students will suffer the most. Students with special needs, English learners, Black and brown children in hard-to-staff, high-poverty neighborhood schools. There are serious equity issues with virtual learning, but chaos and understaffing is an equity issue too. We need to devote our energies to creating a robust, equitable virtual learning plan now. Thank you.
Our next speaker is Dave Munson.
Hello, can you hear me?
Yes. Yeah.
Thank you.
Go ahead. Thank you.
When I filled out the survey that the district sent out last month, COVID-19 cases in Philadelphia and our surrounding counties were declining. I felt confident that they would continue to decline and that my child would be safe at school. Since then, Philadelphia's infections have been slowly increasing. Many of our surrounding counties are seeing second waves of infection. This, combined with the increases in infection we are seeing both at the state and national levels, has made me less confident in sending my child to school. While I am confident that the school district is doing the best with what they've got, I am concerned about our school buildings themselves. They tend to be older buildings with poor ventilation, some relying on window air conditioning units. Spending a large portion of the day in poorly ventilated rooms would increase our children's chance of exposure, despite the efforts towards cleaning and social distancing from the school district. At the same time, I am concerned about online instruction. Online schooling in the spring came as a surprise to many of us, and in my household, the distractions of being in the same space as toys and family members who children are used to playing with and not sitting quietly next to all day was very difficult, to say nothing of the digital divide that made it hard for many of our students to receive instruction. While I hope the school district has taken the summer to create a more robust online curriculum, there's nothing they can do about the distractions of home. I believe that in-person group instruction is the best model for my child, but I ask that it not happen within our school buildings. Various studies have shown that outdoor activities are much safer from COVID-19 than indoor ones. I ask if the school district would consider moving instruction outdoors as much as possible. Schools with small yards that could not accommodate all students could consider nearby parks. Last spring, schools in Denmark continued in-person instruction in parks, playgrounds, and outdoor stadiums. I would suggest coordinating with Philadelphia Parks and Recreation on opening these spaces to schooling. Additional space could be gained by closing the streets near schools to traffic during school hours, as recommended by the National Association of City Transportation Officials in their report, Streets for Pandemic Response and Recovery. I would highly recommend coordinating with the Streets Department on temporary closures for streets adjacent to schools during school hours. I'm a city planner, and when we talk about what type of building or activity should go on in a certain space, we talk about the highest and best use of that space. I would hope that schools, city officials, and near neighbors would agree that the safe education of our children is the highest and best use of our public spaces. While I am concerned about both in-person and online instruction, I trust that the school district has the best interest of our students at heart, and through coordinating with city departments to identify outdoor public spaces for instruction, I believe we can have a safe school year. Thank you for your time.
Thank you. Sharon Santana. And then after that, we have Janet McHale. Something that says Reclaiming Our Children without an actual name, and then Ileana Pagan.
Did you skip Tony Staton?
Oh, I did. I'm sorry.
Okay.
Tony Staton, thank you. Vice President Ahia Hinton. Is Tony Staton here? Okay. Shrahan Santana. Okay, next speaker, Janet McHale.
Hi, can you hear me?
Yes, thank you. You can start.
Thank you. Good evening. My name is Janet McHale, and I'm the parent of a rising senior at Academies at Roxborough High School. I'm here to voice my opinion for the current opening plan. But first, I would like to point out that Johns Hopkins has just announced that the U.S. has surpassed 4 million positive COVID-19 cases. Now some facts. Fact. Parents and families will lie about their pre-screening of the student, and the first part of your safety plan just fell apart. Kids are sent to school now with fevers, strep throat, and pink eye. If you don't think that will happen now, you are sadly naive. Fact, there is a way to keep COVID-19 out of schools. Keep them closed and do all virtual learning until everyone can return to school safely. Fact, leveling when we all know that this is going to be a complete disaster is ridiculous. There should be a moratorium on leveling for the 2021 school year. Staff and students are in chaos now. Don't make it worse with leveling. Fact, changing high school schedules to 9:30 to 4:30 is not acceptable. High school students still receive rides to school from working parents or have younger siblings that they will need to pick up after school. Many high school students have after-school jobs. If they are 18 and they are already limited in the number of hours they can work per week and can only work until a certain time on school nights. So now kids that are trying to save for college or even their first car are being punished. Fact, that you think high school students can remain in one classroom the entire day and teachers can just rotate in and out proves how out of touch you are with how a real school runs. School should be 100% school-based virtual learning until it is safe for everyone to return to full-time face-to-face instruction. I recommend delay opening schools to September 14th so that a 100% school-based virtual option can be properly planned and the staff trained. The 5.5 days missed can be easily made up. If the current plan moves ahead, it shows the complete incompetence of this administration and the Board of Education, and every one of you should resign immediately. Thank you.
Our next speaker, I don't have a name, but Reclaiming Our Children. Is anybody here for that? Okay, and then we have Ileana Pagan, and we've decided that we're just going to continue calling our speakers, even continuing into speakers on general topics at this point. So after Ileana Pagan, we will have Nathaniel Bartles, Ethan Tannen, Kelsey Romano, sorry, extra pieces of paper here, Nick Palazzolo, and Dana Carter. Is Ileana Pagan here?
Yes.
Thank you. You can start.
Hello, my name is Ileana Pagan. I have twins going into 4th grade in West Philly. I am a professor at Westchester University of Pennsylvania. My campus is not opening in the fall. We will be online to keep everyone safe. I do not think it is safe to reopen schools and expose students, teachers, and staff to the virus in September. In March, we kept our students safe at home when there were only 76 cases of COVID in Pennsylvania. Now we have more than 100,000 confirmed cases of COVID-19 in Pennsylvania and more than 7,000 deaths from the virus, and we plan to open schools. It does not make sense that we quarantine then, but not now. The American Academy of Pediatrics' July 16th report on children and COVID-19 states that children account for 8% of all COVID cases. There are more than 240,000 child cases in the US, of which 66 have died. Children's hospitalization rates are currently 2%. In Pennsylvania, there have been 5,800 child cases. That is 207 per 100,000 children. The report doesn't say how many children have multi-system inflammatory syndrome due to COVID. I'm concerned about ventilation. Most of coronavirus transmission occurs indoors. The risk of getting coronavirus is 20 times higher indoors than outdoors. That's because the viral loads can build up in concentrated amounts when people exhale in a confined space. The virus remains stable in airborne particles for 2 to 16 hours. The American Society for Heating, Refrigerating, and Air Conditioning Engineers states that there is no filter or building system feature that is proven to remove COVID-19 or any other airborne infectious disease from the air. The EPA has a number of recommendations to reduce airborne virus transmission indoors, including effective ventilation, enhanced air filtration systems, air disinfection, avoiding air recirculation. These measures are expensive and they take time to implement. Many of our schools have significant infrastructure needs and need to update or replace their entire ventilation systems. So to conclude, remote learning is the safest option during a pandemic. Instead of spending $80 million to open schools under these unsafe conditions, we should keep students at home and use that money to help fund safe spaces with child supervision for families of essential workers and other families in need. Thank you.
I believe we're on speaker number 109 now. Is that correct?
That is correct. Yes.
We're going to take all the speakers this evening in a row, and then we'll consider action items at the end. Our next speaker is Nathaniel Bartels, and then we'll have Ethan Tannen and Kelsey Romano, followed by Nick Palazzolo and Dana Carter.
Okay, can you hear me?
Yes, thank you.
Okay. I'm an ESOL teacher at Wilson Middle School. The school district has developed a plan which it knows it will not be followed, basically requiring something that is not possible or where there's no means of enforcing the requirement. This is just empty words. They don't mean anything. Just one example, masks lose their effectiveness when they're wet. Many rooms in my school are up to 95 degrees during September, and there's no provision for situations where students and staff will need a new mask every hour. This plan is not serious, and these are serious times, and we need a serious plan. I would like to make 2 suggestions. One, instruction needs to be online until schools are safe for students and staff to return. I feel the district is trying to do the same thing it tried to do with asbestos. Basically, they'll do what they can, but kids have to come to school, even if whatever they did is not enough to make schools safe. Second, and most importantly, the district needs to prioritize providing internet for all students. Even in the district's plan, half of instruction would be over the internet. However, a large percentage of the student population would not be able to access the internet. Almost half of my ESOL students were not able to get internet this past spring, despite constant calls from myself and the school's BCAs. In Pennsylvania, we're supposed to have free public education. Requiring work that students can only access if their families pay for internet is not free. Not providing instruction to those families without internet is not public education. Public education in these times means that all students must be provided with internet. Thank you.
I'm sorry, I was muted. Our next speaker is Ethan Tannen.
Hi, can you hear me?
Yes.
Hi, good evening. My name's Ethan Tannen. I'm a teacher at Masterman and a Masterman alumnus. First, I'd just like to thank the school board members for volunteering your time to work for education for Philadelphia's children. But I'm here to speak to you tonight primarily with regard to the 9th demand of the 10 demands put forth by the Racial Justice Organizing Committee and the Melanated Educators Collective. And I'm demanding equitable access for students to all learning institutions and tracks. Also for opportunities for Black educators to teach in those schools and tracks. According to the most recent available data on the SDP website, the Masterman student body last year was 15.34% Black, and the Central student body was 19.58% Black, both schools in a district that is 47.49% Black. This is a clear outcome of racist admissions policies in our magnet schools. And these magnet school admissions policies must be reconstructed in a way that makes all magnet school student bodies reflective of our city's demographics. I hope that everyone on the school board agrees that color blindness is an ideology that protects and perpetuates racism. So I ask then, why is it that magnet schools do not receive race data on their applicants to ensure that admissions is equitable along racial lines? The district must resolve to provide schools with race data to ensure that Masterman and Central are, in my opinion, at least 45% Black, and this must also apply to advanced track and AP courses. Lastly, it is imperative that we recruit and retain Black educators so that Black students have the opportunity to see themselves reflected in their teachers. Research shows that the positive outcomes sparked by same-race role models can last into adulthood. We need to institute hiring practices and policies that actively address the whiteness of Philadelphia's teaching force. We cannot sit idly by while racist policy exists in our district. We must swiftly replace these policies with anti-racist policies. Thank you for your time.
Kelsey Romano.
Present. I have taught special education in Philly for 10 years and currently teach at Saul. I have heard teachers and staff exercise their power over students in a number of horrifying ways. Whether it's the time that a white teacher proclaimed to her class that the room stank because of their braids, or a white dean who thought his casual use of the N-word was acceptable, or the substitute that chose to use the word tranny, we know that our students are being hurt by those who are supposed to protect them. We know that our students are being cut down by those whose job it is to uplift. We know this happens, and by not having a system in place to hold teachers and staff accountable, we are telling these students that our power gives us the right to belittle, dehumanize, and humiliate them. By not having a system in place to protect our children and to report these issues, we are ensuring that they are taught at every turn that their voice doesn't matter. As put forward in Demand 1 from the Student Union, we need school-based bias and racial equity boards and a process for protecting students and staff who report violations of racism and discrimination. Period. No child should be made to feel less than because a teacher has told them, but slavery was good for the economy, or told them that they were just wearing a religious or cultural headscarf because they didn't have their hair done. And these are just two examples of aggressions that students have shared with me as a trusted adult. In the structures that exist now, I am powerless to help these students or enact change in our school. This is unacceptable. Social media should be no exception. Teachers who claim Black people need to get over slavery because the Irish were slaves too need to be held accountable. Social media is not private, and if we are holding our students accountable for what they say to one another on Facebook or Twitter, then educators should be held to the same standard. Until there are systems, processes, and consequences in place, teachers will still share racist and discriminatory beliefs. Behavior that belittles and degrades students won't just disappear because we are operating on a hybrid or virtual environment. So if a student is courageous enough to report it, we need to be brave enough to do something about it. As adults who work in schools, whether in person or virtual, we are in loco parentis. We must protect and ensure the emotional, intellectual, and physical safety of every student. So that brings me to some wonderings. Why would we not have a system in place to hold teachers and staff accountable for racism and discrimination? Why would we return to unsafe, inadequately maintained buildings during a pandemic when our students are the most likely to be negatively impacted by COVID? Why would we put the health of our children's families at risk when we know that many of our students live with immunocompromised family members? As a school community, our whole reason for being is the betterment of our students. So why aren't we protecting them from the physical threat of a pandemic and the emotional and mental trauma of racism and discrimination? It's time for us to step up. And we need to hold accountable those who discriminate against our students and keep them safe from this pandemic.
Thank you. Miriam Singer. Miriam Singer connected? I'm sorry, actually, strike that. My pages got out of order.
Dana Carter, I believe.
Apologies. Yeah, sorry that there were extra blank pages. It's actually
It's
Nick Palazzolo.
Yeah.
I apologize. Is Nick Palazzolo here? Dana Carter?
Hello, my name is Dana Carter, and I'm a member of the Racial Justice Organizing Committee and Parents Organized for a Better School District of Philadelphia. Let's first uplift the voices of the Black students at Central, Masterman, and the Black Philly Students Alliance. Their energy was tangible during our Educators March. These young leaders are products of the School District of Philadelphia. Please listen to them. Ladies, gentlemen, members of the board, and Dr. Height. 153 speakers is a clear indication that something is broken. But in my 19 years in education, I have never seen such a unified response from the community. As exhausted as we all are, we should also be very proud that we all are here fighting for the children. I'm sure many teachers will probably be inspired to go into administration after that outstanding speech given by the president of CASA. At this time, I asked the School District of Philadelphia to consider revising School District of Philadelphia's Code of Ethics, Policy 300, to include students' interactions with each other, employees' interactions with each other, and teacher-students interaction. Ethical guidelines, not legal guidelines, ethical guidelines. Please consider instituting a mandatory ethics training for all students and staff members as a part of their onboarding process and have mandatory lessons for students throughout the school year. The Racial Justice Organizing Committee, as well as the Committee to Rename Philadelphia Streets and Schools, is asking the school board to consider amending Section A of School Renaming Policy 712 by allowing Elijah Cummings and John Lewis's names to both be considered for our first names phase of the school renaming process. On behalf of the Racial Justice Committee and all those people who sweated with us and marched with us from City Hall to 440 in 95-degree weather, please accept all 10 of our demands. It is my pleasure to now introduce a recipient of the Limbeck Award for 2020, my fellow member of the Racial Justice Organizing Committee, an outstanding educator from Northeast High School, Keziah Ridgway, who will all give you a real-life example as to why our presence as Black educators is so necessary. Thank you.
Okay, the next group of speakers will be Keziah Ridgway, Danielle Farley, Margaret Mullen, Don Anticoli, and Deanna Ramsey. And actually the two after that will be Angela Ryans and Dolores James, and that will be the end of group 3. So if you could all be on standby, please. Keziah Ridgway.
Stand by, we're experiencing technical difficulties. We'll get Keziah in just a moment.
Thank you.
We also got an email from a speaker asking why he was skipped as well, because he was on the Zoom, he said.
Yes, I'm told he was unmute. He was on mute. Okay. Is this Keziah Ridgway?
Yes.
Okay, you can start. Thank you.
Before I read my shortened statement, I will be reading Kayla Gibson's speech. She is a student and was not able to speak today. Hello, my name is Kayla Gibson, and I'm an alum of the Masterman class of 2020. I'd like to start by saying that there is no reason why Black students at Masterman should have to carry the weight of the school's rigorous workload in one arm and the school's anti-racism work in another. I am deeply disappointed in the Masterman administration's responses to Black students' reports of racist incidents and Band-Aid fixes to these issues that affect us for years after we graduate. Masterman needs to focus on recruitment and retention of Black teachers, holding teachers and students accountable for racist incidents, and overall establishing a safe place for its Black students. For these reasons, I, along with the Philly Black Student Alliance, urge the Masterman administration to adopt the charter drafted by Masterman alumni for change, as no one would know what is best for Black students at Masterman better than the people who have experienced this discrimination firsthand. My remarks. My name is Keziah Ridgway, and I teach in the school district. This year, I was one of the teachers that was honored to be selected as a Limbeck winner. In addition, I was highlighted for my virtual African American history class that I co-taught with Central's Elizabeth Wesley. With the announcement of this plan, I regret to say I will need to go virtual, or I may have to resign my position. Both are losses for Northeast High. I have 4 kids. I cannot leave them alone to do remote learning for 3 or 4 days out of the week. The district will be losing one of its few Black Muslim woman history teachers. My students will be losing a confidant and an abolitionist educator of African American history. The Muslim Students Association and Black Students Association will lose their mentor, which is a position I have never applied for nor received EC funds. My school would lose their only Black Muslim woman IB teacher. My IB anthropology students would not be able to complete year 2 of their class. The only way to prevent this from happening is going fully virtual. Please don't make me choose between the 4 kids that I birthed and the hundreds of kids that I teach and mentor. Keep school communities intact and safe. In addition, I'm here today to formally ask you to publicly express support for the 10 demands our organization, Racial Justice Organizing, have created. Among them is to ensure that Black students and teachers have a say in who gets hired. I'm also asking you to protect our babies from administrators and teachers who punish Black students and teachers for speaking up. We're also asking you to add percentage quotas for Black students in every magnet program and special admit school. Don't give lip service to our babies in the Black Philly Students Alliance. They've experienced unspeakable trauma as a result of racist teachers and administrators. We teachers, we Black teachers, will not allow you to string them along. So stop playing follow the leader, be an innovator, and do the right thing with COVID and systemic racism. Accept the demands, fund students, not cops.
Danielle Farley. Is Danielle Farley here? Okay, Margaret Mullen. Margaret Mullen connecting? Hello? Okay, we'll move to the next speaker, Don Antipoli. Is Don Antipoli on the line?
Lynn, can we ask for a brief pause for technical difficulties? Stand by.
Yes, thank you.
My apologies, Ms. Varel. Can you please restart your list from the point that Keziah was done her testimony?
Yes, sure. Danielle Farley.
Yes, can you hear me?
Yes, thank you. Go ahead.
Good evening. My name is Danielle Farley, and I'm the art teacher at Lankenau High School. I'm asking for the school board support in pushing to start the school year remotely. We have just listened to hours straight of members of this community explaining everything that's wrong and unsafe about the reopening plan. I've been glued to my computer the whole time. I'm in all of this community coming together to stand up and voice their suspicions and doubts. The risk of school having to shut down again due to an outbreak is high. I believe we should be instead putting our energy into making remote learning equitable, engaging, and culturally relevant while making concrete plans to address the racism and biases that exist in every school. The demands for radical education transformation written by the Racial Justice Organizing Committee and Melanated Educators Collective offer 10 ways that we can make schools more equitable and safe for students. Hundreds marched for these demands on July 12th. As board members, you can show you are committed to racial justice in schools by publicly endorsing these demands. You should be pushing for compensation for these organizations that have been doing this work for years and allowing them to take the lead in making our schools places of learning and growth, not further criminalization and traumatization. I will briefly focus on demand one, but I encourage anyone who hasn't read the demands to shift your focus on how you can use your power to implement these demands in this district. Demand number one is we demand school-based bias and racial equity boards and a process for protecting students and staff who report violations of racism and discrimination. When we empower students to share their stories, we hear their painful experiences confronting racism and discrimination in their schools, experiences overlooked by teachers and staff or held deep inside for fear of retaliation. Our students have turned to sharing their experiences anonymously with Instagram accounts like Black at Masterman, because those situations were not handled properly. Schools should be places where students feel empowered to speak up about the discrimination they face. We cannot enter a new school year without taking real steps towards creating these school-based bias and racial equity boards. These boards must be transparent, student-centered, and supported by clear policies that protect students and staff for reporting violations, including updated language in Policy 248 that clearly states consequences for staff that do not report such incidents. We must empower students to share their experiences and then find ways through restorative justice to hold the responsible accountable. These boards should exist outside of administrative control, and the Racial Justice Organizing Committee, Melanated Educators Collective, and the Philadelphia Student Union should be consulted for ideas on how to implement these boards and compensated for their time and work. The School District of Philadelphia has an opportunity to be a leader in transforming schools into places where students feel affirmed in their identity, safe, and supported. Releasing public statements and after students have shared their harmful experiences is not enough. We need you to take action on this and vote no to the reopening plan. Thank you.
Thank you. Margaret Mullen.
Can you hear me?
Yes, thank you. You can start.
Thank you. I've been trying to get on. Thank you so much. Good evening. My name is Margaret Mullen Whiting, and I am the retired and former principal of 3 elementary schools, 1 high school in Philadelphia, a grandmother of 2 students in the district, and the current president of the Philadelphia chapter of Black Women's Educational Alliance. Our organization's mission is this: to provide information on the issues, current pedagogy, policies, and laws that impact an equitable education. We provide programs to our members that impact significantly on the growth and development of our children and young adults. And because in the end, with our continued use of that information and strategies that we share from our BWEA sessions, We help to support the children that we all touch each day at home and at school. Due to our concern for the children, parents, teachers, and administrators of Philadelphia, we surveyed our members to elicit from them their feelings, suggestions, and concerns for the reopening process for the school district Philadelphia. 75% are current district employees. 71% of the members who responded overwhelmingly felt that the school should remain virtual this September through at least November 2020. All others believed in a hybrid model. Suggestions for opening procedures included providing teachers with great supplies of reusable masks and full face guards, uniform social distancing practices, providing schools daily with clean materials, proper daily sanitizing of classrooms and buildings, knowing that it took the better part of a year to sanitize just 5 buildings, restocking PPE materials monthly, holding parents accountable for their students being online daily, making certain that the school district schedule for the school day is uniform, and most importantly, more training for staff in the area of cyber virtual teaching and learning. There were many serious concerns, which included issues of properly taking care of special education children via their IEP stipulations and union contract issues. Would teachers continue to receive their $100 allotments, and would their classroom belongings be protected if they worked virtually? The daily safety of teachers who are coaches going from class to class or school to school was very worrisome. Whether or not healthcare coverage for staff who might be infected would be covered and paid for by the school district was primary, as well as the quarantine protocols for infected adults and children. The most dire comment was this: teachers and other employees of the district are considering quitting or retiring rather than being exposed to the virus and possibly dying. Let me end with this. Lest we all not forget that in Education 101, we learned that the job of education first is the health, safety, and welfare of children and the adults who teach them. If you lose teachers over these issues, then what are you going to do? It's not worth it. If you have all the answers or you don't have the answers now, then vote no tonight. Simply start school in September by teaching our children from home, and BWEA stands with you. Thank you for your time.
Thank you. The next speaker is Dan Anticoli, or Anticoli. I'm sorry, and it's Don. My eyes are fading. Don Anticoli. Okay, moving on. Deanna Ramsey.
Can you hear me?
Yes, go ahead. Thank you.
Good evening. My name is Dina Ramsey, the principal of the Philadelphia Juvenile Justice Services Center School. Tonight, I am also here as the lead steward of Teamster Local 502 and a member of the Political Action Committee. Regarding the topic of racism, as district administrators, our position is clear. The district must address the systemic racism embedded in its policies and practices to ensure that all students and staff have equal access to opportunity, growth, and success. I too agree with Principal Ellerby, if she had the opportunity to speak tonight, an independent Department of Diversity, Equity, and Inclusion is needed to identify and dismantle the numerous examples of systemic racism that are so widely spread in this district. The data clearly reveals that these practices have supported and continue to increase the achievement gap between Black and Brown students and others. Paying lip service to diversity is not only insulting, but is doing real damage to some of our most vulnerable students. Time is one thing in this life that we can never get back, and we are wasting it. We must act now to address the practices we know continue to widen the already unacceptable achievement gap. I want to leave you with 2 quotes. In the words of Ruby Bridges, racism is a grown-up disease. We should stop using our children to spread it. And in the words of Angela Davis, in a racist society, it is not enough to be non-racist. We must be anti-racist. Good evening. Thank you again.
Thank you. Our next speaker is Angela Ryans.
I'm here. Can you hear me?
Yes, you can start. Thank you.
Good evening. My name is Angela Ryans. I am the assistant principal of the Penrose Elementary School. Regarding the topic of racism, I stand with Teamsters Local 502 CASA. As district administrators, our position is clear. The district must address the systemic racism embedded in its policies and practices to ensure that all students and staff have equal access to opportunity, growth, and success. As such, I stand here as an administrator who once upon a time walked in the shoes of the 51% of Black students in our district, which is why I implore you to ensure that the history and contributions of Black people not be snuffed out of the curriculum in the way that George Floyd's life was. I ask that the knowledge that the children in our district will acquire through a robust, culturally responsive curriculum that works in tandem with our Common Core and PA state standards and the high expectations that are expected of them will give our students a more excellent way to thrive in life and not just survive, as been evident in the lives of many of our children during this pandemic. In doing so, we will know that the school district of Philadelphia did all that it could to dismantle the oh so prevalent system of racism. Thank you.
Thank you. Our next speaker is Dolores James, and the group of five after that, Karen White, Michael Andrews, Laura Overton, Emily Simpson, and Raymond Roy Pace. And actually, Michael Andrews apparently is a duplicate of somebody who already spoke. So it after Dolores James, Karen White, Laura Overton, Emily Simpson, and Raymond Roy Pace. Is Dolores James here?
Yes, can you hear me?
Yes, we can. Go ahead. Thank you.
Okay, good evening. My name is Dolores H. James, President of the Dr. Ruth W. Hare Scholarship Fund and a community advocate for school students in District 4 or school district in Philadelphia. The Dr. Ruth W. Hare Scholarship Fund has been committed to ensuring that Black and Brown students who attend public school in the district have the resources and monies that is required for students who seek higher education. The health and welfare for each student is essential to achieving their goals. We have worked closely with parents, Board of Education, principals, staff, and students for over 46 years. My experience in cultivating these relationships enables me to understand how our students of color lag behind their white counterparts. We must do everything we can to ensure that our children succeed. I don't think that the students should really be in the schools because of the COVID-19. That includes learning in class can be avoided. I have a few questions I would like to ask for the district to address. Will principals, teachers, staff, and students require a COVID test prior to attending the school opening? Are test results going to be available to ensure the informed decisions are made? The health and well-being of everybody is paramount. There are far more variables that have to be considered before schools are allowed to open. Will there be a mask mandate for everyone? Will the staff who are high risk medically be given a choice to administer online instructions? This, where am I?
This consideration.
This consideration, this lady
should include persons who are vulnerable because of pre-existing conditions, staff that live in multi-generational homes, or care for at-risk persons, including at-risk children. Will the building that we are asking everyone to return to be able to be effectively cleaned and disinfected How often will it be cleaned? Will there be a circulation of clean air as this virus is airborne? Can everyone effectively employ social distancing practices in common areas such as eating areas?
Thank you. That brings us to the end of group 3. Before going to group 4, I just want to see if any board members want to take a 5-minute break, or if any staff need a break.
Yes, can we take a 5-minute break, please?
Yes, thank you.
Thank you.
President Wilkerson, just so you know, you're unmuted.
Ms. Ruck, are we ready to resume?
Yes, I am, if everyone else is. Okay, thank you.
We have.
I think everybody's here, so thank you. I'll call the next speaker, Karen White. And this is the beginning of group 4.
Hi, good evening. Can you hear me?
Yes, go ahead. Thank you.
Good evening. My name is Karen White. I'm the principal of the Fitzpatrick School. I have 2 statements to share on behalf of myself and Gina Hubbard, principal of the Greenberg School, who was unable to speak earlier. Regarding the topic of school opening, we stand with Teamsters Local 502 CASA. As district administrators, our position is simple. Not one school should open for in-person learning until the district has developed a plan that addresses the many remaining unanswered questions concerning safety. In the words of Susie Orman, a wise man knows how to summon the courage to do what's right, rather than what is easy. Regarding the topic of racism, we stand with Teamsters Local 502 CASA. As district administrators, again, our position is clear. The district must address the systemic racism embedded in its policies and practices to ensure that all students and staff have equal access to opportunity, growth, and success. In the words of President Barack Obama, Black Lives Matter simply refers to the notion that there's a specific vulnerability for African Americans that needs to be addressed. It is not meant to suggest that other lives don't matter. It is to suggest that other folks aren't experiencing this particular vulnerability. Thank you for your time.
Thank you. Our next speaker is Laura Overton.
Hi, good evening. Can you hear me?
Yes, thank you.
Great. Good evening, Dr. Height and the board. My name is Lauren Overton, and I'm here to represent Teamsters Local 502 CASA. I'm the outgoing principal of the William M. Meredith School and the incoming principal of the Sadie Tanner Mosel Alexander School, often referred to as Penn Alexander. First and foremost, I stand with the demands set forth by the Racial Justice Organizing Committee, and am proud of the organizing across sectors seen here tonight. I am here tonight because I am troubled by the plan set forth to reopen schools. If we are being honest with people, we do not currently have the human capital, systems, or funding to pull this off in the next 6 weeks. The average size of a classroom in the school district of Philadelphia is roughly 900 square feet, accounting for furniture, walkways, different configurations of rooms, and children with a circle around them with a 6-foot radius. You can only fit somewhere between 8 to 12 children in a classroom. As you're aware, overcrowding plagues many of our schools. Let's say we have 33 children enrolled in a class, not overcrowding, mind you. That means that we would have 16 to 17 students in a class on any given day based on this current plan. The CDC guidelines cannot be adhered to given these conditions, and these numbers are related only to classrooms, not hallways, bathrooms, or other spaces requiring access and use while maintaining appropriate distancing. Over the last 4 years of my service as a school principal in the school district of Philadelphia, I have had a fully staffed cleaning team for exactly 6 weeks. This was the 6 weeks that was fueled by a very public concern that Meredith faced regarding asbestos. Once another crisis arose, those cleaners were directed to another building. There are many days that classrooms across the district remain dirty for weeks at a time due to staffing issues. In no way do I blame this on the brothers and sisters who are building engineers and general cleaners. This plan rests on the back of our least paid workers who are dealing with the daily issues of living in poverty, such as the ability to find reliable childcare and resources. Many schools have windows that do not open, and many only open a few inches. And the large majority of school spaces do not have any mechanical ventilation capable of providing the recommended amounts of fresh air whatsoever. The lack of proper ventilation in school buildings, coupled with the understaffed cleaning teams, will inevitably create conditions that are ideal for the spread of COVID-19. I invite the board members to walk a building with me so I can show you why even at the most privileged schools in Philadelphia, they are not going to be ready in time. Let alone my colleagues who run schools that mostly serve brown and black students that live in deep poverty. I already lived through the horrific experience of telling children that one of their favorite teachers wasn't coming back because they were sick and not going to get better. Please do not make me or any of our colleagues repeat this cycle. It was heartbreaking enough the first time around. I implore the board to move to a virtual opening where instruction is driven by the homeschool teachers and leads to a gradual phase-in model. Thank you.
Our next speaker is Emily Simpson.
Hi, can you hear me?
Yep, go ahead, thank you.
Awesome. As an educator who loves my job and my students and who has the honor of working at one of the few agricultural schools in the country, it genuinely pains me to say this. We should not be returning to school for the fall semester. I don't know what that looks like for W.B. Saul High School in Roxborough, a campus that centers hands-on learning with livestock, greenhouses, kitchen spaces, and acres of land usually cared for by students. But I do know that none of us can do any of those things if we become sick and potentially suffer long-term effects from COVID-19. I've taught high school history in Philadelphia for the past 3 years. During that time, I've watched again and again as our students have told us what they need only to be ignored. Even worse, to be told that we, the adults in the room, somehow knew better. That happened with the fight over metal detectors last year. We watched it happen with the presence of police in schools this past month. And now we are all gathered to address the reopening plan released by the school district, a plan which makes it clear that once again, the experiences of students, school-based staff, and caregivers are of little import in guiding official policy. I chose to speak today in the hope that district leadership and the school board, the so-called adults in the room, will recognize that our experiences are indeed the kind of expertise that should shape not only the reopening conversation, but also the continued daily operation of our school buildings. We have told you about the asbestos tiles, the sweltering heat in our unair conditioned classrooms, the poor ventilation, the sinks that don't work. We have begged for smaller class sizes, more supplies, better resources. What we have now is the reckoning. We cannot magically leapfrog over the very real, deep systemic issues that our school district has developed over the course of decades of inequitable funding. What we also cannot ignore is the fact that this reopening plan does the exact opposite of what our students have been asking us to do. It increases carceral practices in schools. How am I supposed to work towards anti-racist education if I'm constantly being asked to police the bodies of my Black and brown students? What kind of relationships am I building if the most frequent words out of my mouth are make sure you have your mask on and you have to stay 6 feet apart? What good is a space filled with the anxiety that any misstep could result in the illness and potential death of another human being? I refuse to be another cop in a school building when what our students need most are trauma-informed restorative justice policies supported by staff qualified to carry them out. 2020 has not been kind to any of us. Between COVID-19 and the racial uprisings, Black communities and other communities of color have borne the brunt of very severe trauma. As the Racial Justice Organizing Committee and Melanated Educators Collective have made clear, our students need support. They need more counselors. They need social workers. They need to receive those services in an environment that is safe. And right now that environment cannot be our physical school buildings. It is past 11 p.m. on a Thursday during the most stressful summer break I've ever had. I am begging you, please commit to a virtual reopening so we can use the time we have left to create the curriculum and services that our students deserve. Ask educators and school-based staff what they need in order to be creative about finding solutions for the students who do need in-person support. Don't ask us to risk our health or the health of our loved ones in the process. Thank you.
Raymond Roy Pace. And then the group after that is Catherine McKellen Carter, Simon Hauger, Elizabeth Wesley, Herbert Muhammad, and Geraldo Rivero.
Hello, can you hear me?
Yep, go ahead, thank you.
Good evening. My name is Raymond Roy Pace. I am the assistant principal of Lamberton Elementary and member of Local 502 CASA Union. Regarding the topic of racism, I stand with Teamsters Local 502 CASA. As a district administrator, our position is clear. The district must address the systemic racism embedded in its policies and practices to ensure that all students and staff have equal access to opportunity, growth, and success. In the words of Njuma Olu, the beauty of anti-racism is that you don't have to pretend to be free to be an anti-racist. Anti-racism is commitment to fight racism wherever you find it, including in yourself, and it's the only way forward. Thank you for your time.
Thank you. Catherine McKellen Carter.
Hello, can you hear me?
Yes, you can start. Thank you.
Thank you. Good evening. My name is Catherine McKellar Carter, Block Elementary School Principal. Regarding the topic of racism, I stand with Teamsters Local 502 CASA. As district administrators, our position is clear. The district must address the systemic racism embedded in its policies and practices to ensure that all students, staff have equal access to our opportunity, growth, and success. The country was horrified by the totally senseless death of George Floyd at the hands of police in Minnesota. The assassination of Mr. Floyd is the prescription that has been written by the doctors of racism and prejudice for generations. The School District of Philadelphia must take the necessary steps to make sure we secure change and equity in our community and dispel racism wherever and whenever we see it. With the barrage of news media coverage, we must not lose sight of the real issue, justice and change. We cannot possibly work to fix this problem without everyone at the table. This problem will not change overnight or over the next month. But if we start a real courageous conversation to face the realities of racial tension, we can make a step in the right direction. As Will Smith said, racism is not new, it's just being filmed. When we know better, we have to do better. We are about change. We can't be silent. We won't be silent. We must rise to meet this moment. It's not enough just to not be racist. We have to be anti-racist in order to dismantle these institutionalized racist concepts. Now is the time to make a commitment and pledge to break down the system of racism and oppression by establishing an office of diversity, equity, and inclusion. CASA will always work to unify our communities and work on enduring change. Recently, former President Obama spoke about change and hope. He said we must look to each other, listen to our young people, and work with our older citizens for change to happen. It will take all of us working with each other to combat injustice everywhere. We must be ever resolute in making the changes now. We must use this spark to work with each other on changing the broken system, not just fixing it. In the words of Tim Wise, progress is always relative to the oppressed. It can only be viewed as an all or nothing deal. If oppression continues even in a modified form, then the system must still be attacked until that injustice is eradicated. Thank you.
Simon Hauger. Simon Hauger here. Okay, Elizabeth Wesley.
Hi, can you hear me?
Yes, go ahead, thank you.
Yes, hi, good evening. I'm a 15-year veteran teacher in the School District of Philadelphia, here to demand that the district abolish policies that beget and perpetuate any inequities in our school system, specifically the use of standardized test scores for admittance into special admit as well as magnet schools and programs. Members of the school board, we know diversity is intentional, and you have the power to implement educational justice, what the late great Congressman John Lewis would call good trouble. It's well documented that standardized tests are biased and that many Black and Brown students perform poorly on these tests due to economic and societal factors outside of their control. Therefore, a school selection process relying decisively on standardized test scores is discriminatory. The disparate outcome from this practice clearly indicates a downward trend of Black and Latinx students attending our most coveted schools and programs throughout the district. We're using standardized tests as gatekeepers. We're exacerbating the haves and the have-nots through the fallacious myth of meritocracy. We've created a private educational system within a public education system by using these test scores to deny the largest sector of our student population access. At Central High, for example, there's been a significant drop in our Black student population. 24% of the rising seniors are Black, yet less than 15% of the rising juniors are. Black students now make up less than 20% of the entire student body. Our Latinx population is at 7%, while our overall district is at 52% Black and 21% Latinx. This is due to our racist practices and racist admittance policies. These inequities are jarring. The impact on Black and Brown students is traumatic, while reinforcing implicit racial and socioeconomic bias in students attending these exclusive schools. I stand with Black students at Central High demanding educational justice. I demand an end to the policy and practice of using weighted and controversial measures to exclude Black and Brown students. And I demand equity through access and opportunities by adopting admissions practices that are favorable for most students, not the least of them. COVID-19 precluded standardized testing last year and will likely impact testing this year. The district now has a window of opportunity to develop permanent anti-racist and equitable admissions policies that can be documented as serving and promoting diversity and equity in our school system. We can do this by putting racial data back into the admissions and school selection process, relying on recommendations, interviews, letters of interest, and ramping up our recruitment efforts in underrepresented school populations and zip codes. This is educational justice. You have the power to do this. Diversity is intentional. As a society, we cannot end systemic racism and reach equity without first accomplishing diversity and inclusion. And it starts with education. School board members have a role to play. This is good trouble.
Our next speaker is Herbert Mohammed, and then after that we have Gerardo Rivera, and then we're going to actually be able to add Nick Palazzolo, Tony Stanton, and Eric Moran in. It was, I think, a technical difficulty on our end that they were not able to connect. So Herbert Mohammed. Is Herbert Mohammed here? Okay, Gerardo Rivera. Is Gerardo Rivera connecting? Okay, Nick Palazzola.
Yes. Can you hear me?
Yes, we can. Go ahead. Thank you.
Okay, great. Thank you. Good evening. As a teacher at Central, I stand with our Black students in demanding racial equity at Central and with the Melanated Educators Collective and Racial Justice Organizing 10 demands for our district. I am calling on you to promote racial equity in admissions policies for all special admit schools and advanced course programs. In the few years that I have been at Central, I have seen a dramatic drop in our Black student population. 24% of the rising seniors are Black, yet less than 15% of the rising juniors are. Black students now make up less than 20% of the student body. Our Latinx population is at 7%. All this in a district that is 52% Black and 21% Latinx. Central's admissions policies are not equitable. Will you eliminate the use of standardized test scores for admissions? They measure family wealth more than academic ability. The district must now develop policies without these tests due to COVID. Such changes must be made towards equity and must be made permanent. Will you reinstitute the use of data on race in the school selection process? The district's decision to eliminate the use of race in admissions contributed to the most recent decline in Black students in special admit schools. Will you increase recruitment efforts for predominantly Black and brown schools that are underrepresented? Past efforts to promote equitable access for Black and brown students were abandoned in the face of opposition for some who see selective special admit schools as a resource for the middle class and mostly white families. You will face similar opposition. So will you protect whiteness or promote racial equity? Furthermore, I call on you to promote racial equity in access to advanced courses. In my analysis of Central's AP courses for the 2018-19 school year, I found that although Black students made up 21% of Central student body that year, they represented just 10% of all AP students. Will you enforce the College Board's guidance to abolish gatekeeping in order to increase access and racial equity in AP by eliminating Central's use of testing as a barrier to entry? It is clear that racial equity in admissions and advanced courses is a start, but diversity without anti-racism is not enough. We must also eliminate the racist view that increasing equity and access somehow means lowering standards. So I call on you to support policies that will end the racist culture in our schools. Black students continue to do the emotional labor of sharing on social media and at rallies the racism they face from their peers and teachers. The racial trauma Black students face includes the use of racial slurs, disproportionate discipline, refusal to affirm Black diaspora culture on international days, messaging that Black students are less capable or somehow do not belong at selective magnets, and a lack of representative curriculum that celebrates Black excellence, joy, and resistance. I know you are planning to mandate anti-racism training as a first step. Will it be robust, ongoing, and teacher-led? Will you involve the teachers who have already been leading these efforts in Philly and compensate them? Finally, how can you follow through on equity and anti-racist policy with an unpaid volunteer equity coalition? Will you create a Department of Equity and Inclusion and pay people for this work? Thank you, and I apologize for the earlier technical difficulties.
Thank you. Tony Stanton or Staton? Is this Tony Staton?
Yes. Can you hear me?
Yes, thank you. Go ahead.
Thank you. Hello, my name is Tony Staton. I'm the Executive Director of the Laborers District Council Lesser Fund and the radio host of the Laborers Live radio show on Word 900 AM that airs every Friday at 4 p.m. I'm also a parent of 2 students who attended the Philadelphia School District. I must say for the past 2 weeks, I have used our radio show platform to share information regarding the reopening of our school district. I've shared with the communities to attend the school district's Facebook Live on Wednesday at 3 p.m. with Dr. Height to voice their concerns and reopening. I've encouraged parents to get involved, not at the last and wait to the last hour, 11th hour rather, and although I've got a lot of flack for appearing to agree with the reopening concept, which at the end of the day, I do not feel strongly about. but I felt we had a responsibility to use our platform and that it was important to be objective and inform the public of your reopening efforts. As I listen today, there is no way you can convince me that over 35,000 district reopen surveys and 6,000 federations of teacher surveys and the large number of survey responses received via online feedback and virtual town hall meetings were in favor of face-to-face learning at this time. You know, you have union representatives speak today, principals, teachers, and parents who are not in favor of your face-to-face hybrid model plan. I know this is very difficult for you all, and this decision is not easy, but I beg you to please delay the reopening plan and put all this effort into online remote learning. Use this time to get the asbestos out of the schools. Bring the school's ventilation up to date, but do not put our teachers, staff, and students at risk. I echo another speaker when they said, "What is the rush? People are scared." A listener called in the radio show last week and said, "If you send your kids to school, you don't love your kids." I thought that was pretty harsh. But after listening to the meeting today, I need to ask you all, do you love our kids? Do you love your teachers? Do you love your principals? If you do, be honest with yourself and your decision. Save our already forgotten communities. They need you to look out for them. Thank you very much.
Eric Moran. And as Eric Moran is joining, if Don Anticoli is still on the line, we can add them next. Is Eric Moran here?
Yes, can you hear me?
Yes, we can. Thank you. Go ahead.
Okay, perfect. Good evening, thank you. My name is Eric Moran, and I'm a math teacher at Blocks High School and a member of PFT, the Caucus of Working Educators, and the Racial Justice Organizing Committee. Much like my district colleague, Charlie McGeehan, I plan to share my time tonight between the topics of institutionalized systems of oppression in our schools and the district's current plans on reopening. In regards to both of these topics, I must begin by saying this. You cannot water down poison and call it non-toxic. You cannot, as Zoe from Parents United said earlier, put a Band-Aid on a pandemic. However, the district leadership insists on using their time tonight to do exactly this. And they expect people who actually have skin in the game to passively accept this. And they are asking this board to sign off on a plan that creates more questions than answers. In regards to the district's response to calls from students and various community stakeholders to establish police-free schools and reinvest in mental and behavioral supports and services that our students so desperately need, any reimagination of school climate and culture needs to be just that, not reform, but reinvention. The district spurned very real concerns raised by a significant portion of our student population and essentially signified to them that their fears are worthless. To break the school to prison pipeline, we need to first stop treating our schools as prisons. We need to end academic incarceration in all its forms and bring back the NTA position to reunite our communities with our schools. Any effort to address institutionalized racism and oppression in our schools that does not directly involve our student activists as full members in the process is unacceptable and illegitimate. I want to thank those members of the board who've already offered their public support for these student-led efforts. We will not forget who stands with us. In regards to the reopening plan, I as a teacher am expected to plan anything that I undertake in my classroom and then plan for when those initial plans go awry. The district has repeatedly insulted the collective intelligence of our communities by not adequately addressing and investing in plans for it if and when things do go wrong. We are much better off committing our limited resources to bolstering our remote learning program and addressing the gross inequities in access. This plan will only serve to exacerbate. Students should never be forced to choose between the health of themselves and their families and their human right to equality and relevant education. Thank you.
Excuse me, Ms. Rauch. The speaker before Mr. Moran, could you give me her name?
Yes, that was Tony Staton.
Thank you.
The next, I'm going to call the next group of speakers, Mary Beth Morgan, Miriam Singer, Mandy Diesel, Crystal Porter, and Desiree English. If Mary Beth Morgan could join, please.
Good evening. Can you hear me?
Yes, you can begin. Thank you.
Thank you very much. I'm going to take a little bit of a different approach with my topic, and I want to focus on the students and their needs and wants. My name again is Mary Beth Morgan. I am an independent living specialist with a focus of youth and young adult transition at Liberty Resources, the Center for Independent Living for People with Disabilities in Philadelphia. The philosophy of independent living is that people with disabilities of all ages should have the same civil rights and equal opportunities to control their own life, just like non-disabled students do. Independent living is about choice and guiding students to discover the best options to meet their needs and wants. Mentoring Transitioning Voices offers transition skills that are based on how to develop and maintain relationships, build self-esteem, set personal goals, communicate with others, live an active and healthy lifestyle, as well as concentrates on working with parents and the professional team to best do for the students, finding out about jobs and anti-bullying, just to name a few. MTV sessions have been offered prior to the pandemic and have proven to give students the confidence to interact positively with each other and seek the right help when needed. This is exceptionally needed right now. All of this is completed in the framework of Liberty Resources, again, the Center for Independent Living in Philadelphia. The core services of information and referral, peer support, skills training, advocacy, and transition are intertwined with the teaching, so students, teachers, parents have a better understanding of what is offered to students as they are going from grade to grade and or leaving high school. I am proposing that Mentoring Transitioning Voices be offered virtually as applicable to Philadelphia school system students as an outlet for young adults with disabilities as they experience transition with the layer of uncertainty that COVID-19 brings to the world. MTV definitely falls in line with social emotional wellness plans that the district has to face and recognize for the students. Thank you. I appreciate the time to speak, and be well, everyone.
Miriam Singer.
Hello? Hello?
Yes, go ahead. Thank you.
Hi. I'm a parent of a first grader at Hackett. I'm an artist and an art teacher with Fleischer Art Memorial, a muralist with Philadelphia Mural Arts Program, and a member of the artist collective Space 1026. I am asking you to vote no on this reopening plan and shift our focus on planning a strong remote education program with curriculum driven by the homeschool teacher. Kids need stability. All kids need stability, a daily routine that's pretty much stays the same. So I feel like the school district needs to delay reopening until we figure this out together. Delay reopening of all virtual and hybrid. It puts pressure on the whole community. Why are we sticking to September to January anyways? This is a pandemic and a disaster. If everyone went virtual, teachers would be paid to help students remotely via Zoom or Google Meet. My son did well on days when he met with his teacher to practice reading via Google Meet. Thank you, Ms. Brandt. Maybe, just maybe, some of those teachers would be open to working with parents on some in-person outdoor park classroom meetups. These would be small classroom groups wearing masks. What if there was a survey out to see what parents are available to monitor and lead these outdoor classroom meetups? We can set up tents, make sure social distancing is maintained, and we could do art projects, reading, based on whatever grade level this would change. Yes, we would need the help of parents and monitors. This would help connect children to their classrooms off the computer. I am also interested in possibly doing, if you could do another survey to see what parents are available to kind of assist. in possibly monitoring smaller groups of kids doing online learning in rooms with windows. I'm just wondering if we could use some money and invest it back into back into communities, possibly hire some neighbors who are currently unemployed to be monitors. Background checks would absolutely be required. Can we look as a group, as a community, for safe rooms with windows? Can we look into our communities and find some rec centers, libraries, art collectives, office buildings, empty storefronts? I know there's probably insurance issues with this, but I think we all need to think outside the box. Thank you so much.
Thank you. The next speaker is Mandy Diesel.
Hi there. Good evening. My name is Mandy Diesel, and I thank you so much for all you guys are doing to make education for our kids safe and possible this upcoming year. I'm a mother of 2 kids in the district, a 2nd grader at Penn Alexander and a kindergartner at Henry Lee Elementary School. And I've been going through the past asbestos reports for Lee, and it is unclear to me if asbestos remediation is complete. I actually don't think it is complete, and I'm raising this tonight to keep a focus on Lee and also get the current status of the asbestos remediation. This board is doing really hard work, and as a parent, I appreciate that. Please keep fighting for dollars to remove and treat asbestos within Lee and every other school in the district that is needing asbestos removal. And thank you again for navigating on how to best provide access and quality educational experiences for all our kids this upcoming year.
Thank you. Our next speaker is Crystal Porter. Is Crystal Porter connecting? Okay, our next speaker after that is Desiree English. And after Desiree English, we will have Nakia Ross, Nicole Phoenix, Brianna Shepard, Tahira Bearfield, and Ella Schwab. Is Desiree English here? All right, moving on, Nakia Ross.
Yes, hello, my name is Nakia Ross, and the questions I have is, as a paraprofessional, when having special ed students in a room and they looking at the hybrid for 4 days a week, now if the students come to school sick, how are our staff and paraprofessionals be safe for us COVID? And also, how will we know if that's a common cold that they have, since we're not doing temperature check when entering the building? Also, I have a child that's entering 10th grade at Saul, who also is asthmatic, who was the second school to shut down due to COVID. How could you guarantee my child's safety of not getting this virus since it's airborne? And also, with that being said, I'd rather do virtual online learning, which my child did exceptionally well with straight A's. Speaking of a parent and a district employee, I'd rather do virtual online. Thank you.
Thank you. Our next speaker is Nicole Phoenix. Is Nicole Phoenix connecting? All right, moving on, we have Brianna Shepard. Is Brianna Shepard here? Okay, Tahira Bearfield. Just checking with our hosts, are we okay here to continue?
We are.
Okay, thank you. Ella Schwab, and while we're waiting for Ella Schwab, the next group is Bernadette Smith. And I apologize if I mispronounce. Ivy Quevedo.
Ella Schwab here, sorry.
Okay, hold on. And then Olivia Nelson, Barbara Dowdall, and Anthony Jones. And Ella Schwab, go ahead. Thank you.
Okay, thank you. My name is Ella Schwab, and I am a teacher and co-building rep at McClure Elementary. As I did in January, after our school was closed, then opened, then closed again due to airborne asbestos exposure and the district's failure to listen to us when we pleaded with them not to gamble with our lives, I will talk tonight about trust. I want to thank the countless speakers tonight who highlighted so many points regarding specific glaring inconsistencies in the plan. There are endless issues, and we are poring over this document trying to make it make sense, when the fundamental sleight of hand was that the decision to go back to buildings, period, was made without us. No survey or online feedback platform can replace true community engagement and trust between district leadership and the rest of us, built over the long term. As I've said before, it cannot be built overnight. Building trust across a power differential is tricky, and it hinges on a humility and a willingness to share power. It cannot be built by constantly deflecting and pointing to a deeply flawed document instead of listening and engaging in conversation. The scandal is that a few individuals have this much power to simply say no to people fighting for our lives, fighting for the lives of the most vulnerable in our city, and to hand down false choices to distract us from the underlying conditions we're cornered in. I know in the broader political and economic climate of our state and country, district leadership's choices are not clear or easy or fair either. But the difference is that our district leaders and the members of the board have power. They can choose to play along with a world that says some lives, especially poor Black and brown lives, are expendable, sacrificial. Or they can choose to push back on these false choices and say, not here. Here in Philadelphia, we will advocate for everyone in our community getting their needs met. Food, healthcare, housing, justice, and a life-affirming education for all in a setting that won't leave trails of dead. I know as a school district, we can't do it all by ourselves, but now is not the time to just play along. It's okay to change your mind. In fact, it's pretty much the whole point of education. The ability to change is fundamental to building trust. Especially in times like this where there is no good script to follow, it is imperative that our leaders be open to changing their minds. Nobody is perfect, and pretending like you have it all figured out is just digging deeper and deeper into your hole. We're up here in the sunshine, wanting to reflect with you, to solve problems with you, wanting to trust you whenever you're ready. Keep us virtual fully in the fall. Use that time to make virtual learning an equitable educational experience for everybody as best we can. Use that time to fix asbestos and lead issues in our school buildings so that when it's safe to go back, it will be truly safe to go back. And we'll be good, or we'll be on the way. Thank you very much for your time, and have a good night.
Thank you. I understand Don Anticoli is on. If Don could connect, that would be great. I also understand that the next three speakers I had called are not on the line. So after Don Anticoli, we'll have Barbara Dowdall. Anthony Jones apparently also is not speaking tonight. And then we'll move to Maritzka Garidi, Ora Townsend, Leslie Medley, and Katie Fernandez.
Okay, thank you. I'm on the telephone. Am I coming through?
You are loud and clear. Thank you.
Okay, thank you everyone for helping with the technical difficulties. Good evening. My name is Dr. Don Anticoli. I am the principal of Feltonville Intermediate School, also a treasurer of PDK International Chapter 19, and the secretary-treasurer of Teamsters Local 502 CASA. Regarding the topic of racism, I stand with Teamsters Local 502 CASA as the district administrators, our position is clear. The district must address the systemic racism embedded in its policies and practices to ensure that all students and staff have equal access to opportunity, growth, and success. In the words of Dr. Martin Luther King, I refuse to accept the view that mankind is so tragically bound to the starless midnight of racism and war that the bright daybreak of peace and brotherhood can never become a reality. I believe that unarmed truth and unconditional love will have the final word. I'd like to conclude with 19 out of 20 speakers tonight pleading for virtual education. Please show your love. Let us all begin the 2021 school year safe at home. Thank you to the Board of Education, Dr. Height, and everyone who has assisted.
Thank you. Barbara Dowdall. Is Barbara here?
Yeah, I'm here.
Okay, go ahead.
Speaking as co-chair of the Ending Racism Committee at the Unitarian Society of Germantown. Young John Lewis spoke at the March on Washington for Jobs and Freedom on August 28, 1963, just 7 years after he, his brothers, and a cousin had been turned away from the public library in his small Alabama town, being told it was for whites only, not for colored. In 1998, now a 5-term member of the United States House of Representatives, Mr. Lewis was warmly invited back to that library of his youth after a 42-year wrinkle in time for a reception and a ceremonial presentation of a no-limit library card of his very own. Representative Lewis shared the lasting impact of that initial cruel and unjust barrier to youthful curiosity and love of learning, citing the pain time and again throughout his career, as recently as 4 years ago on the occasion of his receiving the National Book Award for the 3rd volume of his March on Washington trilogy. With the relentless shutting down of our school libraries and dismissing of our certified teacher librarians over the last several decades, Philadelphia public school children might just as well be living in Alabama of the 1950s. Representative Lewis, when approached at an occasion in Portland, Oregon in 2015, where he was honored by my denomination and informed about the absence of libraries in Philadelphia schools, he responded in puzzlement, "Philadelphia, Mississippi?" The loss of this resource means that before the virus hit, most of our students had little opportunity to develop internet research, discernment, and utilization skills, and zero opportunity to bring home for leisurely perusal and study a variety of books that would have stood them in good stead, at least at the beginning of their remote web-based studies. COVID-19 cannot be the excuse for excluding restoration of our fully resourced and professionally staffed school libraries from the vision and drawing boards of this governing body and city administration. Resources and reassurance for safety of library materials eventually provided to students for such a courageous action of hope can be readily found. And my seconds, I can say that I attended that march in Washington in 1963, very far distance from Lewis speaking. Got to talk to him in person in the year 2015, both by virtue of my church. I thank you.
Maritza Garidi.
Good evening. My name is Maritza Gertie. I'm the mother of 6 children, 4 of which are still in school between high school, elementary, and preschool. I am also the Pennsylvania delegate of the National Parents Union. It saddened me to hear the emphasis on the words, not if, but when a child or adult gets sick with the virus. Why can't the city as well as the state follow suit as other states and districts have in deciding to keep all families safe? The hybrid method will not truly allow children and teens to social distance. Upon returning home, they will unintentionally bring home a deadly virus to their families. Please do not risk the families of anyone. Change the plan to 100% virtual learning. Allow each school to create an online curriculum so that each child and adult that are normally in the school building see each other virtually. For those that still don't have Wi-Fi access and possibly not even a Chromebook to date, make sure that each child has access to one. Keep us safe. Bring us back to school in person in January. Mi nombre es Maritza Guridi. Soy madre de 6 hijos. 4 de los cuales todavía están en la escuela, entre secundaria, primaria y preescolar. También soy delegado de Pensilvania para el Sindicato Nacional de Padres. Me entristece escuchar el énfasis en las palabras, no sí, sino cuando un niño o un adulto se ha enfermado con el virus. ¿Por qué la ciudad y el estado no pueden hacer lo mismo que otros estados y distritos han decidido mantener a todas las familias seguras? El método híbrido no permitiría realmente a los niños ni a los adolescentes a distancia social. Al regresar a casa, traerán involuntariamente un virus mortal a sus familias. Por favor, no arriesguen la vida de nadie. Cambie el plan, hágalo 100% aprendizaje virtual. Permite que cada escuela cree un plan de estudios en línea para que cada niño y adulto que normalmente está en el edificio escolar se vean virtualmente. Para aquellos no tienen acceso a Wi-Fi y posiblemente ni siquiera un libro de Chrome hasta la fecha. Asegúrese de que cada niño tenga acceso a uno. Manténnos a salvo. Traernos de vuelta en persona en enero. I apologize to the ASL translator, but I had to also give my message in Spanish because I still have not been privy to when these meetings give appropriate bilingual translations to our families that do not speak the English language. Please make the decision. Just like you're making the decision to stay home right now for this meeting, just like many of you possibly have children or grandchildren that do not attend the Philadelphia public school, that won't have to deal with this heart-wrenching decision. Please put a hold on making these children come to school in September. Wait until January. Give us a chance to have this virus more under control. Do not risk the lives of anyone. One life is not worth it. Thank you.
Our next speaker is Aura Townsend.
Can you hear me?
Yes, we can. Go ahead. Thank you.
Yep. Good evening, Dr. Height, all board members and listeners. My name is Aura Townsend, and I'm a 13-year English educator at George Washington Carver High School of Engineering and Science. COVID-19 lays bare societal ills that plague us: inadequate housing, health care, school facilities, racism. Yet, here we are. If I'm called to return to work, I'll be there. I won't occupy a place in the digital academy over my colleagues who are immunocompromised, caring for young children, parents, and loved ones. I am not above the store clerks who sell me food weekly, sanitation workers who collect my trash, nor those who service me at appointments. On Sunday, July 12th, I attended the Educators and Students for Black Lives March from City Hall to 440. I took SEPTA since we expect our students to take it. I was extremely uncomfortable, longing for it to end. Right now, our focus should be on making sure students have quality internet access at their residences, implementing best practices since online learning is not the same as face-to-face, providing teachers with resources to digitize materials. What are we doing about textbooks, novels? Can classes be taught in units versus year-long classes? Students at Carver have 7 classes per day. Surely they shouldn't have 7 daily online classes. Are we reimagining education, instituting culturally relevant instruction? How will we rid public schools of racism and discriminatory practices? The students have spoken. I do not favor online education. I enjoy lively class discussion, trips to see plays, and cultural sites. Yet, in the words of Anita Baker, I'm called to give the students the best that I've got under these conditions. 6 days of PD is insufficient to prepare us. We need to start now. Fighting this pandemic must be a citywide effort. The school district must partner to provide support to working parents and to students who need safe spaces and homework help. Teachers are here to rise to the occasion. While students are learning remotely, asbestos should be remedied, air conditioners installed, and much needed improvements made. Currently, I'm in a book club organized by working educators and teacher action group. I'll end with a quote from Assata Shakur. I'm not so concerned about myself. Everybody has to die sometime, and all I want is to go with dignity. I am more concerned about the growing poverty, the growing despair that is rife in America. I am more concerned about the rise of the prison industrial complex that is turning our people into slaves again. I am more concerned about the repression, police brutality, violence, the rising wave of racism that makes up the political landscape of this country. Our young people deserve a future, and I consider it the mandate of my ancestors to be a part of the struggle to ensure that they have one. Thanks for listening and have a good night.
Thank you. Our next speaker is Leslie Medley.
Hi, my name is Leslie Medley. I'm a mother of 3 children in Philadelphia Public Schools, Central High School, and Masterman. One of my many concerns with the reopening plan is with whether the school district is ready to meet the very basic hygiene needs to provide a healthy and safe environment in the face of COVID. I worry that the school district cannot support hygiene requirements across all the schools in an equitable manner, recognizing that schools are at different levels of preparedness and do not all have equal access to essential resources. I was surprised to hear this evening Dr. Farley say that schools will not be monitored with on-site visits. So I would like to hear from him and from the school district how exactly the health department and the school district would propose to oversee compliance with the reopening recommendations. Is this a plan or is it a wish list? Given the existing and longstanding challenges to ensuring fully functional and safe buildings, is the school district ready to reopen and provide for the very basic needs to keep our children, teachers, and staff safe? The challenges faced by many schools before COVID included restrooms which were not fully operational, some without running water or without hot water, restrooms not fully stocked with essential items such as hand soap and toilet paper, items which I've heard from my own children are often not available even in the best of times. There are classrooms across the school district without proper ventilation, classrooms without windows or with windows that do not open. Can we really expect that the school district will be able to bring all schools up to speed within the next 3 weeks by the August 15 deadline noted by Dr. Height? I feel very strongly that reopening schools now would pose a danger to the school community and their family members. Have all schools been thoroughly inspected? Do they meet all the same standards for reopening? Is there an inspection protocol that can be made available to stakeholders to assure us that each and every school has been, can be, will be cleaned, maintained, repaired, supplied, and staffed to meet not only the basic but the increased needs necessitated by COVID? If not, how can parents make informed decisions about sending our children back to school? We do not want to follow in the footsteps of Florida, Texas, and Arizona by reopening before we are ready. I implore the school district and the school board to begin from a starting point of keeping children, Philadelphia school children and their families and the adults who work with them safe. If you begin with that mission of keeping people safe as your priority, then it is clear that reopening now does not serve that mission. Your decision tonight will have an impact on the health of this city, and I ask that you put our health and the safety first by voting no on this plan. Thank you.
Thank you. Our next speaker is Katie Fernandez. Is Katie Fernandez here? All right, our last group of speakers, we have Tamara Reed. Will please get on the line, Tamara Reed, then Corinthia Riggs, Horace Clouden, and Chakia Robbins. Is Tamara Reed here? Okay, Corinthia Riggs.
I'm here.
Yes, go ahead, you can start, thank you.
Thank you, everyone. My name is Corinthia Riggs, and I'm a very concerned parent of Randolph Vocational Technical School and alumni of Manspon Vocational School. So because of the schools, our students should not be subject to the same rules as normal traditional high schools. Having CTEs are good for the economy and the students to become respectable and hardworking citizens. Our 10th to 12th grade students work as hard in their shops. If you take them away, it's unfair to them and their future. These children are our future firefighters, beauticians, mechanics, business owners, and even board members. So we must consider not taking these things away from them, knowing that they need to have virtual school right now at this moment. We also have children with cancer, sickle cell, MS, lupus, and disabilities. You are not giving them much of an option to think about their health versus you want them to go inside of a building, and for what? They already have an illness and you want to put them in harm's way. The students have some type of illness and the virus would cause more problems for them and the parents. Sometimes we have to be in the hospital for our children for at least a week to make sure they are okay. Everyone should be held accountable to make sure the students are safe and still have their education. Putting their health on the line is careless and disrespectful. A building is not more important than their health and including your teacher's health. If all the high school students be able to have virtual school at their school, they'll be able to attend for the school year. The teachers, the parents, the principals, and everyone involved must make sure everyone is equipped and have everything access for them to be accountable. Parents must make sure that their children would do the work every single day, but we also have to make sure the staff is taken care of as well. I know I only mentioned a few concerns that we should start off with. We must work together for the best solutions for our children and staff. Putting these individuals in danger, unhealthy circumstances is not the best thing at this moment, especially since we have not hit the second wave of the virus. So why put people in the building knowing we are going to have the same problem again in the fall season? So like they did in the 34th quarter of the school year. Yes, it's a big adjustment and a learning process for students, staff, and parents. We all must come together to make this work for everyone. Thank you, and I appreciate your consideration in this serious manner. Have a blessed night.
Thank you. Horace Clouden. Is Horace Clouden here? Okay, Shakia Robbins. Do we have Shakia Robbins connecting? Okay, that is our last speaker. I do have one announcement. Michael Burke emailed the board to state an objection. He actually wished to make an oral statement, but he was not registered. And he sent 2 emails to the board raising an objection to the Board of Education's conduct of the meeting, and they were sent at 11:07 p.m. and 11:11 p.m. And Madam President, we are done with the speakers. Thank you.
Thank you, Ms. Rauch. Before we move on to our next part of the meeting, I want to indicate that there have been specific references made by students regarding racist actions that were raised at the beginning of the meeting. These will be followed up on. We take all such allegations seriously. At this point, I'd like to call on Dr. Height.
Thank you, Madam President. And yeah, there were specific actions, specific incidents that students raised that we have noted and will follow up on. In addition, I support all of what they were recommending in terms of students being a part of faculty selection and their voices, particularly on the racial injustices and all of the other issues. So I think that our students who spoke this evening gave bold statements about how we need to rethink our processes and policies and procedures and systems as it relates to particularly the special admission process and other processes that give students access. For the general public, I think that I want to thank all of the speakers, and I want to thank the members of the board this evening, and want to make a couple of statements and in response to a lot of the things that we heard this evening. And I think one thing that is really important for individuals to know, and so thinking what was the rationale behind the plan that we recommended, the rationale was simply, we were trying to respond to the requests of individuals who were part of the 36,000 individuals who responded to the surveys. In those survey responses, and I know that was a month or so ago when data was different, but in those surveys, individuals talked about the opportunity to explore a hybrid plan and the option to go completely virtual. And I want our listening community to understand that's what, as a district, we were attempting to do. And I get that people don't like the model that we actually recommended. I get that individuals think that perhaps that wasn't what we should have done. And I appreciate that. But I would request from the board that we take some time to review before acting on the recommendations that we had this evening before you. I would ask the board that you allow us as the administration to take some time to consider all the comments that we heard this evening and come back with a plan that I think will be more consistent with what individuals are requesting and what individuals may feel more comfortable with. And I do think that several things are important. We have to constantly think about what is happening with our most vulnerable young people. We have to think about what about our essential workers and what are opportunities for them to actually make sure their children are safe if in fact they must report to work. And then how do we think about our most vulnerable and complex needs children and what are the criteria for those things? And so I want to ask the board for consideration of postponing any action on the agenda items tonight and pushing that out to next week so that it gives us some time as a district to then consider all of the things that we heard this evening and then come back to the board with a set of recommendations or amendments to what was suggested this evening.
So Madam President, if I may.
Yes.
I'd like to make a motion to table item number 15 until next week.
I believe Dr. Hyde is asking that we recess the meeting at this point. Dr. Hyde, if I'm hearing you correctly, you want to have all the action items considered at a later point?
That's correct. I mean, I don't think there are any pressing action items to this evening that we could not take care of next week.
Okay.
In the event that we can meet next week to continue this meeting. But that gives us enough time to actually talk about all of the things that we've heard this evening. And as I indicated before, when you have students and families and staff members who have been on the front lines of these issues since March 13th, I think that is really important to take these things into consideration and come back with a recommendation based on all of those considerations.
Madam President, can I ask a clarifying question really quickly to Dr. Hyde's statement? When you say it gives us time to talk, when it gives us time to talk about, my understanding is that you're saying it gives your administration time to talk about taking the input you heard tonight, but the discussion of the board will be public deliberation next Thursday, correct?
Correct. That's correct.
Correct. Yeah. So it's your administration that will be talking about it.
It's my administration, not the board and me, right? So it gives us an opportunity to make some revisions and amendments based on all that we heard from the testimony this evening.
So then what we're doing, Madam President, is
motion to recess.
Motion to recess.
Correct.
Until I think it's what, July 30th at 4. Is that correct?
May I?
Wait, she's making a motion. We'll take a second on that motion and then we'll entertain comments and questions.
Okay.
Your motion is a motion
Yes.
to recess the meeting to Thursday, July 30th at 4 p.m.
Yes.
Is there a second?
I'll second.
It's been moved and appropriately seconded. Are there any questions or comments? And Ms. McIver, Dr. McIver?
I do. I have a very strong comments about the fact that we just spent 6 hours hearing near unanimous requests that we do remote learning for starting. And I do have a statement that I'd like to make. And I think that it is a horrible move for us to make people sit through that many comments and then choose not to have a conversation and move to next week. But I'd like to read my statement first.
Fine.
So, this past school year, the Board of Education engaged in debate regarding school vaccinations. As a board, we believe the threat was so great to our school community that we banned children from attending school if they were not vaccinated. However, today, we are actively considering a plan to reopen schools with the deadly virus spreading unchecked in this country. We are actively considering a plan to reopen schools even though the tools necessary to monitor and slow the spread of this virus are not readily available, as widespread testing and contact tracing are non-existent. We are actively considering a plan to reopen schools in a city where 70,000 children take public transportation to school every day, where social distancing is impossible. We are actively considering a plan to reopen schools even though the average age of our teaching staff puts them at high risk of severe illness and death. This is not hyperbole. On the last day New York City public schools were open, there were only 620. This included 28 paraprofessionals, 30 teachers, 2 food service staffers, 2 administrators, 2 facility staff, 2 school aides, 2 guidance counselors, 1 parent coordinator, and 1 school computer technology specialist. We are also asking parents to send their children to schools amid a pandemic by repeating a narrative that children suffer less from this virus. However, we should consider 2 studies published in the New England Journal of Medicine on June 29th that highlight the devastating nature of this virus in children. The studies describe nearly 300 children in the Northeast who developed severe inflammation affecting multiple organ systems after having had COVID-19. The majority of these children were previously healthy. In one of the studies led by researchers at Boston Children's Hospital, 80% of the children who developed the condition required intensive care, 20% required mechanical ventilation, and 4 children died. In the second study from researchers from New York State, a similar percentage of children required ICU care and 2 children died.
The potential impact of coronavirus on school district children and staff is far more severe than the viruses from which we currently ban children under our vaccination policy. Finally, we know that the best predictor of future performance is past performance, and the school district does not have a good track record of managing and implementing such large-scale logistics. We did not do a good job delivering clean, healthy schools to children of Philadelphia before the pandemic. How can we realistically think that we are prepared to deliver safe schools now? Earlier this evening, Helen Gim asked us to treat the speakers as experts, and the experts have spoken. Board members, at no other time in our tenure has locally controlled meant more than it does tonight. We just witnessed 6 straight hours of near unanimous calls to open schools with virtual learning. I urge the board to reject this reopening plan, and I move that we vote tonight for the school district to open schools this fall with 100% virtual instruction with teachers from students' home schools. We cannot afford to lose another day of the planning time needed to prepare engaging, robust virtual learning for their students. That's my statement.
Moved and properly seconded. Are there any other comments from board members? It's been moved and properly seconded that the meeting be recessed until Thursday, July 30th at 4 p.m.
Sorry.
What about, I made a motion that we vote, so how does that work?
Because we already are in a motion, that's the problem.
I'll call, we have a parliamentarian. You want to speak on that?
I had an item to a question to ask as part of the discussion before we.
Yeah, I think we have a couple hands up actually.
Oh, I'm sorry, I didn't see the hands. Mr. Wong. And
I just wanted to clarify that the clock is ticking in another way in that we owe the Commonwealth a health and safety plan. So I just want to reconcile the due date of that with the postponement of our voting on this particular plan before us.
Dr. Haidt, if I'm not mistaken, when the Commonwealth initially proposed that there be a health and safety plan approved by the board of each district, there was a July 30th deadline. I believe that deadline no longer exists. Am I correct about that?
That is correct, Madam President. That deadline was eliminated as school districts are still deciding on the approach that they may take.
Does that answer your question?
Yes, thank you. I did not know that. Thank you.
The other deadline question that I have is in regard to the deadline for parents to opt into all virtual, the Digital Academy. Will that be affected, or will we continue with the August 4th deadline, and should parents continue to make that decision? And as we continue to think about continuing extending the date to take this vote and continuing to plan and tweak the plan, I think we do need to explore all our options, be prepared for every scenario. And one of the scenarios I'd like to see us be more prepared for, as Dr. McIver just said, is the virtual option, making sure that we're equally prepared for that as well as for a hybrid plan, depending on where the numbers go, so that we can seamlessly transition between the opening plans, depending on the numbers and what things are looking like.
Yeah, Dr. McCogan, I think that still gives us the opportunity to collect data on who is choosing what form. And it would be very easily if, in fact, we, for instance, chose to go a complete virtual route, that those individuals who've already signed up would then just be assigned to individuals at their schools, if in fact that was the way we wanted to move.
Matt, sorry. Go. May I? I think that part of the reason for me, in terms of even putting in a motion to even set aside or to allow the district to look at what it is that they've submitted, has more to do for me. I'm not just minimizing anything that you said, Board Member McIver. I think it's important what you said, but I think that I want to weigh out both, again, both possibilities and what the impact is going to be. I'm not prepared tonight to say yay or nay to either or. And I recognize that there are a lot of risk either way.
Ms. Fix-Lopez, I believe you were next.
Yeah, I want to say, Dr. McIver, I'm 100% with you, but I also, with what Vice President Hinton is saying, one of the things that I want to see is even if it were to be 100%, what is 100%? Is it going to be everybody, or are these ideas of students with complex needs? Would they have opportunity to be in person? Are there going to be pockets of students? And so that's why, for me, I would like to give a week to see what that means for different populations of students. But I did want to ask one clarifying question, going back to what Dr. McColgan asked, because I don't know if I understood that answer, Dr. Height. Where I get very confused is we're still asking parents to opt into something that they really don't understand what it is. And I don't think that I haven't heard a clear definition. I am not very sure what I'd be opting into if I were a parent. And so I think that that's where maybe, even though you can get some data from it that helps you, I don't know if it's going to be valid because people are afraid to make a choice because they don't know what it is. So any way that we can immediately get, as much as possible, but it's a somewhat catch-22, I get it. But so that,
or suspend it and just collect the individuals who have already actually gave an indication that they want to move toward that. So we could do one or the other, and either one would allow those individuals who've already selected it to also just convert to the virtual, even if in fact the virtual is with the teachers from their school.
Mm-hmm. Okay, thank you.
Mr. Akbar?
Yeah, I am inclined to wholeheartedly agree with the sentiments of Dr. McIver. After we've spent and heard from testimony all day, the resounding sentiment from everybody that testified was very much around 100% virtual learning because of the ever moving target of moving in, and what if somebody was to get sick, and I am not willing to risk that. So if given a week, just want to make sure and get clarity that what Dr. Height, what you heard was very much, everyone on the call sort of saying 100% virtual, and make sure those discussions sort of lean in that way, or what that discussion looked like in your administration to consider that as a factor that you heard this evening.
Yeah, no, Board Member Akbar, that's what I heard. But I also heard individuals who talked about complex needs. I also heard individuals who talked about essential workers. Also heard individuals who talked about our most vulnerable children and whether or not schools could become places where those children could go that have internet access. And so I heard multiple things. And so just saying all virtual, I think would solve one problem, but then they've still left some other questions unanswered. And so I'd like to have some time to think through and to come up with some recommendations for the board to consider next week.
Ms. Danzy?
I agree that we do need to. I understand what you're saying, Dr. McIver, but I think more than anything, everyone who spoke tonight want us to try to get it right. Also, I heard when the PFT president spoke, he seemed to me to be speaking that if certain conditions were met, then their opposition would be a different thing altogether. And so a week would give us the ability to really assess thoroughly, could you really reasonably meet these conditions? Or indeed, is it better to go on? Not only that, it would give us a chance to look and see whether or not things are our tests are indicating more cases of COVID in our city, which would give us then definite reason to say, here is where we have to go. And so I think that I would hope that the public would appreciate that, because as we listen to the group tonight, there's also a bunch of parents out there who have said they wanted their kids in school. So we want to make sure when we make a vote, it is a vote that is based not just on emotions, but on data, on facts and on what is the best for the collective as a whole. And so I think that we are making a reasonable decision to concede to Dr. Height's request. And I'm curious about if it's not good enough, if we don't feel it's well enough for our healthy kids to go in, how could we possibly feel it's good enough for our children with special needs to be in? So yeah, I think we really have a lot of things we have to look at. And as Dr. Height said, you have one, if you go virtual, you resolve that. But then what do you do with our children and our English language children?
President Wilkerson, can I have 30 more seconds? What's 30 more seconds at this point, right? 30 more seconds. One of the things that I did hear tonight from a variety of speakers and even from Dr. Height is the need for partnership, right? And for us to say, we need help. We need to work together as a city. We need to work together, you know, as all different kinds of stakeholders. And one of the things that we know we're going to need regardless is internet access. So it's wonderful that our corporate partners are trying to help, but I just have to mark that what Comcast could do is what Dr. Height asked them to do, and they refused, which is open the residential Wi-Fi hotspots for free to our young people. So the $330,000 in in-kind services in Action Item 26 for Ernst & Young is great, but Comcast shouldn't get us consulting. They should get every student online access immediately for free. And that is going to be something huge for us, in particular this next week, because that is a big issue. So I just want to put that out there, that partnership is really important. Comcast is such a valuable partner, but we have to figure out the internet problem for the young people of Philadelphia and Philadelphia at large.
Are there any other comments or questions from board members? It's been moved and properly seconded that this meeting be recessed until Thursday, January 30th at 4 o'clock. Do you want to pursue your motion, Dr. McIver? I can have our lawyer opine on the procedural matter.
I think the motion I think it was in opposition to this motion, so that the board would then vote on action item 15. So I don't think that there's actually a separate motion.
So I had an objection to the postponement or the move to adjourn. I believe we should vote on the reopening plan. We've had we've had town halls, we've had meetings, we had 6 hours of it, so I believe we should work on it. And I also introduced a motion.
Raise that. It's a procedural issue at this point. It's been moved and seconded that the meeting be recessed. You then interposed a motion to vote on the item 15. And I just need clarity, if you want to pursue that, clarification about the procedural.
Yes, I believe that the motion to vote on action item 15 is effectively a motion, is effectively a vote against the motion to recess that impact. So I believe that that it's not a subsidiary motion that we need to vote, the board needs to vote on separately. So I believe that the board should proceed, since we've had a motion and a second and time for comments, to vote on the motion to recess till Thursday at 4 o'clock, next Thursday, the 30th at 4 o'clock. If that fails, then we would proceed with the other part of the meeting.
It's been moved and properly seconded. Call for the vote, please.
Yes, thank you. On the motion to recess, Mr. Akbar?
Yes.
Ms. Danzy?
Yes.
Vice President Haya Hinton?
Yes.
Ms. Fix Lopez?
Yes.
Mr. Huang?
No.
Dr. McColgan?
Yes.
Dr. McIver?
No.
Vice President Walker?
He's resigned.
I'm sorry. I'm so used to it. I apologize. President Wilkerson?
Yes.
Old habits die hard. President Wilkerson, you said yes?
Yes.
Okay, thank you. The motion to recess the meeting until July 30th at 4 o'clock passes by a vote of 6 in favor and 2 opposed. So the meeting will be recessed until next Thursday at 4.
Thank you. Want to thank all the speakers this evening. Want to thank board members. It's been a challenging week, and we'll reconvene then next week at 4 o'clock on Thursday. The meeting is adjourned. Oh,
The meeting is not adjourned. The meeting is recessed.
Sorry, it's late. Thank you.
It's okay. I called Vice President Walker, so thank you. I will announce just for the record that the meeting will be, the Zoom will be turned off as the meeting moves into recess. Thank you.
Are we still meeting?